11. It says, now the angel of the Lord came and sat under the terebinth tree, which was in Oprah, which belonged to Joash the Abizarite, while his son Gideon threshed wheat in the winepress in order to hide it from the Midianites. And the angel of the Lord appeared to him and said to him, the Lord is with you, you mighty man, valor. Now, what's interesting about this story is that Gideon was actually a part of an oppressed people. He was in hiding, and by all accounts, he had a low self-esteem and he didn't expect much of himself. But yet, the angel comes to him and says, you mighty man of valor. Now, what's interesting about this story is it gives us an indication of how God views us versus how we view ourselves. So sometimes you have to figure out what is the right language. By that I mean, sometimes in life what we do is we speak the language of our circumstance as opposed to our desire. I was talking to a young man the other day, and he said to me, he said, Pastor Dave, I was asking him how he's doing. He said, Pastor Dave, you know jobs in the Bahamas? I said, I want you to think about that statement. I said, I'm not sure if that's the right language. Because first of all, you are pronouncing that there are no jobs, but that's not what you mean. It means, I was telling him, I said, you mean you haven't found a job and there are less jobs than before. But sometimes if we speak the language of our circumstances, our outlook can become gloomier than it is. So sometimes if we take an example from the scripture, we have to speak things that we don't see. We have to speak desired outcome instead of our circumstances. Sometimes we have to speak a language that does not make sense to the physical eye, because the Bible says we walk by faith and not by sight. So if you walk by faith, it means you speak things that do not appear yet. And so I just want to encourage all of us to remember to speak the right language. If you speak the wrong language, your problems grow. If you speak the wrong language, things become worse than they appear, and it causes a paralysis. So it's important to speak not your circumstances, but to speak your desired outcome. And if we do that, it will help us to see better, it will help us to have a better perspective, and it would encourage us and motivate us to take action, as opposed to the opposite way. When you speak your problems, then you tend to retract from addressing them. So I want to encourage you today to speak the right language. Amen? Amen. Let's bow our heads together. Father God, we just thank you for this day once again, where we have come to deliberate on important matters for the country. We thank you for your guidance, your wisdom, your direction as we proceed today. And we pray that everything would be done decently and in order, and that we would, at the end of the day, put the business of the people as priority. And we thank you for these things. We thank you, and we say, God bless the Bahamas. In Jesus' name, amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Thine is the kingdom, power, and glory, forever and ever. Amen.
Brent Simonet, Desmond Bannister, Glenwood Wells, Jeffrey Lloyd, Dr. Greenstein, Marvin Dane, Frankie Campbell, Ezekiel Diagula, Michael Tintard, Darren Henfield, Lamal Ferreira, Tanisha Rule, Ranjul Rule, Ellsworth Johnson, Philip Davis, Vaughn Miller, Ofisha Parker Edson, Aaron Lewis, Carlton Bolag, James Albrecht, Travis Robinson, Adrian Gibson, Donald Saunders, Frederick McAlpine, Hank Johnson, Mark Hume, Michael Cook, Miriam Reckley Emmanuel, Ruth Shipman, Ruben Ramming, Ricky Mackey, Shannon Dawn Cartwright, Chanel Ferguson, Gladys Hannah Martin, Faisal Ford, Jeff Tapuki.
Good afternoon, honorable members. Introduction and swearing in of new members. Laying of documents by ministers. Statements and communications by ministers. Communications by the clerk. Messages from the Governor General. Messages from the Senate. Motion for leave of absence, leave to resign seat, and new writs. Presentations of petitions. Presentation of reports of committees. Adoption of reports of committees. First reading of bills. Second reading and committal of bills. Committee of the whole House. Third reading and passing of bills. Consideration of Senate amendments. Resolutions. The chair recognizes the honorable member for Kalani.
Thank you very much, Mr. Speaker. Speaker, before I start, don't start the clock yet. I listened to a very interesting Darrell Miller show where he had a poll about who should be the Deputy Prime Minister. And I was shocked that even Michael Pine got 2 votes for Deputy Prime Minister. Well, you shouldn't have done that to me, though. Anyhow, Mr. Speaker, I rise to commence the debate, to move the extension of the resolution that was tabled yesterday to the 31st of January. Mr. Speaker, in the Bahamas, the proclamation of emergency and Parliament's authorization of emergency powers grant the government of the day the legal authority to act to protect the Bahamian people. We are not here today to extend a curfew. We are not here to enforce a lockdown. We are not here, Mr. Speaker, to announce additional restrictions on any island. We are simply here to extend the period under which an emergency power exists. It is then up to government, guided by the advice of the public health team, to determine if restrictions are needed for a period of time in order to prevent sickness and death. And currently, for example, under this emergency period, there are many islands in the country where there are fewer restrictions, and this is because there are few to no viral cases. When cases and problems emerge, members of the public health team give us their recommendations as to what measures they suggest to slow the spread of this pandemic virus. When those measures succeed, we lift restrictions to allow Bahamians and residents to live a more normal life. And the measures we seek to extend today merely allows us to have the legal authority to act in case we need to use certain measures. This does not mean that all of these measures are being used at a given time. In the Bahamas, Mr. Speaker, we decided to extend our emergency measures for shorter periods than a number of other countries. And this allows us to keep assessing the current status of the pandemic and the need for such measures. Other countries extend their emergency measures for longer periods at a time. For example, Barbados has extended its state of emergency into March of next year, and each jurisdiction follows its own course. Speaker, the government needs these powers because of how quickly this virus continues to spread. One highly infectious individual could spread the virus in a closed room of 50 people to nearly every individual in that room. The infected people would then go home and spread the virus among their home environment, family members, and others who may be in that household. And they may then go outside and subsequently spread the virus to others. And Mr. Speaker, before we realize, the infection may start off like a tree, and soon it become a tree with many branches and leaves which represent the spread of the infection. One case could lead to an outbreak. Hundreds and hundreds of people could get sick and subsequently die. And our public health team, Mr. Speaker, is working extremely hard in monitoring the situation, collecting data, and advising us as to the way forward as to what should be done so as to minimize the spread of this infection and subsequently hospitalization and possibly death. When we see cases spike, we act quickly so that a small outbreak doesn't lead to a major outbreak. Again, I want to emphasize, we utilize these emergency powers only when necessary. And quite often, Mr. Speaker, a number of the emergency measures are not utilized. Example, there are no measures in islands like Inagua, Negona, Auckland, Crooked Island, and many others. When cases spike, governments do not have the liberty of a long period of time to act. We do not have weeks, Mr. Speaker, to act. Instead, governments must act quickly and decisively in order to avoid spread of this deadly virus. If a government waits too long to act, many more people may get sick, many more people may become hospitalized, and many more people may subsequently die. Questions have been asked and statements would have been made that we are not testing sufficient people, and that is why the numbers are falling. So, Speaker, I want to remind those who ask such questions that during the peak of the pandemic peak of our infection rate, many more individuals would have presented and met the protocol as was set out by World Health Organization, and thus a lot more testing would have been done, a lot more infections would have been picked up, and more individuals would have been hospitalized. Mr. Speaker, as a result of the control of the virus today, utilizing the same protocol that was used with the first wave and the second wave throughout, less individuals are now infected. Therefore, the number of tests would subsequently decrease. Hospitalization has decreased as demonstrated, and the number of individuals requiring hospitalization subsequently has decreased as is clearly demonstrated today. The Speaker, and of course, the Speaker, I also want to add that the tracing team numbers have also increased, and therefore, through the aggressive and decisive nature of the health team and the tracing component, they would have been able to trace the given number of individuals and subsequently place them in quarantine under some degree of observation, and subsequently decrease the possibility of those individuals exposing others within our society. Speaking, unlike some countries, their entire tracing mechanism had collapsed. That had not happened in the Bahamas, and I must thank our health professionals for the excellent job that they have done. Mr. Speaker, it is reasonable to debate what restrictions should be in place and what islands and for how long. But it is highly irresponsible, reckless, and unreasonable to suggest that we should not use emergency powers in the worst emergency in our country's modern history. The position the opposition has taken is baffling and disturbing. It appears that their rhetoric, that if they were in office, let me repeat, it appears from their rhetoric that if they were in office, they would not give themselves the power to act to save lives. And I am certain that a responsible opposition, had they been in power, regardless of the political rhetorics that are stated today, I'm certain that they would have taken the same course. At least they would have been advised by the same professionals that are advising us. And they would have had to make their own determination and decision as to which direction they would like to take. The last time we sought the approval of the House for emergency powers, the opposition did not remain in the House to vote on the resolution. In the Senate, the opposition opposed the life-saving measures. These were the very measures that helped to significantly reduce the number of cases in New Providence and in Abaco. And without these measures, which the opposition opposed, our numbers would have gotten much worse. Speaker, if you look around the world today, you'd see that many countries are being locked down, and some parts of Canada, Ontario, is being recommended to lock down until January. And this is happening throughout the world. So I must say, Mr. Speaker, the health professionals, I thought, had done a wonderful job, and the majority of Bahamian people would have cooperated and act responsibly, and that's why we're in such a remarkable, unique, and beautiful position today, as opposed to other countries. However, this is not the time for us to let our guards down, because if we do, then we can possibly encounter a third wave. I think I've always said that we possibly entered the second wave before most countries, and would seem reasonable that we should leave the second wave before most countries. Mr. Speaker, if the country followed the advice of the opposition, the Bahamas would be in the same dire straits as those places which opposed life-saving emergency measures. And Mr. Speaker, our policies in cooperation with the discipline of Bahamian people helped our country battle successfully, though through second wave of this virus. The emergency powers were key to this success. And the main authority in the powers is the ability to enforce physical distancing. This virus spreads when people are in close contact with each other. When viral cases go up, Mr. Speaker, it is necessary to cause more distancing between people to prevent infections. We do this by putting in place certain restrictive measures for a given time. By preventing mass gathering, we lessen the chance of the virus spreading. By having curfews, we limit human-to-human interactions to lessen the chance of the virus spreading. And you listen to some individuals, and they may argue that they don't understand why we would introduce curfew 9 p.m. to 5 a.m. as if the virus only comes out 9 p.m. to 5 a.m. That is not the case, Mr. Speaker. One has to take their cultural behavior into consideration. And that is the time when most of us are engaged in social gathering. And that's why those times are selected with our environment. In some countries, their social gathering may be maximum between the hours of 12 midday and 5 p.m. And therefore, those countries would introduce their curfew or restrictive component during that particular time. And they would take other functions into consideration so as to minimize those type of activities. For example, Joncanoe, which can act as hotspots and spread of virus. Independence celebration that we normally have, again, that could have possibly act, and therefore we acted appropriately. And even Remembrance Day service that we normally have, all of those factors had to be taken into consideration. Mr. Speaker, we are a small island developing nation. We have limited hospital space and a limited number of trained doctors and nurses. And we cannot, under any circumstances, allow the virus to run wild within our society because it can cause serious problems and have great repercussions. Doing so would lead to the collapse of our healthcare system, leading to extraordinary human suffering and subsequently death. It is unfortunate that some have offered commentary and taken positions on these emergency powers merely for political reasons. We did not, Mr. Speaker, have the luxury of saying things that might seem popular at the moment. We had to do the hard work to save lives. And that Mr. Speaker, is what we did. And that is what we will continue to do. We followed the medical advice. We were not afraid to act. We will not ponder and jeopardize the health of the Bahamian people. The Speaker, my government decided from the beginning of the crisis that keeping the Bahamian people safe was our main priority. Politics was not a consideration. Safety was, and saving lives were. Thankfully, Mr. Speaker, the measures we used worked to beat back the virus thus far. And I am certain that when the Minister of Health arrives, he would have a lot more data and information that I have, and he would be able to clearly demonstrate how the numbers, which were at one point up to 160 or more in any given day, is now, New Providence, is now less than 10. Consistent. So currently, Mr. Speaker, our country is in a better position than many places. We all must continue to follow the public health advice in order to keep our circumstance better. Mr. Speaker, despite the recent announcements of a number of vaccines, which will soon be deployed, it will take quite a number of months for vaccines to be readily available around the world and in the Bahamas. The United States and parts of Western Europe are likely to start frontline vaccinations next month, meaning December. We will work hard, aggressive, to ensure that we too may be able to obtain vaccines during that same month. And I want to repeat so that the Bahamian people would hear that once the vaccine is available, Mr. Speaker, I most certainly will be one in the first line, ready and available to obtain my vaccine shot. It will take some time, Mr. Speaker, for these vaccines to get to the developing world. In the meantime, because we are still in the middle of this deadly pandemic, we must continue to aggressively fight COVID-19. That is, we must continue to wear a mask. And some countries are now just making it mandatory than we had done so at such an early stage of this deadly virus. We must avoid social gathering, and we had clearly demonstrated that when we've made the bold decision to cancel many events that has become a part of the Bahamian society and that we love so much. And I want to, while on my feet, I want to thank all the Junkanoo personnel and the Junkanooers who were more than willing and cooperated with government to cancel all of their events through great sacrifice, knowing that that is the time when most of them would become employed and would have some form of economic stimulus, both for themselves and their family. But they understood what was at stake. They understood the danger that their country and others could have been placed in. And they made that great sacrifice, advising government that they would have no problem in canceling such great events. So I must thank the Junkanooers, Mr. Speaker. Mr. Speaker, we should remember that a pandemic is when an infectious disease is passing easily from person to person in many parts of the world at the same time. And this continues to be the case throughout the world. Tragically, in many regions of the world and in many countries, the current second wave is worse and more deadly than the first. And this second wave, Mr. Speaker, will last for some time and is occurring during winter and holiday seasons, where there is a considerable increase in travel. Mr. Speaker, it is essential that we have an international or global perspective. And such a broader perspective or world view enables us to appreciate that in the Bahamas, we are utilizing many of the same measures that are being used in other countries throughout the world. We are following the good example of other countries and jurisdictions in our emergency orders. These include curfews, physical distancing, mask wearing, and other public health restrictions used to protect our people. We also look to other countries to appreciate how the Bahamas is doing. Unfortunately, during our second wave, we did not have to put in place the most restrictive measures that are being put in place in many countries throughout the world. I wish to briefly note what is going on right now globally. The BBC reported on Tuesday, the 24th of this month, I quote, "The COVID-19 virus is surging in many regions and countries that had apparent success in suppressing initial outbreaks are also seeing infections rise again. The most recent figures show more than 500,000 new cases reported in 24 hours. North America is currently seeing the steepest rise in new cases. And the World Health Organization has warned that health workers and health systems are being pushed to the breaking point. The BBC also reported, Mr. Speaker, World Health Organization Director General Dr. Tedros said more cases of COVID-19 had been reported in the past 4 weeks than in the first 6 months of the pandemic. The World Health Organization Europe Director says there is light at the end of the tunnel, but it will be a tough 6 months. He said one person was dying from COVID-19 in Europe every 17 seconds. Mr. Speaker, within this broader international context, I wish to update the House on the status of the various islands in our pandemic response. And as I've said before, the Minister of Health, who has arrived, has much more updated information than I do. And I am certain the Minister of Health would be able to expand on that when he speaks. He would be able to outline how we have turned the curve and how well our islands and our nation is doing. As the House is aware, Mr. Speaker, tourism reopened at the beginning of November. I am advised by our health officials that because of the emergency public health measures, we took approximately 3 weeks ago, the cases on New Providence appear to be stabilizing. On Monday past, November 23rd, there were 29 new confirmed cases for COVID-19 in the country. Mr. Speaker, that means the Bahamas. I don't want people to believe that's New Providence. That's the Bahamas, the nation that extends off the coast of Cuba to off the coast of Florida, that covers 100,000 square miles of water. That's what I'm talking about. As of November 23rd, there are 11 individuals hospitalized on New Providence. 11. 121. To ensure that this trend continues, and out of an abundance of caution, we believe that the relaxation of measures at this time may be premature and may risk an increase in cases. As previously noted, Mr. Speaker, an increase in cases on Grand Bahama was attributed to an outbreak at an industrial site. This past Monday, there were 18 newly confirmed cases on Grand Bahama, and there are 8 COVID-19 hospitalizations. Health officials have advised that the restrictive measures currently in place on Grand Bahama should remain the same. Health officials have identified the need for more contact tracing resources on Grand Bahama. and will continue to closely monitor COVID-19 developments on that island. But I'm sure Mr. Mark Alpine, who's from Grand Bahama, when the Minister of Health speaks, he would give you great news. Grand Bahama is doing very well since then. The Ministry of Health will provide further details on Grand Bahama in the days ahead. Mr. Speaker, health officials report that the restrictive measures put in place for mainland Eleuthera on the 8th of November are working. We are no longer seeing a large number of cases in Eleuthera. On Monday past, no new confirmed cases were reported on Eleuthera. Within days of the restrictive measures being put in place, health officials were able to isolate all positive cases on Eleuthera and quarantine the contacts of those positive cases. The curve, Mr. Speaker, is starting to bend. Health education initiatives are working. A team from the Ministry of Health and Ricky and Hank, you all would want to hear this. A team from the Ministry of Health will travel to Eleuthera this coming Friday, meaning tomorrow, November 27th, to conduct a follow-up assessment of the COVID-19 situation. Restrictions will remain in place for the rest of this week, meaning that that team may report the continuous great news in Eleuthera, which means that Eleuthera can possibly be liberated as of Monday. So I ask all Eleutherans to continue the measures that were put in place as they are working, and the team would do an assessment and data collection, after which they would advise the government as to the way forward. Next week, Mr. Speaker, based on advice from health officials and their findings, I will announce whether Eleuthera has been truly liberated. I am happy to report that cases are down on mainland Exuma. On Monday past, there were 3 new confirmed cases, and health officials continue to closely monitor COVID-19 development on the island and will have more to say on Exuma soon. Exuma, I want to say to you, the member for Exuma, that I would be accompanying the member for Carmichael, the minister responsible for works, and several others who are going there to view the dock, I think the completion of a dock in Exuma, the Parliamentary, the work that this government is doing. And we would also visit the site responsible for the construction of the new road, paving the road in Exuma, so that in spite of the pandemic, Exuma's terrible, dilapidated road that was left in place will be repaired. Mr. Speaker, we are entering the holiday season, which is also the busy travel season. We are exactly a month away from Christmas. Health officials have monitored very closely the pattern of infections occurring in Bahamians, including from overseas travel by Bahamians and residents. And in this vein, Mr. Speaker, I invite us all to be careful and cautious in our travels and movements over the holiday season. I encourage Bahamians to be very vigilant this holiday season. I say, please follow the public health measures, including avoiding large social gatherings and wearing masks, no matter where you are in the world. If visiting with family or friends, not in your household, it is best to do so outdoors. If indoors, there should be good ventilation and proper physical distancing. And it is essential, Mr. Speaker, that you wear a mask at all times when with someone not in your household. Mr. Speaker, the COVID-19 pandemic is the worst public health emergency of the world in a century. More than 1.4 million people have already died. Hundreds of thousands of people get sick every day from this very infectious virus. A large number of countries and territories have invoked their state of emergency laws. And such laws were created for times like these. Such laws are part of the rule of law. We can now see the beginning of the end of this terrible pandemic. We are all tired of this pandemic, Mr. Speaker. The time is nearing when we will be able to be close and in contact with each other again. When we can see friends and family more regularly again. And when we can feel safer to travel again. Mr. Speaker, may I close by paying a brief tribute to Dr. Timothy McCartney, who passed away on Sunday in Florida. As I noted in my statement on Sunday, Tim McCartney was an exuberant, generous, kind-hearted man who excelled as a teacher and as a counselor. He was a deeply spiritual and creative individual who dedicated his life to the well-being and enrichment of his family, friends, students, clients, and colleagues. Dr. McCartney was a Bahamian pioneer and trailblazer in psychology. He made tremendous contributions to national life and to an understanding of mental health and well-being in the Bahamas. On behalf of the government and people of Bahamas, and on my own behalf and that of Patricia, I offer condolences to his wife, Pauline, his daughters, Angela and Lorraine, his siblings, Kwame, Major, William, and Clinton McCartney, and Cancino, in-laws, grandchildren, and great-grandchildren, and numerous friends, colleagues, and generations of students. May he rest in peace. Speaker, I also want to extend condolence to former Speaker, not just recent former, but a former Speaker, to Ingram, Oswald Ingram, who has passed away. I had the honor of meeting Mr. Ingram, and he was always very respectful, quiet individual, but who would humble individual, who would give you advice, regardless of whether you were PLP or FNN. I worked closely with his daughter-in-law, who was a nurse in Eleuthera, and she too went beyond the call of duty in terms of her nursing profession. If individuals were sick, regardless of time of day or night, she was always willing to assist. Regardless to the state of affairs of the health facilities, she always felt that health and life was always first. So again, I extend my condolence to the family of Mr. Ingram, and may he too rest in peace. Mr. Speaker, I vigorously support the extension of proclamation of emergency until January 31st, 2001. I continue to pray for God's guidance and discernment for our country and my government. And Mr. Speaker, I would just like to remind everyone that group exercise immediately, group exercise will be permitted in groups of 10 here in New Providence and Abaco. That can occur between 5 a.m. and 9 p.m. Monday through Friday, and 5 a.m. to 6 p.m. Saturdays and Sundays. that applies immediately, Mr. Speaker. You have the orders, the resolution. Here, Mr. Speaker,
This point.
may God continue to bless the Commonwealth of the Bahamas. May God continue to bless each and every one of you. Thank you, Mr. Speaker. At this time, I'd like to read the first paragraph and last paragraph of the resolution. The first paragraph, whereas pursuant to Article 29(1) of the Constitution, the Governor General may make a proclamation of emergency declaring that a state of public emergency for the purposes of that article exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation of emergency made on the 24th day of November 2020 until the 31st day of January 2021. Affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Risk Management Regulations 2020 made on the 24th day of November 2020 until the 31st day of January 2021. Affirms the continuance and effect of the Emergency Powers COVID-19 Pandemic Risk Management Order 2020, made on the 24th day of November 2020 until the 31st day of January 2021. And D, affirms the continuance and effect of Emergency Powers COVID-19 Pandemic Risk Management Special Provisions Order 2020, made on the 24th day of November 2020 until the 31st day of January 2021. Mr. Speaker, anyone remind the Leader of the Opposition, during the last resolution, the leader said that we should follow the course of Barbados. And the following day, the Barbados Prime Minister announced that they were extending the emergency orders until the end of March next year. So, do you still want us to follow Barbados? Mr. Speaker, thank you very much.
Thank you, honorable members. Is there a second, though? The chair recognizes the honorable member for Bamboo Town.
Thank you, Mr. Speaker. Mr. Speaker, at these points in time, I remember what the prophet Amos said. God said to him, he said, I have shown you, O man, what is good. And what does the Lord require of you? That you do justice, love mercy, and walk humbly with your God. He goes on further in the Lord to say that today, Bahamas, we, in this administration, consistently put before you life and death, blessings and cursing. But as the good Lord always put choices before us, and he never leaves us without the answer. He tells us to choose life, that we and our children may live. And Mr. Speaker, that is what this administration has done, time in and time out. Mr. Speaker, it's always difficult to follow the Prime Minister after such a substantive contribution on health. But Mr. Speaker, COVID-19 has proven itself a menace since its emergence almost 1 year ago. This strain of the coronavirus has proven to be more infectious, Mr. Speaker, and deadlier than any other in its class. It has moved across the globe via human behaviors previously inculcated and subconscious, such as hugs, shaking hands, and touching doorknobs, to name a few. We have seen played in the Bahamas and indeed other countries worldwide, one contagious person potentially infecting healthy persons in the double and triple digits. Scientific literature spells this out in graphic terms. Specifically, an infected person can potentially spread the virus to approximately 3 persons per day. These individuals, without mitigation measures, can contribute to further spread of the virus. The ripple effect, Mr. Speaker, is then one infected person can mushroom to 406 infected persons rather rapidly. Mr. Speaker, COVID-19 has undoubtedly wreaked havoc on economies and has disrupted social norms. As the pandemic drags on, job losses and shifts in public behavior have become evident worldwide, and the Bahamas has not been on since March 15th, 2020. Mr. Speaker, the first wave of COVID-19 epidemic in the Bahamas is bookmarked between mid-March to late June 2020. The second wave commenced on July 8, 2020, and has been prolonged. Our second wave, COVID-19, has claimed more lives prematurely, has laid bare vulnerabilities of our health system, and has seen a shift in the age distribution of cases towards younger persons aged 50 years and less. Notwithstanding this, COVID-19 requires the willingness to learn and pivot to ensure responsiveness to our current realities. My ministry, Mr. Speaker, and the government of the Bahamas did just that. And today, the nation is reaping the fruits of declining trends in all of our monitoring indicators. For the past 7 days, Mr. Speaker, there have been fewer than 30 new cases each day. Mr. Speaker, on the 24th of November, Tuesday, we had 9 cases. Yesterday, Mr. Speaker, we had 8 cases. And Mr. Speaker, this brought the total number of confirmed cases in the Bahamas to some 7,482. Total COVID-19 hospitalizations, Mr. Speaker, are also on a downward trend and now stands, I know the Prime Minister said that there was 11, but there's 10. There's 10 at PMH. We have less than 10 for the first time at PMH. Throughout the country, we have 19 in total, Mr. Speaker. Down, as the Prime Minister would have said, from our national high on October 22nd of 122 hospitalized cases in country, we are down now to simply 19 cases throughout the archipelago. There are 7 COVID-19 patients hospitalized in Grand Bahama Healthcare System. All of those patients, Mr. Speaker, are moderately ill, and at this time, there are no patients in the intensive care unit or ICU at the Rand Memorial Hospital. In New Providence, Mr. Speaker, there are 4 hospitalized COVID-19 patients at Doctors Hospital. 3 are moderately ill, Doctors Hospital West, and 1 is in ICU. There are currently no COVID-19 patients being treated at the South Beach Acute Care and Referral Center. At the Princess Margaret Hospital, there are 8 moderately ill patients with COVID-19, and there are no patients at this time in the ICU at PMH. Mr. Speaker, that is a remarkable success considering where we were very shortly. Mr. Speaker, active cases are also trending down. There are 1,475 active cases in the country. 56 persons were added to our cumulative recovery, bringing the total of recovered cases to 5,789 for a recovery rate of 77.4% in the country. Mr. Speaker, we have had no new COVID-19 deaths since the 19th of November 2020. The total number of confirmed COVID-19 deaths have remained at 163 for the past 10 days. This, Mr. Speaker, is welcome news, as one COVID death is one too many. Mr. Speaker, a total of 42,458 RT-PCR tests have been carried out for COVID-19. The average positivity rate over the past week, this EPI week, was 8.6%. Down, Mr. Speaker, from an average in October and early November of 17%. Mr. Speaker, at one point in time, one day we were up around 32% for our positivity rate. And the Bahamian people should know that WHO would like to see a positivity rate below 5%. And on Tuesday and yesterday, our positivity rates were below 5%. Mr. Speaker, our collective efforts are flattening the COVID-19 curve. The change in trajectory did not come by chance. I want to say that again, Mr. Speaker. Our collective efforts are flattening the COVID-19 curve. The change in trajectory did not come by chance. Paul J. Mayer, the pioneer of self-improvement industry, reveals productivity is never an accident. It is always the result of a commitment to excellence, intelligent planning, and focused effort. This is exactly what the Minnis administration has done, Mr. Speaker. The government capitulated, catapulted into action early on, with focused planning and preparedness to wage war on the silent enemy should it invade our shores. Did we hit some bumps along the way? Most certainly, Mr. Speaker, but the road to recovery is never smooth, and be wary of those who purport that it is. I assure the Bahamian people that COVID-19 is not our first rodeo with preparing for and responding to public health measures. The Ministry of Health has built on previous experience with SARS, cholera, H1N1, influenza, chikungunya, and Ebola. These local experiences and lessons have been boasted by international best practices from international health authorities, such as the World Health Organization, the Pan-American Health Organization, the Caribbean Public Health Agency, CARPA, and the Centers for Disease Control and Prevention, the CDC. Mr. Speaker, ain't God good? Ain't God good? Mr. Speaker, that we have in our current Prime Minister a Minister of Health over 5 years who would have dealt with some of these pathogens between 2007 and 2012. And unbeknownst to us, Mr. Speaker, but you see the Lord of time and space, the Lord God Almighty, whose name is forever, knew that we would be in this place, Mr. Speaker. And as a result of that, Mr. Speaker, we now have at the helm of this nation an individual who's experienced in having dealt with these kinds of pathogens. And Mr. Speaker, as I always say in this place, it is not by chance, because I firmly believe that we have come to the kingdom for such a time as this. Mr. Speaker, there was a concerted effort to intently focus on 4 major areas. Led by the Prime Minister, those areas was managing the Bahamian borders, effectively communicating with all stakeholders, developing COVID-19 guiding policies, and preparing our health agencies to rapidly respond to the coronavirus. Mr. Speaker, our borders constituted the first line of defense to the introduction of public health and other threats, which come along with trade and travel. To mitigate against the pending threat, there were enhanced border control measures to decrease the risk of the introduction of the novel coronavirus, along with quarantine measures and monitoring. Educational sessions, Mr. Speaker, for customs and immigration officers stationed at LPIA and other ports of entry on the possible effects of the coronavirus and how to prevent contracting the same while experiencing and dealing with others. Effective communication by health with key stakeholder groups alleviated initial fears and concerns. Mr. Speaker, we hosted meetings with healthcare providers from public and private sectors, inclusive of doctors, nurses, allied health workers, and support staff to discuss the importance of health facility plans and emphasize isolation procedures and other protocols. Mr. Speaker, meetings to update government agencies on current activities associated with 2019 nCoV, resolve reported loopholes, and to encourage smooth and effective communications were undertaken. Mr. Speaker, developing a COVID-19 preparedness and response plan required a whole of government, a whole of society approach, which was led by the Honorable Prime Minister. The COVID-19 task force was established at the Office of the Prime Minister, and a COVID-19 multi-sectorial task force was instituted at the Ministry of Health. The National Coordination Committee and other ad hoc committees bolstered our national response. They say, Mr. Speaker, success is where preparation and opportunity meet. And Mr. Miguel Cervantes once said, to be prepared, Mr. Speaker, is half the victory. Mr. Speaker, the government has developed countless policies and protocols to stop the chain of transmission in the Bahamas. The Ministry of Health's most effective tools were the implementation of those preventative measures in our society. The general public was continuously reminded to wear a face mask when leaving home, maintaining a physical distance of 6 feet from others, wash hands often with soap and water for at least 20 seconds, and if soap and water were not available, use an alcohol-based hand sanitizer with at least 70% alcohol, cover coughs and sneeze with the inner elbow or with tissue, and clean and disinfect frequently touched surfaces such as phones, remote controls, counters, doorknobs, keyboards, and the like. Mr. Speaker, I was privileged to chair the 39th session of COSAD for the health ministers in the CARICOM region. As a matter of fact, Mr. Speaker, I just got done with that COSAD meeting. That's why I was a little bit late. The COSAD meeting ended at about 2:30, and there was some cleanup that needed to have been done, Mr. Speaker, in regards to just my presentation here. So I was a little bit late to this Parliament, Mr. Speaker, but we had the COSAD meeting from 9 o'clock this morning until 2:30, Mr. Speaker, where we were dealing with issues in the region in regards to health and COVID-19. The COVID-19, Mr. Speaker, vaccine and the COVAX initiative featured prominent on the agenda of COSAD. The global community is encouraged by the strides made in the development of an efficacious and effective COVID-19 vaccine. The studies indicated that between 50% to 80% of any population would need to be vaccinated to confer herd immunity on the population and to interrupt the spread of COVID-19. Mr. Speaker, we know two things. One, the global availability of pre-qualified COVID-19 vaccines are likely forecast for the second quarter of 2021. And two, eliminating all human contact is not realistic. Therefore, Mr. Speaker, essential lockdowns and well-timed curfews played an important role in the successful break in the transmission of the virus in the Bahamas on one and on other occasions. Mr. Speaker, the Prime Minister of Singapore is such a firm believer in the need to break the circuit of transmission, an engineering term, by the way, Mr. Speaker. The Minister of Health of Singapore is an electrical engineer who came up with the term circuit breaker that is now being used worldwide in regards to the transmission of COVID-19. Mr. Speaker, the Prime Minister of Singapore refers to this action as breaking the circuit of transmission. He refers to lockdowns as circuit breakers. And while it is true that the entire Bahamas only experienced one complete lockdown in April 2020, other islands such as Grand Bahama and Bimini experienced lockdown for some 2 weeks to control the spread of the virus on those islands. Controlled weekend and 24-hour weekend curfews have been most effective on the islands of Eleuthera, Exuma, Abaco, and New Providence to bring the overall transmission down. In other words, flattening the curve, reducing infections, and avoiding overwhelming and helping us to avoid overwhelming our treasured healthcare system. The main and most effective policy, Mr. Speaker, was the legal requirement for all Bahamians to wear a mask. Even when societal distancing and social distancing and physical distancing, Mr. Speaker, was a challenge, wearing a mask prevents the spread. Mr. Speaker, my mask protects you, and your mask, Mr. Speaker, protects me. Mr. Speaker, testing policies were also established. These were essential pieces in charting our in-country strategy. At the beginning of the first wave of COVID-19 in the Bahamas, there were real constraints to upscaling molecular testing. This was simple because we had a limited supply of test kits, swabs, and human resources in our national reference laboratory. Today, the gold standard, the RT-PCR test, is available across multiple sites, both public and private, guided by our national policies. Mr. Speaker, capacities for RT-PCR testing have expanded from the National Reference Lab alone to PMH and on the islands of Grand Bahama and Exuma. Mr. Speaker, an RNA extractor machine, as I would have mentioned previously in this place, was purchased to reduce test processing time, and additional persons were onboarded at the National Reference Laboratory to process tests more readily. I'm going down through the plan, Mr. Speaker, as to how we got to where we are. Currently, Mr. Speaker, we are running a controlled saliva pilot test in paralleling with the test using the nose and throat swabs. We expect confirmation very soon to whether we will be able to incorporate the saliva test going forward. Recall, Mr. Speaker, that the Ministry of Health has incorporated the rapid antigen test, the RAP, as they call it, as a surveillance modality for COVID-19 with the requisite reporting framework to the National Surveillance Unit. We have the protocol, member for Cat Island. Mr. Speaker, contact tracing, the backbone of successful containment of an outbreak, has been greatly expanded over 5 islands in the last 2 months. In October 2020, there were some 80 additional persons trained as contact tracers to assist in the vital task of identifying, contacting, and conducting further follow-up of contacts of confirmed cases. This included 10 civil servants, 10 persons from the Ministry of Tourism, and 60 employees of Bahamas Air. These additional bring the total pool of contact tracers to 111 in country. And Mr. Speaker, just a note, the WHO requirement in normal times is that you should have about 15 contact tracers for every 100,000 person that you have in country. Mr. Speaker, we have nearly twice that amount. They're required for the WHO. Mr. Speaker, data monitoring teams are working closely with cooperative partners to improve data overflows for greater efficiency, accuracy, and timelines of our data. Mr. Speaker, to streamline our COVID-19 efforts, our 511 number was also reestablished. Let me say that again for the Bahamian people. To streamline our COVID-19 efforts, you can call our 511 number, which was reestablished. This number acts as the central portal for your COVID-19 questions, queries, and reports. Calling 511 gives access to contact tracers and medical personnel. It also provides information and answers queries about work and travel protocols. Mr. Speaker, those who violate the public health measures, the emergency orders, or who engage in large gatherings can be and is being reported using the 511 number. Mr. Speaker, there was much laborious work involved to bring our healthcare facilities up to par to accommodate the patients who needed hospitalization during the first and second wave of COVID-19. Existing infrastructure at South Beach Acute Care and Referral Center, the Princess Margaret and Rand Memorial Hospitals had to be retrofitted to accommodate negative pressure rooms, Mr. Speaker. And I was happy to lend my support in some of the design work that was needed. That was my former profession. Plans are already in place, Mr. Speaker, to create negative pressure rooms at Elizabeth Estates Clinic, the clinics in the Family Islands, and any other government facilities where persons under investigation for COVID-19 would have to sit and be assessed for the virus. Mr. Speaker, ventilators, so important in this fight, were purchased. And Mr. Speaker, our national total, we have increased the total inventory on ventilators. Our capacity now stands at 90 ventilators. And at the beginning, Mr. Speaker, I believe we had about 15 ventilators in the country. 70, Mr. Speaker, functional ventilators are at Princess Margaret Hospital. 70. 4 of these, Mr. Speaker, were deployed to Doctors Hospital West. 15, Mr. Speaker, for Pine Ridge. 15 is at the Rand Memorial Hospital in Grand Bahama. And there are 3 at South Beach Healthcare Center. As more persons contracted COVID-19, Mr. Speaker, in the second wave, we all know that hospitalizations escalated. The government had to act swiftly to increase its bed capacity, Mr. Speaker, to meet the health needs of our people in country. It is noteworthy to mention, Mr. Speaker, that New Providence always had bed space for the Family Island transfers. We always kept a few of those hospital beds available, as our national plan was to evacuate those from the Family Island to New Providence, those who were critically ill. And so we always kept bed space available for them here in New Providence for that transfer via air ambulance. Mr. Speaker, however, during the second wave of COVID-19, the Bahamas had to seek outside assistance from Samaritan's Purse to meet the bed capacity needs. And currently, Mr. Speaker, on record, the bed space capacity to respond to COVID-19 in the Bahamas is as follows. In Grand Bahama, we have 16 beds at the Cancer Association of the Bahamas and 7 beds at the Infectious Disease Center. In New Providence, at the South Beach Health Center, we have 10 beds currently in place with an expanded capacity of 26. There's also space for 16 additional beds underneath the tents supplied by the National Emergency Management Agency, NEMA. Currently, the COVID-19 bed assignment at the Princess Margaret Hospital is 78 beds. We have 30 beds at the Special Pathogen Unit, 11 beds on the private medical ward, 14 beds on the Medical Surgical Ward 2, 8 beds in the Legacy Unit, and 15 beds in the old general practice clinic area. Doctors Hospital West has 22 beds, and Doctors Hospital East has 6 beds. With the addition of the 28-bed COVID-19 isolation and treatment unit beds that were previously operated by Samaritan's Purse, now a part of the Special Pathogen Unit, the national, Mr. Speaker, the national bed capacity for COVID-19 now stands at 106. Mr. Speaker, the government was conscious of the understandable fears experienced by our healthcare workers during the second wave of the pandemic. Hence, we spared no efforts to ensure the safety of these valued employees through training, increased and consistent stock of personal protective equipment across all our facilities. The ministry, Mr. Speaker, also supplied PPEs for staff at private medical facilities in country to reduce the spread. Mr. Speaker, we increased sanitization frequencies of healthcare facilities throughout, and we rerouted general hospital traffic to maintain distance between non-COVID-19 patients and those suspected of being positive for COVID-19. Mr. Speaker, we also facilitated access to our healthcare workers to psychosocial support. Today, Mr. Speaker, there has been no, I want to say this, Mr. Speaker, today there has been no furloughing, layoffs, terminations, or reduction or deferring of benefits for our staff. Mr. Speaker, the government has also augmented its human resources in the healthcare sector. It has hired some 32 new doctors, and recently 54 registered nurses, 2 trained clinical nurses sat the nursing examination. The government awaits the decision of these 56 nurses who are poised to enter the Bahamian cadre of nurses. Additionally, the government will be paving a parallel track to strengthen the healthcare system by sourcing nurses from abroad. The government intends to buttress the healthcare system with adequate personnel, provide better coverage of the shift system, and offer a longer respite to relieve frontline workers. Mr. Speaker, plans are also in place to test our healthcare workers. This is something that is being requested by our healthcare workers. Plans are in place to test our healthcare workers regularly using our new gene expert machine. With this strategy in mind, those who have been exposed to contracting COVID-19 may receive the green light to return to work more quickly after receiving a negative RT-PCR test. Mr. Speaker, the government has also sourced therapeutics, as we all know, and has been reported like remdesivir, which has been used to reduce the time spent in the hospital for patients who are very, very sick with COVID-19. Still reiterating the plan, Mr. Speaker. Mr. Speaker, yes, it is true. We have a reduced number of newly confirmed cases, but we are not out of the woods just yet. These reduced numbers simply signify that we appear to be containing this virus, containing the transmission. We have the potential to be at a good place while we await the delivery of a safe and effective vaccine. How long we sit in this comfortable space depends on the behavior of our beloved Bahamian people. It is our hope that during the holiday seasons, persons would refrain from large gatherings, as the Prime Minister would have mentioned, and small get-togethers with family outside of their immediate households. Specifically, international recommendations for CDC and WHO are that gatherings should be outdoors and limited to those who normally live in your household, as was mentioned by the Prime Minister. Mr. Speaker, we employ the Bahamian public to be socially distant and to remain conservative during the holidays. Remember, Mr. Speaker, when we move, the virus also moves. Mr. Speaker, today we have 2 viable options for long-term success in COVID-19 fight. 1, we develop herd immunity, where some in the community have contracted the virus, some become ill, and perhaps die, while we achieve a measure of immunity. Or 2, we introduce a viable COVID-19 vaccine to keep the population alive and thriving while we develop herd immunity. Mr. Speaker, I have another 2 pages. I know my time is gone, but I just request another 2 minutes or so, Mr. Speaker, your indulgence.
Sure.
Mr. Speaker, we choose, Mr. Speaker, option number 2. Mr. Speaker, government has already signed on to the COVAX facility of the Pan-American Health Organization COVID-19 vaccine introduction readiness tool and has devised a national COVID-19 vaccine strategy plan, the NCBSP, to manage the equitable distribution of vaccine supplies in sufficient amount to the Bahamian population once it becomes available. Mr. Speaker, prevention is better than cure. Hence, it is in our best interest to keep the COVID-19 virus at bay and prevent the spread within our community. Mr. Speaker, until the vaccine is disseminated, we will continue to detect. This is our plan, Mr. Speaker, which we've carried out. Mr. Speaker, we will continue to detect the virus, isolate the infection, prevent the spread of COVID-19, and care for the critically ill to save lives. We cannot discount the impact of wise policy decisions, such as the emergency orders on bending the back of COVID-19 in our country. Mr. Speaker, Narendra Modi, the Prime Minister of India, once highlighted, good governance is not firefighting or crisis management. Instead of opting for ad hoc solutions, the need of the hour is to tackle the root causes of the problem. Mr. Speaker, the Minister administration has done just that. Tackle the root causes of the problems in regards to the spread of COVID-19. We have only done, Mr. Speaker, what Paul Mayer recommended. Crystallize your goals, he said. Make a plan for achieving them and set yourself a deadline. Then, with supreme confidence, determination, and a disregard for the obstacles and other people's criticism, carry out your plan. We have carried out our plan, and because we did, the Bahamian people are now in a better place because of it. Those seeds, Mr. Speaker, planted in the field of our nation, those seeds of hope, are now springing forth a harvest of plenty for the Bahamian people. Mr. Speaker, with that I say, may God bless you, and may God continue to bless this great Commonwealth of the Bahamas. I second this motion.
Thank you. Thank you, Honorable Member. Honorable Members, it has been moved and seconded that the following resolution be agreed. Whereas pursuant to Article 29, subsection 1 of the Constitution, the Governor General may make a proclamation of emergency declaring that a state of emergency for the purpose of that article exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation of emergency made on the 24th day of November 2020 until the 31st day of January 2021. B, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Risk Management Regulations 2020 made on the 24th day of November 2020 until the 31st day of January 2021. C, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Risk Management Order 2020 made on the 24th day of November 2020 until the 31st day of January 2021. And D, affirms the continuance in effect of the Emergency Powers COVID-19 Risk Management Special Provisions Order 2020 made on the 24th day of November 2020 until the 31st day of January 2021. As many? The chair recognizes the honorable member for Cat Island, Rumkey, and San Salvador.
Thank you, Mr. Speaker. Mr. Speaker, listening to the side opposite with the self-congratulatory patting on their backs about their management of this virus and expressing how well they have done and where they are now in the fight supports our contention. If it is so good and you're doing so well, why then the need for a proclamation? Why the need for the proclamation? Right? So, Mr. Speaker, both members, well, the Prime Minister himself indicated, he himself has indicated that the efforts here are not about lockdown. He started off by saying, it's not about lockdown. It's not about curfew. Well, and I wonder if he read, well, he signed it, so I must accept that he read it.
he read his emergency powers COVID-19 pandemic risk management order 2020 that he signed on the 24th of November, 2 days ago. Because all of this flows from the proclamation of emergency. And it speaks to curfews. It speaks to lockdown. Right? That's what it speaks to. So if you needed some time and you're doing it now, then is the member of Kalani misleading this House by saying that this is not about lockdown, by saying it is not about curfews? Mr. Speaker, at the end of the day, Mr. Speaker, right? I am concerned and troubled by the manner in which this pandemic is being managed and handled. And I can raise a very critical issue as I move on. But just let me, Mr. Speaker, confirm without any doubt that we emphatically do not support yet another proclamation of emergency. That's apart from implementing protocols. That's apart from implementing measures that are necessary. I'm talking about the proclamation of emergency. It is an unnecessary intervention in the fight at this stage. At this stage. Mr. Speaker, at the heart of our nation's constitution is a series of fundamental rights and freedoms for Bahamians. Many of them, many have died over the years. Many have struggled over the years, right, to establish and to ensure these freedoms that undergird the quality of life in a democratic society. This fundamental document, called our Constitution, also sets limits on those who govern, whether in the legislature, the judiciary, or the executive. Our founders understood that there might come moments of extreme crisis during which the Constitution could not operate normally. They understood that. But they also recognized the seriousness involved in suspending the Constitution and fundamental rights of a people. Hence, they put safeguards limiting suspensions of our rights to short time frames and to ensure parliamentary oversight and scrutiny. Mr. Speaker, it is now some 8 months since this FNM government first persuaded the Governor General to proclaim a state of emergency. 8 months since the Prime Minister appointed himself as the sole competent authority. And 8 months since he has ruled without consultation, without transparency, without accountability, and even without competence. That's my view, Mr. Speaker. The COVID-19 is no longer a new crisis. That ain't no new crisis, no longer a new crisis. There have been many lessons learned around the world about how to protect public health during this pandemic. The need to do so by a one-man rule has long expired. This government has a sizable majority in this House. They could pass any legislation they want. Their own Attorney General has been quoted in the media saying that the government could protect public health through ordinary legislation. I think he had in mind the Health Services Act when he talked about that, because I spoke about that before, and the Quarantine Act. You could do it through those domestic legislation. or even more, Mr. Speaker, 8 months, that may have been enough time to elect not to continue to leave us in what I call an undemocratic state subject to a one-man rule by at least drafting by now a medical emergency law, one that could be debated and then passed by the representatives of the people. And of course, it would be their bill. They have the majority. Mr. Speaker, I find it rather baffling, troubling that we would be sitting here talking about continuing the suspension of fundamental rights of a people in a democratic society in 2020, Mr. Speaker. The truth is, this new extension of the proclamation of emergency has nothing to do with public health and everything to do with a competent authority, in my view, who has learned that he prefers to govern and spend without accountability or oversight. They say absolute power corrupts. This extension of the emergency proclamation is, in my view, a corrupt power grab. I'm not surprised that a view has emerged that we may be seeing in action a demigod. I'm not surprised at that. All right? So, Mr. Speaker, we could go to Barbados, and I'll go there. So, it sounds like somebody just came out of the bathroom. Sounds like someone just came out of the bathroom. So, Mr. Speaker, so for possible,
Honorable member, the chair recognizes the honorable member for Yamako. On a point of order.
That kind of stuff on the floor of the house.
What I said
On parliamentary.
Exactly what you said. You've been here before all us.
All right. To say that
You can't.
the language is most,
Honorable members, the member for Yamako has the floor.
among other things, Mr. Speaker.
How do you do that?
The language is most on parliament.
This is not a barroom. This is the Parliament of the Bahamas. This is not a barroom.
Making those types of suggestions.
Come on, man.
Struck from the record.
Honorable member. Honorable member.
Most unparliamentary, and beneath him. I'm tempted to say that it is low, disrespectful, discourteous, and condescending.
Unbecoming of the leader of the
And I
opposition.
don't know how
Statesman
you know,
in this country.
he's a tracker.
Come
Because
on.
he has a very, one of his senses is probably much exasperated than everybody else in here. That he could say to a member, you just came out of the bathroom. So stop being petty.
Honorable members.
Stop being
Honorable
petty
members.
and low. Stop being
Honorable members.
Like you sound like you
Honorable members.
auditioning for another job. But
Honorable members.
you're auditioning for another
The
job.
chair is about to make a ruling. Honorable member, resume your seat a moment. Let me make the ruling. Honorable members, it's the view of the chair that the implication, and the way the phrase was used could be, in my estimation, in breach of Rule 33, 16, and 18. I wouldn't want to put it on the record. I don't want to put why I think it is on the record. But it's in. Don't worry about him. He's a criminal lawyer, and I do criminal law as well. I know how to try and put something on the jury, and then deal with the objection. So, honorable member for Cat Island, the ruling is that The reference, yes, yes, you made. Um, uh, Honorable member,
I can withdraw it if you want me to. Right?
no, I don't want you to withdraw it. I'm going to expunge it.
Or you prefer expunging it than I withdrawing it?
Yes, I prefer to expunge it from the
Now,
record.
let's identify what you're doing, though.
No,
The
I'm,
words, someone, and who's the person we're talking about now?
honorable member, resume your seat. Honorable member, we don't want to bring any further, resume your seat. It's the ruling of the chair that the reference to bathroom or someone coming from the bathroom is offensive, it's abusive, it's insulting, and is really unparliamentary, and so it is hereby expunged from the record.
Who may have been insulted. I was trying to. See, you know, I could, no, I could find another way to say it, you know. Right? But Mr. Speaker, I would invite you to cause persons who would invoke such a comment to perhaps keep their mouth shut.
Everybody in there can talk just like
Right? And if they wish to speak, please stand up. And then I'll deal with you directly.
I got the mic in front of me.
Speaker, that's fine, Mike. That's fine.
Are you sure you
So, Speaker, so keep them quiet because they are insulting me. Speaker, they insult me from their seat. You're hearing it. You're all hearing it. You're hearing what they say.
Honorable members,
I didn't say anything to anyone, but then you're saying, and I'm a speaker. Speaker, I will, Speaker, he looking for company, but he never me no company. Let me just say that, right? Well, he not the company. But Speaker, you know, what I'm saying is that what we are talking about here, and as I said before, it's no surprise that a description of demigod is being emerging out here, right, about the company's authority, right? Because when you suspend our most fundamental rights,
honorable member,
to control
honorable
the
member,
movements of every citizen,
honorable member,
every possible,
just resume your seat a moment. Yeah, resume your seat a moment. I want to address a particular matter because the honorable member for Cat Island, Rumpke, and San Salvador is sliding down a slippery slope. And honorable member, you're making reference to resume your seat. Resume your seat. No, you cannot stand up while I'm speaking. It is clear what the honorable member for Cat Island, Rumpke, and San Salvador is attempting to do. And what you are attempting to do is you are also trying to attribute something to a member in this parliament that was falsely reported in the newspaper. And so I would advise you.
I said there is a new emerging. I never attributed that comment to anyone. Now, if, again, I didn't ask. I said a view is emerging, that the member might be a demigod.
Honorable member.
Emerging. I attribute that to no one. The member for Kalani.
Honorable member.
Now, if
Honorable member.
you feel that I talked about what you might have been saying,
Honorable member. Let me say this to you.
That's the emerging view.
When I referred to you earlier, I referred to you as a criminal lawyer. Not a lawyer who is a criminal, or not a criminal who is a lawyer. But I referred to you as a criminal lawyer. I think you should be guided by that.
Mr. Speaker, I am a lawyer, and I'm a lawyer more than involved in criminal cases. And the vast number of cases that I would have been involved in, right, far more than criminal, you would not even have touched, Speaker.
You don't know my capacity, and you don't know what I've touched. So don't go down that path.
No. But you brought me there. You brought me there. You are taking a bait, Mr. Speaker. I talking about an emerging view of the competent authority. Right? Right? People are calling him a dictator. People are calling him anything. Right? Now, if you want to explain what the paper reported you to have said, and you want to do it in here so you could excuse yourself from your boss, and sit down, you could do that. So that's where you started. Right? And so, the Speaker, when I talk about this, about controlling the movement's citizens, there's even more that has been invested in the competent authority by these COVID rules and the regulations on the Emergency Powers Act. For example, the power to spend outside of the ordinary procurement process. That's as a result of this as well. The power to punish and reward. That happens too. Some bars could open, some liquor stores could open, and some can't, for example. Some restaurants could open and some can't. The power to choose favorites goes out of that as well. The power to make decisions without having to debate or defend them. That's what happens. It's really something to see that we who are parliamentarians are supposed to be the bastion of upholding and protecting the society as being one, as a democratic society. We'll just sit meekly by to see this subversion of our democracy. 8 months with more to come of the suspension of civil liberties. It's a wonder that somebody they could walk upright. But you need the spine to walk upright. You need the spine to walk upright. And what's more, Mr. Speaker, the competent authority has been so incompetent that we are much worse off than we needed to be. More than 7,500 Bahamians. I'm hearing all the pats on the back here today, But more than 7,500 Bahamians have contracted COVID-19. Our local economy has been ravished by the effects of lockdowns and curfews. And as I have said before, when I was speaking, visitors are being warned not to visit. Imagine that. Imagine where we would be now if the competent authority had used all its extraordinary and unprecedented powers to put enough testing and tracing resources in place ahead of the July opening. Many fewer Bahamians would have contracted or become sick from COVID-19. Less suffering would have been amongst us, less grief. No lockdowns or curfews at this time would have meant few Bahamian-owned businesses would have to close their doors. We could have been known as a low COVID or no COVID destination. Instead, the Prime Minister's tenure as Companies Authority has been, in my view, and by the world, and if you see where we are, when they compare where we are in managing, see, that's what I look at too. When we look at where we are managing against all other jurisdictions, where do we land? Where are we? The worst in this region. Check it. Right? See? So, Mr. Speaker, right? The orders continue. And even as you go through these last order signs, there's still confusion and you can see chaos. Who needs to be quarantined? Who doesn't need to be quarantined? What does the visa truly mean? What are the factors that one has to fulfill to be granted the visa? It's a confusing document when you look at it. Right? Now, for example, I want to travel to the Family Islands too, just like the Companies Authority. I would like to carry the persons who work for me. They are not public officials, or they're not in the government service. Because when I identified a person who went with him, last time he said, "Oh, she's in the public service," I accept that. I don't quarrel about your travel. You need to. But I need to travel too. And I should be able to carry who I wish to. Now I notice you're going to Parliamentary. Then from Parliamentary, you're going to Kerala. Rumkey too. Oh yeah. I hope you're going with him too. But I see you auditioning. So you better go with him when he goes. But I see you're being accompanied by someone who is not a public servant. He's not a public servant, and I wonder whether he's going to be quarantining. And I wonder why, I would wish that we consider, if I get the visa, and I see that the visa, in one instance, you need to get the PCR test, right? And that's complicated, that's costly, right? Right now, I have a family who's trying to get back to Cat Island. They're being told they got to go do the PCR test. That's, someone told them it's $200. Stick to them. That's $800. That's $1,200, sorry. $1,200, right? Right? So I'm saying, if it's 130, that's still what's that, 6 to 18, how much is that, $780? For a poor family who can't, that's what I'm saying, and they won't go home. So that is the dilemma. Some of the confusion and the chaos and the restrictions. You say we could travel, but you make traveling so difficult, you might as well say you can't travel. Same thing, right? No, they won't go home. Right? They were here for other reasons. Right? Important emergency reasons, and trying to get back home. Again, talking about confusion, the measures say they could travel in emergency situation once it's identified. So I travel on the emergency situation, I come, stay around, and I need to get back, and I'm now being told I can't get back unless these things are in place, which are costly. I ain't talking about the cost of the trip, but the cost of the visa, the cost of taking the test that's required, and then quarantine, right? And so, we were good, and we remained good, all right? So what I'm saying, so he has, and so, we, this curfew, lockdown, when we continually rely on that, it speaks to an absence of plan. It speaks to an absence of my not being able to manage what I'm doing, right? That to me, that's, I think someone you say that's a lazy way out. It's lazy to, what do you say? Lazy to impose tax, right? Lockdowns and curfews, that's a lazy way out, maybe. Now, we accept that COVID is not an easy problem. But you have deepened our health crisis and economic crisis in a way that can only be described, you being a doctor, as malpractice. So you continue to point to the struggles of other countries. You keep pointing at other countries as justification. But there are plenty of nations that are succeeding. Why does he never aim for success of our country? Why are you so comfortable in justifying failure, man? Let's look at countries. I call Barbados. Right? Sandals is open. Why is Sandals not open here? Sandals are open in many of our Caribbean neighbors close by. That ought to tell you something that you need to know. Right? Now, and are we learning from our mistakes? I think not. Now, I've looked at the numbers, and you need to look at from October to November to date, there appears to have been 50% reduction in testing. You're not testing, the government testing as much between that period as you were in the previous 2 or 3 months prior. July, August, September. Now, that may be correct on the numbers, but I asked the question. I asked the Minister of Health yesterday, I think, when we talked yesterday or the day before. Look, and he mentioned today that they are now ramping up the rapid antigen test. Now that has been going on in conjunction with the PCR test. I asked the question, are we taking into account, or how are you treating the results of the rapid test? Are they being included now, to date, since or in your count? Are they, and if not, why not? Because I'm advised that they're not. And if you add them, then you'll see, as you were saying before, what the true numbers are. Right? You see what the numbers are. You'll see what the numbers are. Well, I'm hearing that those tests are not reliable. But I just heard the minister say that they're just ramping that up. I just read in your emergency orders that one of the tests that you could be relying on is in here, the rapid antigen test. So if it's not reliable, why would you legislate that it be it? Right? That's what you're saying. But why, if it's not, why are you using it? And the question I asked, Minister, are you including the positive results from the antigen test? Right? That is a question I asked. And if it isn't, then why not? And so, let's speak up. So Now we are reopening our borders again with COVID again raging in the United States. It's again, and we reopening again. We are testing fewer Bahamians. We are testing fewer Bahamians. We should be aggressively
Honorable members, honorable members.
See, I'm a neck, man. I protect myself, man, you know. See, the speaker knows me, you know. And we know each other. And he knows brave don't need no one to protect him. He knows that. He went to school, you know, every brother, I went to St. George, man. And they know my reputation from there. Anywhere. Anyway. So what I'm saying is,
I wouldn't think that big. I wouldn't think it that big.
he's not as unwise as you all might think. So, Mr. Speaker, what I'm saying here, that it's not, I'm not questioning reopening. What I'm suggesting is that if you're reopen wisely. And if you're going to reopen wisely, well, you know, I suggested my plan. You could look at it. You can decide whether you want to adopt it or not. But I think it's a good plan. And you ought to adopt it. But that's still your choice. I'm saying, Mr. Speaker, reopen wisely. So that if you're reopening, you don't reduce your testing, you increase it. That's how you protect your people. The virus is invisible. The only way we can make it visible is through testing. You heard the minister yesterday speak about his experience. He was asymptomatic, straight through, but he was infectious. He was well, right? But we are not testing to determine to capture that demographic of ill person who may be carrying the virus but asymptomatic. But that doesn't. What's that engineering term you talk about? Breaking the cycle or the transmission, the circuit breaker. So you don't have your circuit breaker. Your circuit breaker has to include identifying those persons who may be carrying it and don't even know they're carrying it. They're asymptomatic. You see what I'm saying? And so I'm saying if you open wisely, so you don't decrease your testing, you increase it. Particularly the Bahamians who are in the service industry, because they'll be welcoming visitors, they'll be exposing themselves to the visitor, and themselves to the visitor, and the visitor to them. So you'd want to ensure that they are looking after our people as well. So that's what I'm saying. I'm saying that from the statistics you're showing, I don't need to go by that because I don't know all what you're doing. And I don't know everything. I just have to look at the numbers you publish, right? And from the numbers you publish, your testing is going down. And whereas you should carry it up and keep it up. Yeah. No, well, the speaker, that's not. Okay. So, okay. Speaker, so, Speaker, you know, I've said it before, and I've said it again. You know, Bahamians really suffer. There's this health crisis. There's this economic crisis. And I'm saying now we have this constitutional crisis because we continually moving to suspend our civil liberties. And no doubt you would have heard me that there's this leadership crisis. And now with the government now engulfed in a serious scandal, the lack of trust in this government is spreading even faster than this terrible virus. But Mr. Speaker, forcing the Bahamians to live under the rule of one man for another, and I say another, and I say likely 6 months, even though they're taking it to January 31st, the opportunity is still there to carry it to another, to at least 6 months. I call that a corruption scandal. It's scandalous to have this kind of power after 8 months of suspending our civil liberties in a democratic society to continue, right? I did not tell you follow Barbados. I say look at my question. You all keep saying, Speaker.
Honorable member,
Speaker.
the member for Yamakro is on the point of order.
Misleading the House. You can't have it both ways.
No, you can't.
When he asked us to look at Barbados, and it's a fine example, now he wants to pull it back. They've gone far beyond. You know, all entangled where we weave when first we try to deceive.
Blowing hot and cold.
That's right.
Blowing hot and cold.
Kalani, I can give you a little reference to it. He's doing a good job. He's auditioning well. He's very auditioning well. Doing a good job. But let me just say this, right? If you understood me to say follow Barbados, well, let's follow Barbados. Look at his leadership. Look at what their measures were. Look at when they say that the proclamation of the emergency is in place, whether or not it suspended all the civil liberties. That's what you look at. No, listen. You look at what it says. You can excuse the provisions under the Constitution that you don't want affected. Look at that. And that's what you look at. Okay? So, Mr. Speaker, look at what they have done. What has happened now? They are open, and they have opened safely. Right? And safely. And they're high. Right? And so, Speaker, I say, forcing the Bahamians to live under the rule of one man for another likely 6 months is a corrupt scandal in itself. It's scandalous. It's a grab for power, I say. That has nothing to do with public health. Look at what the people's time has come to. One man, not competent, not compassionate, and determined to avoid accountability to Parliament and the Bahamian people. Mr. Speaker, this is not what the drafters of the Constitution, our founding fathers, envisioned. This proclamation of emergency is an abuse. We cannot support it.
Thank you, honorable member. The chair, as many, chair recognizes the honorable member from Mangrove Key, South and Central Andros.
Thank you, Mr. Speaker. Speaker, I stand proudly on behalf of the great people of Mangrove Key, South and the Central Andros, and to say a few words on this emergency orders 2020. Time is of the essence, Mr. Speaker. I would not be distracted. The COVID-19 pandemic,
Honorable members,
has generated far-reaching impacts on the global economy, with the global economy now expected to shrink by some 4.9%, a sharper decline than expected or forecasted of some 3% projected in April of 2020. Over the next 2 years, the pandemic's global economic cost could reach just over $9 trillion, larger than the combined economies of Japan and Germany, causing more economic devastation than the 2008 financial crisis, according to the IMF Financial Journal of 2020. Mr. Speaker, the World Trade Organization projects that the global economy that global trade, could decline as much as some 32% in 2020 and beyond. COVID-19 pandemic has already erased some 130 million jobs in the first quarter of 2020, as expected to eliminate more than 400 million full-time jobs in the second quarter of the same year. The global economic downturn will have and has had disproportionate impact on developing and emerging economies such as ours. They will take the hardest hit as they have less resources to protect themselves against this dual health and economic crisis, Mr. Speaker. World Bank President Mr. David Malpass opined that the global recession could set back decades of progress in developing and third world countries, and noted that the COVID-19 pandemic could lead to higher infant mortality rates, stunted growth in children, educational dislocation, more physical and psychological challenges, infrastructural challenges being exacerbated, foreign direct investment flows, a critical source of financing for these emerging economies, projected to decline by some 30 to 40% in the near future. Mr. Speaker, developing countries have seen more than $100 billion, flowing out of these regions, especially from ACP countries, between March and April of this year alone. Developing societies in the Bahamas being a part of this mix. Debt burden has soared from between 2.6 trillion to 3.4 trillion over expected to soar to those figures in the next 2 years, according to the United Nations Conference on Trade, Investment, and Development, UNCTAD. The same report projected that the Latin American Caribbean region will experience the worst possible economic contraction in the region's history. The economy's economic decline projected at some 7.2%, with unemployment expected to reach, on an average basis, some 13.5%. An economic downturn could push some 28 million people into extreme poverty. Mr. Speaker, then, since I only have a very few minutes to stand, I would turn quickly to the home front. I would then quickly reflect on the call made by the honorable member for Carolina and El Salvador. He asked the government to consider the selection of an economic advisory council, and this would have brought a bipartisan approach to the process of looking at how we can revive and sustain the Bahamian economy. With the government representative, some member from the opposition, the business community, the church and civil society, and hopefully a family island representative also being a part of this mix as we come together to build a better society. This afternoon, as I stand here, I'm receiving any number of emails, texts, WhatsApp. In my view, many Bahamians this afternoon are concerned with the level of what they would call incompetence, inconsistencies, constant vitiations and amendments to the emergency orders in the past few months alone, and also the concern of infringement on their basic civil, decent Bahamian rights. Many have been left confused and bereft of what they expected would have happened under these orders, but they're now further confused with the infection, what we expect to see in the next few months. As we hear now, this could be extended until the end of January. We would have also seen in many press conferences where the member for Kalani would have stood and made his contribution, and only later on you hear someone telling you that there's something else that came up in the Attorney General's office. There's now a spirit of COVID fatigue, and maybe, Mr. Speaker, that has been exacted upon the Commonwealth of the Bahamas. I would like, amidst all the confusion, Mr. Speaker, to commend frontline workers, nurses and doctors, and ancillary staff, especially those in my districts, South Andros, Mangrove Key, and Fresh Creek, on this Thanksgiving Day, as we give God thanks for just being alive today amidst these challenges in our society and, by extension, the world. Mr. Speaker, people expect their government to have economic plans and policies that exudes confidence in the governing process as a whole. ones that bolster confidence and strengthens revenue for the long term. The government that affords them more progressive and 21st century public service structures and protocol, coupled with good infrastructure and also the prospect for future development so that they can be a part of the process of building a better country. Reduce unemployment and lower misery index, ease of doing business, access to financial assistance, especially those involved in small and medium-sized enterprises, inclusive of family islands. And I go back there once again. Also, they expect their government to attract legitimate foreign direct investment. And I would have had the opportunity just the other day to sit with some prospective business young people who were speaking to the issue of blue economy and what it could do and encompassing sustained growth, and especially those in Andros, Marine Resources, Larry Bastian and others had a chat with them the other day on the grain economy and those who feel strongly about protecting the environment, like the Prescott Smith and Graham Rutherford and others, not downgrading our environment, especially our pristine beaches and pipes and creeks in Andros and the Exomas and other parts of our beautiful Commonwealth. But also, we must also look, and as these young people have much expectation and anticipation for a better Bahamas in the 21st century and beyond, look at the orange economy, where their talents would be, and their various talents would be showcased, intellectual property protected, and also cultural heritage, for example, Mr. Speaker, being further expressed and encouraged in our society. I want to commend the member for Fort Charlotte, who's been most assiduous in his efforts, in trying to keep things going in that regard. I don't know what kind of funding or allocations have been given to his efforts, but every time you listen that he's trying to do something, he reminds me of the late Winston Saunders. Amidst all the ups and downs and the vicissitudes of funding and other things happening around him, he continued to move on with his cultural dynamism back in the day. I want to commend him, remember, for Charlotte, and what he's been doing. I watched this last evening with my family, the BDC Cultural Show, and saw Pastor Simeon Outen and Apostle Roll. And then my daughter, my wife, rewinded the program, and we saw one with Veronica Bishop and Sweet Emily. This gave much hope as we look at the orange economy and cultural development. The leader of our party is a real down-home man from Cat Island. No one can do the dance like him. But I remembered how we would have been a part of a meeting at the CARICOM Heads of Government meeting held here in New Providence, a subcommittee, where we heard a cultural presentation by former Prime Minister of Jamaica, the Most Honorable Percival James Patterson, on the dynamics and how the cultural economy could be such a major part, especially of third world developing states. And I would say that by the same token, the efforts of the former administration with John Canoe Carnival, although besmirched and belittled by many, led to the same kind of burgeoning of the cultural dynamism of our country once again. Like we would have seen when I was a part of the communities of Jamaica, Barbados, and also the Republic of Trinidad and Tobago. But today we are still saddled with the 60% increase in VAT, which has led to much hardship in the last 18 months in our society. An economy that continues to falter, in my view. Trade unions are still up in arms for industrial agreements to be settled. The issue of minimum wage is one that Bahamian people are still very concerned about. The non-payment or refunding to vendors of those who are expecting the legitimate refund from those to those as they would have paid, their value-added taxes. Revenue collection, according to the projection by this very same government, is down or off by some 12 to 15%, or some $400 million below the budgeted amount that was expected. But today we stand here, and I would simply go through some of the things that concerns Bahamians as we talk on an everyday basis. The General Food Assistance Program. And I heard the member for Angleton just yesterday. As we look at this COVID and the implications for our society, it is real. Many have died and many persons have been challenged by the illness, and my family has not been removed from it. The reality is, though, that the National Foods Assistance Program, as noted by and she commiserated over the fact that the former Club 601 is going to be used as what I call a general point of persons collecting their foods in New Providence, their food products in New Providence. Mr. Speaker, there are many persons among the authorities and those who are directing the program, NG or otherwise, to be cognizant of the fact that all of our fingers are not the same length, Mr. Speaker. And we might take it for granted that someone who over the hill in Odell Corner, Taylor Street, or there are persons in South Beach who are waiting for for their assistance. They have to catch buses, and the buses are not moving around very frequently. Your cousins and family, because they're not working, they don't move unless you put gas in their car. It's real talk. And so I think we need to look at having these, once again, having these various locations around New Providence, where persons can go and collect their food from the national program instead of going to one location. The issue also, Mr. Speaker, that concerns many persons. I was at an event just the other day at a church. Two ladies, young ladies came to me very concerned about the rental assistance program, Mr. Speaker. People are being evicted, put out of their apartments or their rental units. Others are being taken before the courts. And one of the young ladies noted the fact that she would have gotten some check or some kind of financial assistance from your ministry member for Southern Shores. So I want to note that fact. That's a very positive report. But I'm saying at the end of the day, if someone is not working and they've been furloughed, and many times persons now have to have the extended family members sometimes being with them. It's a very challenging time. And I'm saying the member for Kalani once again stood and talked about the rental assistance program. We heard the other day about we heard some pronouncements. But we must note the fact that many of these landlords, they want and expect more money. And a lady was talking to me the other day who owns a property and saying they waited long enough to get these couple dollars. And so what they must do, the banks are calling them. So what I'm saying here, the banks are calling them, the landlords, pardon me, they got to make the payments. And the tenants are saying, well, I'm not working. I'm only getting a couple dollars from NIB. I think it's going on to maybe $100 or maybe one something. This is real talk. This is what was a part of the conversation. So people are really hurting in that regard. Persons are the homeless numbers are high. A pastor said to me the other day, so just somebody take a drive to Montague or on the eastern tip of New Providence in the evening time and see the amount of persons who up to curfew hours still at the beach, park with their kids in their car. Hungry, no homes to go to. Someone, I don't want to switch part of the law enforcement now they're part of, would have seen persons parked along the street with draft, what we call it, due on their car, parked, nowhere to stay. Why you here? Children in the car with all their virtual clothing that they own in the car with them. Homeless. This country where we have much. There are those who are still hurting this afternoon. The National Food Program, Mr. Speaker, must be real and must reach our people. People need real help. But today I was gratified to hear the member. And I must quickly note this fact that I wish the member for Kalani and members of the competent authority bear in mind as I head to South Andros tomorrow, my birthplace, proud Androsian, that quarantining for 14 days in the Family Islands is a major dislocation for Family Island people. It's hurtful. Most of the businesses in the Family Islands are led by older men or women. Teachers and self-employed individuals are returning home. And you return home from the Congo Town Airport, Carmichael. You go to Clarence Bean Airport in Mango Key or the Andros Town Airport. And when you get home, unlike being in New Providence where you get the population numbers are bigger and you could kind of be absorbed into the numbers. In the Family Islands, they know you. The Family Island life and politics becomes very personal many times. And if you understand Family Island life, you should know which I speak. And you can fall to victimization in a very real way in the Family Islands. So I'm asking the competent authority to bear this in mind. It has happened to people in my district, returning home from funerals, to be victimized because of who they support politically. I never believed in that kind of South Andros, Mango Key, North Central Andros. I want to build a better community in Andros. And I believe in it very strongly. We must bear that in mind as we pass these laws that has impact on the lives of our people on a day-to-day basis. I am saying that if we're going to give, Mr. Speaker, some kind of quarantine mechanism to lend some level of comfort, the numbers should be, if persons are going to be quarantined when they go to the Family Island, it shouldn't be no more, in my view. if you're going to have to be quarantined, no more than 3 to 5 days, if that, Mr. Speaker. 14 days, Mr. Speaker. 14 days is a bit much. 14 days is a bit much, Mr. Speaker. I am really concerned about the 14-day principle, Mr. Speaker. We are very concerned, and that's my view, Mr. Speaker. Nothing to do with my party. So once again, these are my view after listening to people in our communities. Mr. Speaker, I am very glad to know today, as I listened to the leader, my leader spoke about on this emergency orders and this extension, and the fact that all of the appropriation and the exigency powers that are given to the member for Kalani on this day of Thanksgiving, as I am about to go home once again, the persons and the people of Andros would be most grateful if the member for Kalani and his delegation, as they head on to and traverse the central and the southeastern Bahama Islands on the weekend, we look on this Thanksgiving Day to give us a reason, South Beach, to be thankful in South Andros. And most gleeful if we could have in Mangrove Key this afternoon to say, listen to me on the national station as their hometown boy who represent their interests in North Abaco in here. I speak for them. And they sent me here to do just that. Speak for them. And I will keep speaking for them. I would want to see on this Thanksgiving Day that I can have, we can be grateful and thankful for having the contract once again reissued for the repairs on this Thanksgiving Day for the clinic in Mangrove Key, where David Wallace and Reverend Christopher Smith and others, Alice Bastian and Mr. Ralph Moxie was given much, Queenell and Jackie Oleg and others down there, Shiraz Sanders and my Sister Lee Brennan and others, Sister Lee Brennan and others could feel proud this afternoon that they can get their clinic, Kalani, their work could be commenced at the clinic in beautiful Mangrove Key. The docks and the warehouses at Lisbon Creek, I'm glad to see that the member for Carmichael has heard our plea and is giving it deep consideration on this Thanksgiving Day. Thank you, Lord, for having someone who would listen to our plea this afternoon. Also, I want to say we anticipate better telecommunication facilities also there. This afternoon, I would say that we also very concerned this afternoon about the developments in Central Andros. Roads in Central and South Andros is a major issue on this Thanksgiving Day. We would like to be thankful to see that these road works could be done, because with the pandemic, you quarantine and things are rough. At the end of the day, at the end of the day, the competent authority and the member for Kalani has the right to appropriate funding to effect change and make things happen under these orders. And I'm simply saying to the member, as we do some things for the other districts of this Commonwealth, please consider us in the community of South, Central, and Mangrove Key Andros. I would simply say this afternoon, Mr. Speaker, our roads, our gyms, our dock is critical to our people. Better telecommunications is very critical. And I would join with my administrators and local government practitioners, Mr. Speaker, in wishing all Bahamians this afternoon a very peaceful, fun-loving, and a mind-building Thanksgiving as we come together, and not very big numbers. And also be careful, and although I would like to embellish in all of the ham and turkey on this day, especially ham, which is not good as you get a certain age, and when you get into a certain age, you got to be careful with the high blood pressure element and hypertension, they would say. That's what they want me to say. But the fact of the matter is I want our people to live in love and hope. And I must say quickly that I noted the fact that one pastor said to me today, if our people this afternoon with the extension of the orders was expressed by the member for Cat Island on this concern, and how it's going to lead to certain basic civil liberties being removed from our people or people being constrained. He said, how in the world that people going to be bucking up in super value every day? the end of the day, when it comes to churches, numbers being relegated to X amount of this and that, but any you go to the food store, one senior member of religious community sent me numbers, sent me a video, pardon me, of the food stores being congested. But I'm saying if you go into the house of God, there's nothing for me. It's a proud jumper than going to watch night service, feeling free. Like I told Pastor Mario the other day, the Moxie family was like royalty in East Street in the Valley Corner when I first came to New Providence in the late 70s and the early 80s. The late Edmund Moxie and his family had a front row with the late Bishop Harcourt Pinder at East Street. Well, that's a part of us. The church is a part of our upbringing, the coming together of ourselves. And if you're going to go to all the other places and have numbers, I am saying that the church should be given the utmost consideration because the church is a part of the foundational keepings of and trappings of the Bahamian society. And it's important for persons to be able to go to worship their God in good numbers. The same way they can go and assemble and go to the food store and other places and have some level of the burdens and the constraints being lifted and less implications from the members, those who are part of the legal society or legal fraternity in our society. I would like to thank, as I take my seat, Mr. Speaker, the administrators once again, like I said, and chief counselors who worked real hard. I made the plea on your behalf that we can have a better Christmas amidst all the challenges of this COVID-19 pandemic. It is real. But I note the fact, and I heard the commentary of one former Chief Justice, Dame Joan Sawyer. And she's also joined the chorus of those who are concerned about the suspension of certain basic fundamental human rights in our society, civil rights, in our society. And so here we are today, after 8 months. The pandemic is no longer a new phenomenon in our society. But like my leader said, you've got to live with it, but we must also, at the same time, allow our people to make some mature and responsible decisions with their freedoms in the 21st century Bahamas. We need measures to fight the pandemic. And also, we know the fact that the member for Exuma will speak pretty shortly, but have commenced the free testing protocol in the Exumas. The next thing you know, the government announced the same. We're always saying, then why we can't have the free testing protocol also in Andros for my people? That's all I'm saying. Please. That's all I'm saying. If you have the free testing that the member for Exuma would have started, the government chimes in. I'm saying that the people in Andros are no less of Bahamian than those in the Exumas. If the government could offer it there, come to Andros and also offer the same to our people in South Central and Mangrove Key Andros. Speaker, I too then, on this Harvest Thanksgiving Day, as Brother Latrey would have been too young for this, as we grew up back in the late 60s and the 70s, we call it Harvest Thanksgiving. When you went to church, you saw the cane and the cabbage. We call it sugar cane, by the way, the cantaloupe and the big pumpkin, and some tamarinds were bitter, some were sour, some sea grape, mangoes, and everything was there. Things have changed, Mount Mariah. Go to church now, you see corned beef and tuna and grits and flour and everything else. But in our time, they were proud, as I'm about to take my seat, that there's a song that's called Bringing in the Sheaves. And we will come rejoicing, bringing in the sheaves. And so today, I stand here and hope that we'll be able to give further thanks. On this day, we'll see some relief, where our people can feel free during this Yuletide season. We'll be able to sing lustily as a free people, like the member for Cat Island said just now. Joy to the world, the Lord has come with the shackles off our hands and off our legs. We want to celebrate this Christmas season in a very meaningful way. The Speaker, Philippians chapter 4 and verse 6 says, be careful for nothing, but in everything by prayer and supplication with thanksgiving, let your requests be known unto God. I've made my request unto the Almighty, the omnipresent, omniscient one, who hears and knows all things. I am saying this afternoon, for those who have ears, let them hear what the member for South Central and Mangrove Andros says on behalf of his people. Allow my people to go to Beulah Baptist Church, Mount Olive Baptist Church, the Church of God of Prophecy in Kemps Bay, the Kemps Bay Seventh-day Adventist Church, Macedonia Adventist Church. Let them be able to go to Mount Pisgah Baptist Church during the Yuletide, and those who want to imbibe a little libations, let them be able to do that also. Now, I'm not going to do little libations. That is not my thing, what I'm going to do. But God has also given us free choices. We have the right to choose. So therefore, this afternoon, Mr. Speaker, at this very critical juncture, I must join with my leader in saying that in this present state, and with the extension, I cannot support the resolution as stated earlier. We hope that one day we can come here and we can look forward to a brighter day, and all of our people will be able to freely say, we are free at last, free at last. Great God Almighty, COVID is gone, and we are free at last under a great, let's just say that, under a great PLP government led by Philip Brave Davis. Thank you very much, Mr. Speaker. Thank you very much.
Thank you very much, honorable member. As many? The chair recognizes the honorable member for Carmichael.
Thank you, Mr. Speaker. I did not want to interrupt the honorable member for South Central, Andrews and Mangrove Key, who spoke so well about his constituency, and insofar as he's indicated that he is going home tomorrow and he's raised certain things about works, I just want to assure him that as he was speaking, the contractor for Lisbon Creek, sent me a text about the works that he's starting there. And those are amazing dredging works. You can have an outstanding dock there. We are almost at the process where we can order. We're almost at the stage where we can order your elevator for your gym that you are going. You know the road contract was signed a few months ago, and you know why they haven't started the works. I just want to ask you one favor when you come back to let me know about the progress on that Mangrove PC wall. Thank you, sir.
Thank you.
As many. The chair recognizes the member for Centerville.
Thank you very much, Mr. Deputy. I had not planned, Mr. Deputy, to speak to another extension. I really thought we were done with those. Now I am not sure where this is going. Many Bahamians, Mr. Speaker, Mr. Deputy, are not sure where this is going. Centerville encourages the government in their efforts to do the best they can for as many as they can. We couldn't help but notice, Mr. Speaker, in the presentation by Kilani, he spoke to the opposition not being present or not voting on the previous resolution to extend. I don't know where that puts me. I would assume that the independent is also a part of opposition, and I was not here myself. Mr. Speaker, as a member of this House, and thank you very much, Lord Abaco, for reminding me that I wasn't here. But thank you very much, North Abaco, for reminding me that I was not here, even though I would have voted no in my presentation. I felt quite disenfranchised, Mr. Speaker, by that. I felt, Centerville felt, that the government was disingenuous for a government to call a division of the House when even half of their very own members were not here. Mr. Speaker, first of all, during a time when we are in a COVID environment, which required social distancing, and in the words of the Speaker, he said because of the impact of COVID on the Parliament, persons would be considered present even in their absence. In the interest of democracy, Mr. Speaker, public clarification, and the rights of a people to be represented, can the leader of government business or the leader of opposition business communicate to this House their intention to call a division of the House? Mr. Speaker, if we look at the rules based on division, and the rules on division, Mr. Speaker, speaks clearly to division and the importance of division to democracy. Page 54, section 7, Mr. Speaker, states, when a division is to be taken, the division bell shall be rung for 2 minutes unless the chair is satisfied within a shorter time that all members in the precincts are within the seats allotted to members. This bell, Mr. Speaker, represents our democracy. It represents our right of representation of our people. And you can go a little further in division and when a division should be called. In section 10, after the bell has been rung and the members are within the seats allotted to members, the Speaker or Chairman shall repeat the question. Mr. Speaker, in Westminster Abbey, the bell is rung. The bell is even rung in restaurants surrounding the Westminster Abbey. This is for a reason. This is because democracy must exist. Democracy, Mr. Speaker, even from there becomes a state of mind. Democracy, Mr. Speaker, should be the order of the day. Mr. Speaker, thank you for indulging me for a moment with that representation with regards to division, or when a House calls for division. Mr. Speaker, today my presentation is very short, and it's on democracy requiring responsibility and why governance requires dependability. Good afternoon, once again, members. Good afternoon to Centerville, and good afternoon to the entire Bahamas. Let me first start by saying happy Thanksgiving to all of my friends and colleagues and families in America who watch our Parliament. They watch our Parliament, Mr. Speaker, to see if there's anything to come home to. They watch our Parliament to see if our leaders understand the importance of efficacy, the ability to produce a desired or intended result. Mr. Speaker, I rise on behalf of the wonderful people of the independent Centerville constituency. Centerville, Mr. Speaker, is not an F&M constituency or a PLP constituency. Centerville is an independent Bahamian constituency. We support anyone who values Bahamian. We support anyone who will do right by the people of Centerville and who will do right by the people of the Bahamas. Centerville continues to be concerned, Mr. Speaker, about the petitions brought before this House on behalf of the Bahamian people with no reply. Your Public Accounts Committee has not reported to this House, yet we hear cries from their own members asking for financial information outside the scope of the committee's report. Your constitutionally constructed committees, Mr. Deputy, Treasury, House Rules, statutory instruments, have not reported to the House as we approach the final year of our session. How ironic, Mr. Speaker. Driving home a bill, to me, in my opinion, of dictatorship and control, but when the people cry for standards, crying for proper health care, crying for their pension, their food, their rent assistance. There is absolutely no response. As I have said before, and I will say it again, party politics in the Bahamas is dictatorship in disguise. This level of dictatorship, Mr. Speaker, is then transferred into our governance. I just wanted to take a minute to refer to the member for Bamboo Town. In his presentation today, spoke to his beliefs. And he spoke to his belief that we have been called, and I believe he meant we have been called for such a time as this. I'm not sure if he meant just them or all of us being called. But I will take it further, Mr. Speaker. We were called, yes, for such a time as this, but more importantly, for such a transition as this. It is time for us to transition. Time to transition into quality leadership. Time to transition into innovative leadership. And time to transition into inspiring leadership. Our country, Mr. Deputy, has become desperate for leadership and governance for all Bahamians. Mr. Speaker, I'd like to direct all Bahamians to the Centerville Facebook page. This is where not only will you see all of the wonderful initiatives in the Centerville community, inclusive of food, rent, and building assistance, but you will continue to see our fight for the civil rights and liberties of our people. My appreciation to the senior citizens of Centerville, the Fofi generation, the 40-year-olds and the 50-year-olds, and all the young people of the Centerville community for their support. Mr. Speaker, we should be encouraging democracy and discouraging dictatorial models that lead to unfairness and hunger, models that lead to desperation. This model hurts, Mr. Speaker. This model hurts our people. Our economy and our social well-being is depending on our democracy. Mr. Speaker, I have said it before, and I will say it again. The government appears visionless, and visionless leadership leads to visionless governance, and this in turn leads to dictatorship. Governments in the past, Mr. Speaker, have depended on tourism. When bills and loans became due, they borrowed again. Well, this government appears to be no different. Let's bank on tourism, employ, but borrow to do everything else, even to pay off debt. Let's just borrow, borrow, borrow. This is a system, Mr. Speaker, that will fail us in a time such as this. One extension of power after the other. In my opinion, Mr. Speaker, the psychology itself of this extension defeats the purpose of a democratic approach to resilience. It defeats the purpose of a responsible approach to economic recovery. Even without Dorian, without COVID, that system would not sustain us. And our grandchildren, as I would have said before, will not be able to afford even food. The attempt, Mr. Speaker, not only to control our needs, but also our wants, it's an undemocratic approach to survival. It's desperation. And our days are heavy and they are exhausting. Just knowing these extensions, Mr. Speaker, are over our heads creates a model of inconsistency, helplessness, hopelessness. Mr. Speaker, this model has mastered a hidden dictatorial system, in my opinion. It has destroyed creativity and ingenuity, the creativity and ingenuity of our democracy, of our young people. This system has even recruited our young minds to an authoritarian system with no way out. We must break these chains, Mr. Speaker. The very thing they said they needed us for is the very thing they don't respect of us. They liked our boldness, our creativity. They liked the fact that we believe in democracy. Turns out they liked that you could be muzzled, that you could be bought, and that you put them before your own family. Divisive politics, divisive house. Parties, Mr. Speaker, must change their models. It was just over a year ago, Mr. Speaker, that Centerville decided to speak for the people. It doesn't mean that Centerville can't be a part of a party, but we just decided to speak for people because the party wasn't. And if the party isn't doing what it is supposed to do, we cannot be a part of it. We are here, Mr. Speaker, to represent people, all 10,000 of them in Centerville. Is it, Mr. Speaker, a democracy or is it a dictatorship? Is it, Southern Shores, a democracy or a dictatorship? Are these organizations so polarized so as not to reflect on critical needs or the critical needs of our people? Ensuring economic and social democracy or even justice? Leaders, Mr. Speaker, and hopefully this will answer many questions, with no track record in public service, no track record of people helping people, no track record of debating our very own issues. Nothing, Mr. Speaker. And then we expect them to come in here and speak on our behalf, really? These models, Mr. Speaker, can give us a competent authority who may not even be competent at all. Mr. Speaker, the model gives us what they want to, and that must change. This isn't questions and answer day, Mr. Speaker, another political strategy that ensures the people's questions are not answered, even at the parliamentary level. Well, Centerville looks forward to see if we would meet on December 8th of this year, the second Wednesday, to see if some of the questions can be answered. Mr. Speaker, things like the second Wednesday in every month is in our rule book for a reason. Division of the House, when it's called, it's clear. Every member should be notified by the ring of a bell. And if we don't have a bell, at least by notice of intention, to ensure that our democracy lives. We have been given one order after the other without table or regulated guidelines. Mr. Speaker, our democracy is at stake. Our dignity is at stake. The lives of our children and our future are at stake. And Centerville is not willing to sell them out. Democracy or dictatorship? Hidden dictatorship, fake democracy. Give you another 30 days for what? Now, if you had said to me you needed 30 more days to create antitrust laws in order to break the economic monopoly over our country and give our small businesses a real chance, I can say yes. If you had said, given you another 30 days so that you could legislate on behalf of the Bahamian people to rein in some heads of agreement, to restructure in the best interests of our taxi cab drivers and our people, I can say yes. If you said, give you another 30 days to pass campaign financing laws and to not only table a procurement bill, but debate it, pass campaign laws, demand that Parliament meets its constitutional committee obligations, answer the petitions of the people. If you need 30 days for that, Centerville can give it to you for that. This debate, Mr. Speaker, is clearly about governance. The people want governance, governance for the people. The people want governments they can trust. Governance is the issue, not the extra 30 days. Because if we trusted our governments, that would not be a problem. These extensions, Mr. Speaker, have hindered capital markets development in our country and the rights of our people to elect. But yet, it's still touted as accomplishments. Mr. Speaker, the orders continue to go on and on and on. Yet we hear nothing of the democratic processes in our country that can show value to our people and develop our capital markets. We hear nothing about school board elections, which were due in October. It's now November. We hear nothing about local government elections that were due. But yet we talk about an extension. An extension for what? I was right here. Local government, Mr. Speaker. Well, they tabled a advisory report. I think it was last week. Well, speaking about it is different than action, man. Efficacy. Action. We're not talking about anything now. We're voting on action. Nobody's voting anymore on words or promises or talks or carrots. We're not interested. Mr. Speaker, please, through you, get this House in order. We have 4 to 5 committee reports that we have not seen. The people need to know what they are voting on, voting for. The people don't even know what, and another, what this is, extension, hold on. Another extension of emergency power order again. Then you had a proclamation. Mr. Speaker, the proclamation leaves room for inadequacies in our democracy. You know, with much respect to the governor, and thanks for his wherewithal, I guess, in terms of determining we are in an emergency time. With no school board elections, Mr. Speaker, but yet we want our children, we want the grade to go up. We want to, we want to move from a D grade. No school board elections, no talk of it, nothing. The importance of school boards in legislation is so important to how we manage the education of our children. Mr. Speaker, like I said, local government, but I don't want to talk about that too much tonight, but we watch. Our people, Mr. Speaker, are voting for democracy. We're voting for the right to know. Too much we did not know. Now that we know, we have to take the responsibility for our actions and for our votes. Are we serious, Mr. Speaker, about governance? Are we serious about democracy? Are we serious about economic growth? And Mr. Speaker, are we serious? Are we serious about the protection, preservation, and promotion of our people? Our young people, to those unborn, are we serious? Mr. Speaker, the abuse of these orders is just setting a bad precedence, terrible precedence. You don't have enough governance, managerial skills to do what you need to do to ensure that your people are protected and safe, even in an environment such as this. Mr. Speaker, but I don't know. I have about 4 more petitions to bring to the House, and I don't even know if that, I don't even know, if that is where we will go with it. But the people wanted those here, so they will be there forthcoming, but not answering the people. But yet you want them to support you, your efforts. But you have no respect, a total disrespect for the Bahamian people. Not demanding that the House of Assembly, the legislature, operates democratically and independently. Mr. Speaker, without these things, this request is useless. Mr. Speaker, dictatorship is about monopolies. It's about controlling industries, controlling businesses, controlling data, controlling our lives. It's about politics and elections, Mr. Speaker. This is a lazy approach to governance. It's a lazy approach to democracy. The problem we are faced with today, Mr. Speaker, is the model of dictatorship. And I think it was last time I said the same thing, and then someone stood up and I can't remember one of the other members, but I had to put it here again, just in case they missed it last time. The problem we are faced with today, Mr. Speaker, is that the model of dictatorship may be a good socio-political model for them, but it's a terrible model for economic growth and development of a people. People's growth and development, especially in trying times such as this. Where are we going with this? Get it right. A model of true democracy, it's all we have. That's all we have to fall on. Dictatorship won't save you because come 2022, when you're not here, then what? And I've seen it happen over and over again. Then what? Did we look that far ahead? Leaders, Mr. Speaker, of these parties must be able to manage dictatorial behavior, which was actually created and patterned after a selfish model that no longer works for the people. We understand you learned the Westminster system very well, so you know how to dibble and dabble around democracy, even to the extent where you hurt your own people. Don't educate them. Don't teach them about your parliament, their rights, their votes. But yet you come in here and ask for a dictatorial resolution to be approved. Centerville says no.
What's in your view? What's in your view is dictatorial?
Yes, and that's fine.
Because I think while the chair is giving you a lot of liberty, I think the issue taken was the rule that speaks to members not using offensive, abusive, insulting. No, one second. Members using offensive, abusive, insulting words about either House of Parliament or members thereof. And while the chair is giving liberty for you to continuously use the term dictator, I think you have to be very careful how you craft it and how you present it as representing this house or any other member. So I think that was the issue. So I'm just guiding the good member to be cognizant of that.
Thank you, Mr. Speaker, and I appreciate your legal mind because you have the lawyers of us could speak in that way. But I appreciate your comments.
I just want you to be cautious. You don't want to offend any member by.
Well, I hope I'm not offending them because I'm.
Or this house.
Well, I'm speaking to a system, Mr. Speaker.
Yeah, that's what I'm saying.
A system that hasn't worked. That hasn't worked for the people. We must transition. We must transition. We must transition, Mr. Speaker. Transition. We must transition. Mr. Speaker, we must transition. And God, we have something for you over there. Don't worry. Don't worry. You can be gone. Okay, so we must transition from this hidden, now exposed dictatorship to democracy. True democracy, Mr. Speaker. Time will show that we will resent your calls for an extension. Buying time, Mr. Speaker, to control data and information while we sit idly at home, wondering where the next dollar or meal will come from. Mr. Speaker, Centerville did not support the last extension, and Centerville will not be supporting this extension. More Bahamian businesses, Mr. Speaker, would have had to close their doors, and more will. And as we are locked in our homes, our way of life, our mental state are being challenged by your inconsistent and dictatorial approach to governance. Family Islanders got a good one, boy, I can't wait. family islanders will join Team Centerville and change the very fabric of dependence to independence. Don't mind those family islanders. They know exactly what they're going to be voting for. They don't need your promises. They don't need your carrot because they should have roads and all that stuff long time. What they do need is their ocean back. They need their land and their fishing industry back. They need what their parents left them. They need what their parents left them. A people full of pride, full of dignity, full of praise. Mr. Speaker, the entire constituency of Centerville, including the Valley, Roll Avenue, Culmersville, Fort Fincastle, and Mason's Addition, Farm Road, East Street, and Grand Sound. We vote no to this request for further extension. The health of the nation, Mr. Speaker, we know. It's the wealth of our nation. Don't regulate us without educating us. Don't regulate us without educating us. So, Mr. Speaker, to God be all the glory. Great things we have done, or you could never get that narrative over. Don't try that one. The payment people know what I Mr. Sorry. Thank you very much.
Oblige. Thank you, Mr. Senator. Osmani. Oh, that's many. The chair recognizes a member for Pine Ridge. Member. I don't like my members in the gallery, you know.
Thank you very much, Mr. Speaker. I'll give thanks unto the Lord, for he is good, and his mercy endureth forever and towards all generations. Mr. Speaker, I always deem it a pleasure and a privilege to stand on behalf of the good and gracious people of the Pine Ridge constituency who has allowed and afforded me this opportunity. On such a day as this, internationally known as Thanksgiving, I'd like to thank them and to let them know that I'm grateful for their support, both physical and verbal and prayerful support that they consistently and constantly give to me. Thank you very much, Pine Ridge. By extension, the people of Grand Bahama and indeed the Commonwealth of the Bahamas. I am forever grateful with a thankful heart. Let me take this opportunity to also thank the former Deputy Prime Minister and Minister of Finance, Mr. K. Peter Turnquest, for his services rendered to the Bahamian people. I wish him well in all of his future endeavors. We've come to discuss, debate, deliberate on the extension of these emergency orders, recognizing that this is a pandemic that has never been experienced during my lifetime. This virus has set the country and indeed the global sphere in much uncertainty. This pandemic, to me, is considered another storm. It just seems to last longer and has fatigued most of us psychologically, socially, and financially. Let me make it graphically and emphatically clear. Nobody blames the government, nor are we asserting that the government is responsible for the pandemic. What we are saying, when I say we, I speak in terms of many Bahamians. What we are saying is that the government handling of the pandemic leaves much to be desired. If we are to be honest with ourselves, Dorian and this pandemic has only exacerbated the failures and in some cases, the ineptness of this government, of which I am a part of. In other words, most Bahamians will not accept your failures with Dorian and COVID as an excuse, because your performance prior to these catastrophic events was nothing to write home to mama about. Had you talking figures in here and telling us about 1 point unemployment being low and all that sounds good. It's true to you, but it's not the reality out there. So you could talk all you want, but what you say in here and what people experience out there is two different things. Had you performed better and even beyond the expectation prior to these catastrophic events, the Bahamian people would have perhaps been willing, as the young people would say, to give you a blight. The Bahamian people will not judge you on your personality, nor your personal idiosyncrasies, but they will judge you on your performance. That's what this is all about. How did you perform prior to and during? And right now, it's not looking good. You know what it say? I'm the voice in the wilderness. Remember who told you about the quicksand? And then you said I was in the quicksand with you when in actuality, I was standing on solid ground trying to throw you a rope, but you refused to take it. Now you're thinking. When I talked to you then, you was at your waist. Now you're to your belly in quicksand. That's why the Bahamian people will love me for that, because when the time comes, I will do what I need to do if it needs to be done. But they will respect me for not being one of those who was outside talking, but was inside trying to make a difference. I have always ascribed, well, that's what you said. Centerville is making a difference. I've always ascribed that the competent authority ought to based on our early experiences, be in the hands.
Order, members. Order, members. The member for Parliamentary has the floor. Please, let's respect the member. Pine Ridge. Thank you.
One of the things, Mr. Speaker, from I've been in here, I have tried to be very honest, both to the leadership, that when he walks out of a room, he never had to think twice what Pine Ridge was thinking, because Pine Ridge expressed himself. Maybe more forthright than others did, or perhaps would do. and they may have their reasons. But I want to consider myself one of the most honest and forthright persons to the leadership of this present country. There's no question. But one of the problems too, Mr. Deputy, was that oftentimes when I spoke in here, I only came in as a messenger, speaking on behalf of the people. And just what they were doing a few minutes ago, laughing and heckling and taking it for a joke, what they didn't recognize was the country was watching. And they were saying, but he talking what I saying. And when you were laughing at Matt, you were actually laughing at the people. And when you were attacking Matt, you were actually attacking the people, because the people were saying, but that's what Mac is only saying, what I've been saying. Mac is only delivering the message. So if you have a problem with what Mac is saying, you have a problem with what the people are saying.
I don't have a, he's saying.
Is that a point of order?
You rising on a point of order? What's your point of order?
Please stop, my club.
But
This could be interesting.
the member is saying that he's speaking for the people.
Can you one second, member for Charlotte. You need to just speak. Step to a mic so the Bahamas can hear you. On your point of order. And what's the point of order?
The point of order is that the member is sort of misleading not only this House, but the Bahamian people, that he's the voice of the people. The people is a generalization. The people, see that now he's now qualifying people. Now he's saying many people, which is still different from the people. Now when he speaks, when he stands and says that he's speaking for the people, it makes it seem as if that's the whole of the people of the Bahamas, which he does not speak for. Because as much as he gives his perspective and his point of view, there are many others who have differing point of views than he does. So please, Mr. Speaker, I ask the member, when he stands to speak for or qualify those people he speaks for. Because he can't be speaking for all of the people of the Bahamas.
So thank you, member for Fort Charlotte. Thank you, member for Pine Ridge. One second, Pine Ridge. Time. Yeah.
Thank you, Mr. Speaker. Let me say, I speak on behalf of the people of Pine Ridge, and by extension, many people in Grand Bahama and throughout the Commonwealth of the Bahamas. It may not be all the people, but just by extension, all the people didn't vote F&M, and all the people didn't vote PLP. Okay? So, trust me, a large portion of people, in my view,
Member for Fort Charlotte. If you notice, I intentionally didn't even. I allowed Pine Ridge to try and correct himself. One second. This is the House of Assembly. A member could stand up and speak and say that in his view, he speaks for the people. I think all of us have made such. I don't think, with all due respect, that's a point of order that this chair is going to agree with. I've paused and I allowed the member for Pine Ridge to take note without having to make a ruling on the matter. I see you're coming back to, in my view, because he seemed to be going in the same direction, but he tried to qualify his statement. And so, with all due respect, a member for Charlotte, the chair does not see the point of order being raised against the member for Pine Ridge. And that's the ruling of the chair. On your guided Pine Ridge.
Thank you, Mr. Speaker. I've always described that the competent authority ought to, based on our early experience, be in the hands of more than one individual. One man having all this power in his hand, which appears to be dictatorial, whether intended or not, is not the perception by most, in my opinion. It is not a good position to be in a democracy. And let me also talk about what I would call dishonest intellectuality. The competent authority by the Constitution is one man, not the cabinet of the Bahamas. Regardless what you tell me, it's not the cabinet of the Bahamas. Now that we're in hot water, now we're including the cabinet. Prior to that, there was no cabinet included when all the decisions were being made. But as far as if they were, certainly the competent authority did not include. Let me finish the statement before you point about. Certainly,
the member, the chair recognizes the member for sub-insurance.
Mr. Deputy Speaker, I'm concerned that the member is misleading this House and suggesting certain facts that we all know he is not privy to. He's talking about what happens in cabinet and who's consulted in cabinet and who's not, and he's not privy to that. So he must not give the impression that he is privy to that.
Mr. Speaker,
Member for Pine Ridge.
that's not what I'm trying to allude to. I'm simply saying, and this is in the public domain, and that's why it came up. This discussion based on the competent authority making all the decisions was always an issue. Recently, it has been said that the competent authority is not making the decisions, but the decision is now being made by the cabinet. It might be so that the competent authority and the cabinet are discussing matters as it relates to some of the decisions of the competent authority. But prior to that, we never heard that. We just recently now heard that, where this has come to the public domain.
And remember, you're not providing information, or you're not attempting to provide information to the Bahamian people on this parliament.
The Emergency Power Act.
And the speaker is speaking.
Oh, sorry, Mr. Speaker.
Yeah, the point I think that the member's trying to make is that he's saying that you cannot be putting information out there as if you're privy to the information through as being a member of the cabinet. And I hope you're not doing that.
No, sir. No, sir. Neither is it my intention to do so. But it is my intention to remind the public, because of conversation that was made in the news lately, it is my responsibility to remind the public that according to the Constitution, that the competent authority means the Prime Minister, according to the interpretation of the Constitution. Whether Exuma passed it to me or you handed it to me, it is the Constitution. I don't care who handed it to me. The Lord Jesus Christ was the chair recognizes. It is what it is.
Can the chair recognize the member for Southern Shore?
Mr. Speaker, Mr. Speaker, the member for Exuma would have been invited to and attended a meeting where the cabinet was being briefed on matters that later the competent authority spoke to. So the good member from Exuma is aware of the process, and he wouldn't utter what is being said by Pine Ridge.
Carry on, Pine Ridge.
This is the regulation under the Emergency Powers Act, Chapter 34, Clause or Interpretation 2, competent authority means Prime Minister. All I'm simply trying to is to inform the public that regardless what is being said, there is not a grouping that might be perceived to be represented as if a grouping is making decisions. Decisions are being made by the one man, the competent authority. That's the point I'm trying to make. Okay? And that is what I'm speaking to. Or you can challenge it. You challenging the law?
One second, Southern Shores. 1 second.
You challenging the law?
Members. Southern Shores. Southern Shores. Members, we're not gonna get in this frenzy this evening. All right. The member for Pine Ridge has made a statement, and I think he's trying to justify his statement. The member for Southern Shores is objecting on a point of order. The point was raised, put to the member of Pine Ridge, and I think the member of Pine Ridge was whatever information he got, how he got it, it's not important. Again, I think the member for and before you stand, I think the member for Southern Shores, you were saying you were making a point of order, but it was getting all.
My point of order is the member for Pine Ridge is suggesting that the decisions that are being made and uttered or enunciated by the member for Kalani are not decisions of a body, that they are individual decisions. That's exactly what he said.
Members, I think the member. What do you say? The member for Pine Ridge, in the chair's view, and for where I sit, the member for Pine Ridge is making his own assumptions of what he feels is being said to the public and what he thinks is reality. The member for Pine Ridge has given information to this House and the nation based on the definition, I think, with his reasoning, what was used as a competent authority. And the member is saying, in my view, that from what I heard, that it was said that the competent authority initially was in the hands of the Prime Minister, and now is being taunted that it's in the hands of not only the Prime Minister, but the Cabinet. And he's giving his views on that. And he substantiated with his definition, I think, that all of us got in this House. And if that's his view, the chair is going to allow him to make his point. But notwithstanding that, Pine Ridge, again, the same point I was raising to the good member for Senator, just be guided in where you're going and how you share it. Because I understand, the chair understands what you're saying. And just be guided in what you present. And more importantly, do not try to, as the member for Southern Shores has rightfully indicated, don't try and put into the minds of the House or the people things, comments about what is done and said in the Cabinet if you can't, obviously you cannot substantiate that. Let us carry on, please.
Thank you very much, Mr. Speaker. And so my objective here is to just basically educate the public as to what I believe the competent authority is and the function that it relegates.
And that's your belief?
That's it.
Okay, fair enough. Let's carry on.
Okay.
But don't mislead. Let's carry on.
Okay. I've always believed, I think I've indicated that. I've watched and listened fervently as the government would say, we're in this together. But yet every time the government gets up while calling for unity, it would take a personal attack shot at the leader of the opposition and others who do not share their same view. If you want unity, then you should have a unilateral participation, even by those who oppose your governmental view. You cannot call for unification on anything while leadership simultaneously divides. This is a time that we should all work together. Put our egos aside, our politics and colors. But he who wants friendship must first be friendly. One of the areas that many Bahamians fault the government for, particularly during the state of emergency, one of the areas that many Bahamians fault the government for, particularly during the state of emergency, actually They accuse you of this prior, but the issue is this state of emergency. What the Bahamians don't seem to have coming from its government significantly enough is proper planning and a sense of direction as it relates to this pandemic and the state of emergency. There seems to be a lack of direction, no compass, an action to a reaction. We seem to be ad hoc in our approach. The government seems to be operating like people in a dark room and in an unfamiliar territory. There is a cry by the wider community saying to its government, lead so we can follow. A leader doesn't have to know anything, but a leader doesn't have to know everything. But a leader will find the people. I think this is very important, even though I'm trying to be distracted, Bahamas, through you, Mr. Speaker. A leader doesn't have to know everything, but a leader will find the people who do know and place those people around them to get the job done for the benefit of its citizenry. And the people who know, don't have to like you. Be a part of your political affiliation or of your personal class. Because those things don't matter when it's about your people and your country. From March 2020, we have given the competent authority power to shut down and open up at his will. Our civil liberties have been arrested. This is the closest some of us will ever get to prison. And in many instances, we have taken the competent authorities' word without any national scientific data to support many of these emergency orders. In other words, because we Bahamians can be passive at times, we trusted you in the beginning and took you at your word. We are now suffering with lockdown fatigue and phobias. And hence, many people are now concluding that the competent authority seems more comfortable with the title and position than that of Prime Minister of the Bahamas. There is absolutely, unequivocally no question that our economy has been injured, taken a beating, deprived, and badly shocked by this global pandemic. I have for some time prescribed that the government needs to show the country that they can walk and chew gum at the same time. And let me say it again. I have for some time prescribed that the government needs to show the country that they can walk and chew gum at the same time. What do I mean by this? And no, the opposition does not give me talking points. And unlike many of you in here, I write my own speeches. I don't have a secretary or a PS to write my speech. These are my words. The government should be able to protect lives while simultaneously seeking to preserve the economy. The government has a responsibility to protect its citizenry and afford them the best possible health care and protection during this pandemic. And you do so by ensuring that all health facilities are readily able and available to receive patients, make sure that our healthcare workers have proper PPEs, educate the public about the virus, and how to avoid the virus, more testing. You know, and I'm not asking you what I think, I'm telling you what I know. In Grand Bahama, there were nurses who were around people who had COVID, and they weren't even being tested. They were just told, go home for 2 weeks. They weren't tested, and they're healthcare workers. I don't need to tell you when, note the fact that it happened. And all of this should be done by public announcement, government announcement, parliamentary announcement, rightfully so. When talking to us, give us the facts along with scientific evidence. Don't tell us we can't go to the beach and then tell us it's good to be in open air to avoid COVID. You tell me I can't go to the beach. How many people contracted COVID on the beach? You just shut it down, but you give me no scientific facts as to why and how. Don't tell me our children. And this is very important to me, you know, because right now, many of our children in this country are out of school, not getting the education that they should get. You tell me our children can't go to school to learn, but yet you turn around and tell me there's a hotspot for children to congregate to get online. So then you might as well, if you could, go to school. You tell me I can't travel. You tell me I can't travel to America or Canada. But they're free to come to us from where the numbers are much higher. Don't tell me. So what you're telling me is, and I want you to see, because when I speak in here, I try to make it plain so that Mama and Papa down in Athens and Crooked Island, and down home in South Andros and Centerville, and the people in Pine Ridge, okay, that they all understand. Don't tell me I can't go because you feel I'm not responsible. Don't tell me I can't go to catch COVID, but COVID could be brought to me. And you perhaps would love me to go. Probably without a mask too. We must teach our people and believe in our people to be responsible. That's the point I'm trying to make. Don't tell me, performance through you, Mr. Speaker. Don't tell me I could only have 10 persons to my wedding. And then when I look in the paper, you got 10 groomsmen standing. And I haven't seen the bridesmaid and the guest yet. It was dealt with because it was made public. And that's only what we were exposed to in public. What about the things that took place we have not seen? That's the point. I bet that. I bet that. But you tell me I could go to church. You tell me I could go to church, but yet people can't bury their loved ones decently. You tell me only 10 people to a funeral, but the man got 15 children. In other words, there can't appear to be one set of rules for one set of people, whether intentional or not. The perception and the optics on this is not good. Tourism is our bread and butter presently. By now, we ought to have been seeking ways for diversification. However, my concern is the numbers have been pretty low since our borders reopened. What's the use of opening hotels that can host 3,000 people, but only 30 family in it? This is the quagmire that we might find ourselves in. What if our numbers don't return until 2022, which is very practical? The government must seek to revive the local economy. We have to have, in my view, a self-participatory economy. The economy cannot be revived with businesses and people being locked down, government offices hardly functioning. Gyms have basically become bankrupt by this state of emergency. Foreclosures on homes have escalated. Tenants are being evicted daily. Thousands have not worked since March. And the state of emergency and the competent authority don't seem to speak to these issues as it relates to the Bahamian people. A major politician said in this country years ago, I could call his name. So Lyndon said it. He said, if it's important to the people, then it's important to me. And that's what parliamentarians and politicians need to recognize in this country. What's important to the people ought to be important to you. And what's important to you, if it ain't important to the people, it really don't matter to them out there. And they can let you know that when the time comes. I say nothing mean about that man. Not that man. Not that man. I might have said some things about some other people, but I say nothing mean about that man. I respect that man because many of us are sitting up in here because of that man. Don't put no words in my mouth. My recommendation is to fully open the economy. Mr. Speaker,
members. Order. Swallow short. Members, Prime still have the floor. Carry on, Prime, please.
My recommendation is to fully open the economy. Put people back to work. If a restaurant can hold 100 people, tell them they can only host 50. If the bus carries 30 people, tell them they can only carry 15. Open the stores. Tell the people there can only be a limited number in the store, including the employees. Emphasize mask wearing, social distancing, and sanitization. You say what you're doing, but when I drive on Bay Street today, it was empty. Empty. No, we don't need tourists. Open the economy. Open up those stores, and guess what? We will have sales for Christmas, and they will all of a sudden
Order, members.
to purchase.
Order, members.
The government, in my estimation, when it brought the emergency order into effect the first time, should have made provision to bring legislation to bear to this place to cease mortgages and rental payments for a period of the emergency order. This would have been far more beneficial and would have put people in this country in a better position. When you locked us down, you should have considered mortgage and tenants and bring legislation and cease. As long as there is an emergency order, there should have been a desist order of mortgage, rent, and interest rates. As Solomon said in one of his writings, let's hear the conclusion of the whole matter. This is really about the preservation, Mr. Speaker, As Solomon said, let's see the conclusion of the whole matter. This is really about the preservation of our citizens, health, and the Bahamian economy. A balancing act that has found itself wanting. Our numbers from the health perspective, COVID-19, have been one of the highest in this region, and the economy has us in fear and trepidation. And I tell you, Bahamas, if we ever needed the Lord before, we sure do need him now.
Amen, brother.
Let me see if I got this. The competent authority closed down the businesses, stopped the people from working, won't allow us to bury our loved ones in decency, closed down and paused. I think it's atrocious as to how we handle the late Honorable Darrell Roll, a former member of Parliament who have contributed in this place. And I asked myself, what if it was one of the members in this place? Things that make you go, I gave my regards, Satan. That was wrong too. No, you brought it to my attention. That was wrong too. A former, well, okay, you brought it and I'm telling you, what they did to John Lee Ferguson, a chairman and a former senator, was also wrong. But he allowed some other people to slip through the cracks. And they didn't serve the nation in the capacity as these men. So telling me that don't make you look no better. Close down. So let me get this straight. The competent authority closed down the businesses, stopped the people from working, won't allow us to bury our loved ones in decency, closed down the restaurants where people work, closed down the gyms, passed no law for me or you to pay our rent or mortgage while being unemployed. So everything the Bahamian people are suffering today, we could blame COVID-19 and the competent authority. So what you're asking Pine Ridge to do is to give you the ability, if need be, to lock down again, to preserve health as we continue to move towards economic ruins.
Let me give you two extra minutes.
Thank you, sir. Pine Ridge
No more than
suggests
two.
that you find a way to put emphasis on both the health and the economy rapidly and vigorously. Because in my estimation, from where I sit and stand, it don't seem like it's going to get better anytime soon. Pine Ridge and the Bahamian people will follow if you tell us where we're going and how we intend to get there. Until then, Pine Ridge does not support the extension of the emergency order until we can find balance between the health and the wealth of this Commonwealth. Pine Ridge rests. Much obliged, Mr. Speaker, and thank you, Exumo.
Thank you. Thank you, Pine Ridge. As many, the chair right now recognizes the good member for Golden Gates.
Was in a state journal, which was inside the journal. And if you could have had the video, if you could have the video, you could have the state. But that goes straight to your cause. The more you talk, the more you speak.
Order members. The chair recognizes the member for Golden Gates.
Thank you, Mr. Speaker.
Members. The house is a little bigger in terms of the chambers. So speaking from the front of the house to the back of the house now, former gallery, creates an issue for the chair to concentrate on what's being said, and preside properly over the house, and it's more and equally important as another member who wants to speak, particularly when members had the opportunity to speak and others will have the opportunity to speak too. The chair now recognizes the member for Golden Gates.
Thank you, Mr. Speaker. Mr. Speaker, I rise on behalf of the wonderful and resilient people of the Golden Gates constituency, and I thank each of them for the honor and privilege they have afforded me to represent them and their best interest in this honorable chamber. And I thank the Almighty God. Mr. Speaker, before I move to the resolution, sir, with your leave,
I should like to extend my deepest sympathies to several families in my constituency whose loved ones passed away recently. We lost a cultural icon, Mr. William Ramming, a member of the Ramming Brothers, who we all know well. And we all know that song so well, Who Will Fill Those Shoes? One of our best known gospel singing groups. He passed away several weeks ago. Mr. Ramming was the second eldest of the brothers. For his wife, Mrs. Deanna Ramming, of 51 years marriage, and the entire family, I know that it has been difficult, especially given his untimely death, as he's returning home to Nassau from his birth home in Cat Island. They have been long-time residents of Golden Gates too. They've been living there for over 40 years. To the family of retired Chief Inspector Henry Bain, who worked on the Royal Bahamas Police Force for about 30 years, especially to his wife, Mrs. Agnes Bain, of 49 years marriage. They too have been longtime residents of Golden Gates and Golden Gates 1 for more than 40 years. To the family of David Jonathan Bethel, especially his wife, Susan Bethel, of more than 50 years, and the entire family, especially his son, my good friend Jeff, a former F&M Council representative for Golden Gates for more than a decade. The Bethel family also have been longtime residents of Golden Gates 1 for more than 50 years. Also, I join my colleagues in extending my deepest sympathy to the family of Mr. Oswald Ingram, former member and speaker of this honorable House, and former acting Governor General. I also joined the honorable member for Southern Shores and the Minister of Social Services and Urban Development in extending my deepest sympathy to two employees of the Department of Social Services, Ms. Ellery Seymour and her family on the passing of her father, and to Betty Williams, who lost her son just last week Friday, and her mother several weeks ago. May all of their souls rest eternal, and may perpetual light shine upon them. Amen. Mr. Speaker, I should also like to join my colleague who last week congratulated Ms. Marion Bethel, noted attorney at law and author, on her election to the United Nations Committee on the Elimination of Discrimination Against Women, known as CEDAW. She has been, over the years, on the forefront, a steadfast and committed advocate on women's issues, especially equality for women. We are thankful for the work of the Minister of Foreign Affairs, the Honorable Member for North Abaco, and his team at the ministry for their part in making her election a reality. In the same vein, as was said last week by both the Honorable Member for North Abaco and the Honorable Member for Angliston, we thank our brothers and sisters of Caricom, who were very supportive of Ms. Bethel and in a real way made it happen. We cannot thank them for their critical support enough. Mr. Speaker, it is a major personal accomplishment of hers, and one we can all be proud of as Bahamians. I wish her all the best and success in her new role working on women's issues at such a high level on the world stage. Mr. Speaker, I now move to the resolution. Sir, we continue to be deeply saddened and concerned about the families, now 163 of them as of Tuesday past, who have lost loved ones due to this virus, COVID-19. Our hearts go out to them, and we pray that they enjoy God's comfort, peace, blessings, and strength as they cope with these great days of loss, distress, and challenges. Mr. Speaker, while our number of lost souls have sadly and most unfortunately risen from the first wave of 11 on the 1st of July 2020 to now 163, as just mentioned. Importantly, though, those 11 deaths represented a mortality rate of almost 11%. Almost 11% in the first wave that we now call successful. However, our mortality rate as of Tuesday past, Mr. Deputy, was around 2.18%. That is a 500% improvement in the mortality rate since the successful response that we all say to the first wave. A 500% reduction. Thank you. Mr. Speaker, put another way, and this is alarming, frankly, it is alarming. Put another way, if we were still at the mortality rate of, let's say, 10%, but we knew it was closer to 11, as we were at the end of the successful response to the first wave, now with 7,469 confirmed cases as of Tuesday, we would have had a mind-blowing and truly unimaginable 746 deaths. Had we maintained the same mortality rate in the first wave that we said it was successful, had we maintained that now at the amount of confirmed cases, Mr. Deputy, we'd have had 746 cases. As I said on the 26th of October, Mr. Deputy, just about a month ago, we are making good progress. We are on the right track and we are moving in the right direction. That was a month ago. And as I said then, the facts bears that out today. We are indeed making good progress. We are on the right track and we are moving in the right direction in our fight against this virus. And by God's grace, we will defeat it. Mr. Speaker, during the debate on the resolution a month ago, I said that our COVID-19 recoveries were going in the right direction. They were going up. The recoveries, people leaving the hospital from being hospitalized and persons no longer having COVID was going up. There was a clear and unmistakable trend in the right direction a month ago. A month ago. Therefore, I'm very pleased to say, as we heard earlier, the numbers from the Honorable Minister of Health and the Member of Parliament for Bamboo Town, as he said earlier on, I am very pleased to say that the trend has continued over the past month. Recovered cases were at about 62% on the 23rd of October. But as of Tuesday past, just 2 days ago, the recovery rate was almost 77%. And the Honorable Minister said that also early on when he spoke and when he seconded this resolution. That means that about 15% of the confirmed cases recovered over the past 4 weeks, pardon me. That means 15% of the confirmed cases recovered over the past 4 weeks. 15%. Mr. Speaker, that is good progress. Being on the right track, going in the right direction. Imagine 77% of all the confirmed cases from day one. From the first day, From the first case we had up to Tuesday, of all the cases, 77% have recovered. But there is more good progress to report, Mr. Deputy. Active cases on the 23rd of October were at 35.73%, or 2,290, of all the confirmed cases at the time. As of Tuesday past, active cases were down to about 20%, or 1,518. An Honorable Minister reported that number's even dropped as of yesterday. The number of people who are active with COVID-19, as reported by the Ministry of Health on Tuesday past, reduced by about 15%, or 772 people. 1 month, almost 800 people less now have COVID. Mr. Speaker, put another way, 15% or 772 people fewer now have the virus compared to just 4 weeks ago. We are making good progress. We are on the right track, and we are going in the right direction. Mr. Speaker, there's still more good progress to report. Being on the right track and in the right direction. Still more. Hospitalizations, and the Honorable Minister, the member for Bamboo Town, made this point earlier as well. Hospitalizations on the 23rd of October was a relatively high number. And I acknowledged that at the time of my contribution on the last occasion. It was at 110. It was at 110 on the 23rd of October. However, as of Tuesday past, just 2 days ago, the Ministry of Health reported that hospitalizations were down to just 19. 19! In 4 weeks, from 110 down to 19. Imagine that, Mr. Speaker. Down from 110 in only 4 weeks. And as a percentage, down from 1.72 of the confirmed cases to, listen to this, 0.25 of a percent. And that means that is a quarter of 1%. Not even a half of 1%, much less a percent. Put another way, Mr. Speaker, 91 fewer persons are hospitalized compared to just 4 weeks ago. 91 fewer people are out of the hospital than 4 weeks ago. 91 people are no longer in the hospital who were there just 4 weeks ago. And it is noted, only one person of the 19 hospitalized as of Tuesday past was in the intensive care unit. Just one. Just one. We are making good progress. We're on the right track, and we're moving in the right direction. But there's even more, Mr. Speaker. Even with tests that we hear so much about from the side office there was good progress there too, being on the right track and in the right direction. On the 23rd of October, tests were reported as being 34,088. 4 weeks later, Tuesday past, the Ministry of Health reported 42,254 tests were administered. While the increase in tests was not as robust as the September to October, and that is true, nonetheless, it was still strong at an increase of 24% in just 4 weeks, or an increase of 8,166 in just 4 weeks. Mr. Speaker, put another way, about 11% of our population have been tested. Given that our population is estimated to be about 390,000, we are making good progress. We are on the right track, and we are moving in the right direction. Mr. Speaker, the side opposite made a lot of hay during the last debate on the 26th of October about the rising numbers of confirmed cases. They made a lot of hay about that. That was a big thing. Even that number, too, shows good progress, despite the rising numbers. Despite the rising numbers, there's good progress to report. As I stated during the last debate on the 26th of October, the Ministry of Health reported that as at the 23rd of September, confirmed cases totaled 3,618. And on the 24th of October, they reported 6,410 confirmed cases. However, Mr. Deputy, and this is what's important, the dashboard this past Tuesday, the 24th of November, reported a total of 7,469 confirmed cases.
Member for Golden Gates, respectfully, can you yield to the chair, please?
Pardon?
Can you yield to the chair?
Yes. Thank you.
The chair recognizes member for Southern Shore.
Mr. Deputy Speaker, I rise to move that the business of the House proceed beyond the 7 o'clock hour.
Do I have a seconder?
Second.
It's being moved and seconded that the business of this House proceeds beyond the 7 o'clock hour, PM hour. As many members are in favor of being seated, those opposing will rise. The business of this House shall proceed beyond the 7 PM hour. Chair, now, thank you, member for Golden Gates. Recognizes again the member for Golden Gates.
Thank you very much, Mr. Deputy. Thank you very much. So I'll just repeat that. And on the 24th of October, the ministry reported 6,410 confirmed cases. However, Mr. Deputy, the dashboard this past Tuesday, the 24th of November, reported a total of 7,469 confirmed cases. Now, one might ask, where is the good progress in that? Mr. Speaker, we can see from the numbers above that from the 23rd of September to the 24th of October, the confirmed cases increased by 2,792. So September to October, 2,792. Now watch this. We can also see that from the 24th of October to this past Tuesday, 2 days ago, which was another month, the 24th of November, the confirmed cases only increased by just 1,059. Put another way, the rate of increase over the past month dropped from 2,792 of new cases to 1,059 new cases. September to October was almost 2,800 new cases. And October to November was just over 1,000 cases. We are making good progress. We are on the right track and we are moving in the right direction. Mr. Speaker, let me say too about the number of tests administered. As Dr. DeLon Brennan, Deputy Chief Medical Officer, made the point some months ago on a radio show, and I am paraphrasing, that whatever your view about the number of tests administered, if the number of hospitalizations are down, if recoveries are up, etc., those are objective numbers. They are beyond question and supposition. Those are hard numbers, and those matter most because they represent a true barometer as to the level of response to the virus. Those numbers say how well we're responding to the virus. That's the point he made. The Deputy CMO, Dr. DeLon Brennan, he made that point on a radio show, being asked about that very question. Mr. Speaker, in that regard, the true barometer regarding the level of response to the virus as of Tuesday this past is as follows. Confirmed cases going down over the past 4 weeks. Recoveries going up over the last four weeks compared to the prior 4 weeks. Active cases going down. There are fewer active cases over the last 4 weeks compared to the prior 4 weeks. Mortality rate, as we said a moment ago, going down from 11% down to 2.18. The last 4 weeks, in fact, even compared to the prior 4 weeks. Hospitalizations going down last 4 weeks compared to the current 4 weeks. And ICU, as a subset of hospitalizations, are down from 8 to 1 in the last 4 weeks. Mr. Speaker, during the debate on the last extension on the 26th of October, the honorable member for Cat Island, Rumkeys, and Salvador, the leader of the opposition, aided by his deputy, the honorable member for the Exumas and Ragged Island, made a big to-do about the Global Coronavirus Index, otherwise called the GCI. And as he said then, we were at the bottom of that listing. He said we were at the bottom of that listing. Upon close examination, he said that we were not in the last position at 184, but in fact, we were at 183, one before the last. The Speaker, the Honorable Leader of the Opposition, seemed to have been assisted by his deputy who gave him the said numbers from his phone. There was no document laid to support the assertion, but, Mr. Deputy, I took no issue then, and I'm not taking any issue now. I'm not. However, Mr. Deputy, following that debate, I had an opportunity to check the said GCI site, which I became aware of on that occasion, the prior occasion, and discovered that it indeed indicated at that time, on the 26th of October, that we were in fact ranked just one above the lowest at 183. That is exactly what it said. Mr. Speaker, more progress though, more progress. Demonstrating that we are on the right track and in the right direction. That very index, Mr. Deputy, I need you to follow me carefully. That very index, the GCI, that the Honorable Leader of the Opposition, assisted by the Honorable Member for Exuma and Ragged Island referred to, in order to support their contention that we were 183rd in the world. As to our coronavirus response, sir, GCI reports, as of today, the 26th of November, the report today. And like he said then, he told me, now I'll say to him, you can go and check it. That we are now in the 138th position in the world. And you can go check it. And you go check it. God is good. And further, the report indicates that our position on the GCI today, and listen to this, and Ms. Debbie, I want you to get this, and I want to bring people to know this. Because it was a big deal last time. We were at the bottom. One from the bottom. That's what they said we were, and you know what they did? I didn't question it then, I don't question it now. I use the same site they use, the GCI. And you know what it says now? It says that we have improved our positions by 42. We are up 42 positions in 30 days. The same site. The report that they used on the last occasion says that as of today, we have improved 42 positions on the index. Mr. Speaker, even the global coronavirus index, I decided opposite advance in this chamber a month ago to show that we were one spot shy of the worst in the world. Now reports too that we are making good progress. But sir, that should come to no surprise to anyone, given all of the improving matrices mentioned a moment ago. That should come to no surprise to anyone. And Mr. Deputy, if I might, I have that report here. I brought that report. I'm not speaking from a phone. Yeah, absolutely. And I have a copy for you as well. This is the report, and I'd like to table this, Mr. Deputy. And I have a copy for the opposition. I have a copy for the clerk. I have several copies, and just so that we can go through it, you can see. And oh, absolutely. No, this is not from a phone. None was laid. This is. So I'm so thankful for the information last time. Thank you. So here you will see it's numbered from 1. Number 1 here goes straight down, and it goes to 5 pages. And the index now has 180 instead of the 184 as it was then on the last occasion. And this is 180. And where's the Bahamas now? The Bahamas now, as I said, right here at the bottom of this listing on this page 3 of 5. We're no longer on page 5. We're on 3 now. And on this page, we are at 138. And what this index does, because, people should be aware of this index. It's a lovely index. You know what it does? It rates every country every day. So they compare your movement up or down to the other country's movement up or down. It's current, and it's every day, and it's live. And so it says here, and this is the 30-day report now, it says that we are now today at 138, but there's a green arrow pointing up. You know what it says next to it? 42. We're up 42. 42 in 30 days. And I'm happy, absolutely, to share this with the House.
Order that the documents be brought up.
Thank you, sir.
What's the document again, member
Yes.
for Golden Gate? Member for Golden Gate, what's the document again?
This is the global infection trend full GCI ranking. Yes, it's the same document they referred to on the last occasion when they say we were 183rd, and they were correct. Absolutely. Just today. This is as of today. As of today. No, you can't argue today now. Exactly. Yeah, and we give them a copy.
What are the document be brought up?
And pass the copy there. Pass the copy there. Okay. We have done this thing. Mr. Speaker, as I said in this honorable chamber a month ago.
1 second, go ahead.
My apologies.
What are the documents do lie on the table? Thank you, Onion.
Undisputed. Thank you, Mr. Speaker. As I said in this chamber a month ago, and now we have it confirmed by the same worldwide ranking that is recognized and accepted by the side opposite. Same one. They accepted it, and they accepted everything about it. That we are in fact making good progress on the right track, and we are moving in the right direction. Mr. Speaker, despite the clear, undeniable, and definitive and definite good progress that some want to deny, others might ask the question, from the Bernie Mac movie. We're talking the Bernie Mac movie now, hold on. Of the same name. Are we there yet? Some might ask that question. Because such good progress has been made. Exactly. Well, sir, the short answer is no. We have not arrived at where we want to be. But in the same way, Bernie Mac was driving the car on that long road trip, making progress towards the destination. Every time the question was asked by the young child in the back seat in the movie, we too are making progress on a long trip. A trip just over 8 months long now. And no, to answer to the question, we are not there yet. But good progress is being made, just like in the movie. We are on the right track or on the road, just like the movie. And we are going the right direction, just like the movie. Mr. Speaker, we owe a great debt of gratitude to our health care professionals, each and every one of them, at every level in the system and on every island and key in our country. We cannot thank them enough, Mr. Deputy, for as I said a month ago, they are doing yeoman's work and a Herculean job for the benefit of us all, at great risk to themselves, their families, and indeed their friends. They have been literally on the front line, in the ditches, in the trenches, being the first to charge at the enemy of us all, COVID-19. And sadly, Mr. Deputy, taking incoming fire and suffering casualties, as we have seen. We know, Mr. Deputy, there are persons in the healthcare of all of us who have lost their lives. They've taken casualties. Most of us are not on the front line, being the first to charge, nor are we the first in line of defense. When one is hospitalized, they are. They're on the first line of defense as well. That is why we must all, as best we can at all times, continue to follow the protocols to bolster and support the front line and the defensive positions of all of our healthcare professionals. I applaud them, I commend them, and I thank them, each and every one, sir. I also commend the Minister of Health, the Honorable Member for Bamboo Town and his team at the Ministry. I commend the Prime Minister, the Honorable Member for Kalani and his cabinet colleagues. Mr. Speaker, finally, I want to commend the Bahamian people. Most of all, it is the people. As I said last month, it will take a collective effort. All of us working toward a unity of purpose, working together to defeat COVID-19. And by the grace of the good Lord, that is what we are all doing for the most part. Mr. Speaker, having come this far by the grace of God, we cannot now put in jeopardy the success we have had. We cannot now throw caution to the wind. We cannot now risk it all We cannot now abandon the good progress. We are not there yet. We are not out of the woods, as the minister also said. Especially, Mr. Deputy, with the Yuletide season fast approaching. Mr. Speaker, while we have made good progress on the right track and are going in the right direction, we are grateful as a people. And there is collective commendation, collective, for all of us. The reality is, though, we still have some challenges, particularly with large gatherings. And the Honorable Minister said that as well. I just have 2 pages, if you may. Thank you very much, sir. Thank you. And we still have that challenge, sir, with the citations in place. We still have that challenge of large gatherings. Let me say this again, with the citations in place, sir. And knowing that we are still under the emergency orders, we still have that challenge. Imagine if we were not under the orders and they simply did not exist anymore. I shudder to think where we would be. Mr. Speaker, we need to be careful and cautious that we do not send the wrong message, that it is over, it is done, the virus is defeated. We must be careful not to send that message. It is not so, winter not there yet. Not to send that message that there is no longer need to follow the health protocols. We cannot send that message. We cannot say, do not wear your mask. We cannot say, do not wash or sanitize your hands thoroughly. No, we cannot say that. No. And we cannot say, do not physically distance. We cannot say that. We cannot say that by not extending the proclamation of emergency and emergency order. Because that, make no mistake, would be the message. That is the message our people will get. That is the danger in not extending. And that would be utterly, utterly disastrous for us all. Mr. Speaker, as I said on last occasion, no army goes to war without its entire arsenal available. Imagine a country sending soldiers into battle without guns or with guns but no bullets. And imagine going into that same war, but leaving the tanks at the base or dispensing with the bazookas. When a country goes to war, it goes with all it has at its disposal. We should do no different. Mr. Speaker, lest we forget, we are still at war and we need the extension of the proclamation of emergency and emergency powers orders in our arsenal to fight COVID-19. It makes little to no sense to leave it here in this chamber when this debate is finished. That would be grossly reckless and irresponsible, a dereliction of duty and a betrayal of the people on our part should we do that. Sir, I fully and wholeheartedly support this resolution. May God bless the Commonwealth of the Bahamas. Thank you. Thank you.
Thank you, member for Golden Gates. As many. The chair now recognizes the good member for Angliston.
Thank you, Mr. Speaker. Speaker, I am privileged yet again in 2 consecutive days to stand in this place on behalf of the good people of Angliston. I want to say to them and pledge to them my full support for them. I stand with them. I am their gatekeeper in this house. And I again express my gratitude for them giving me this privilege of being able to stand on their behalf. I won't be long, Mr. Deputy. The member for Cat Island, Rumkey, and San Salvador has made the case. He was our lead debater. I just want to add a few points. But before I get to those points, I want to say to the member for Golden Gates, who circulated the GCI ranking of states, I think he said that initially when it was brought to this house, we were, and this member's opposite raised it. Actually, it was raised in the media. If you go and Google it, you'll see the Guardian, the Tribune. This is a matter of public discussion and record. It's not a political issue with the PLP. Bahamians are intelligent and they assess what's happening in their country, and they make, and the media has a role in informing and educating what the issues are. So this is really where the alert for me came from, because it's in the media houses. We were 183. But I looked at this, what you sent to us, and I want to make 2 points about this. But let's look at some of the countries on this list. Cuba is number 8. I'm talking about in the region now. Cuba's number 8. Barbados is number 36. Trinidad is number 44. Dominica is number 64. Antigua and Barbuda is number 85. St. Vincent and the Grenadines is number 96. Jamaica is number 99. It appears to us from our quick review of this document, which is just being circulated, that the only countries behind us in the region are Belize and Haiti. But I want to make another point, though. The reason why
Your rights
it's a
on.
point of order, because I mean, you had more than your time, you know.
On 1 second, if he rides on the point of order, what's the point of order?
What's the point of order? Mr. Misleading. I was not gonna go there. And my contribution.
It's your
But
document.
seeing that the honorable member has gone there, the leader and the member for Cat Island said when he made his contribution that there was no country that was worse than us in the Caribbean. He said there was none. And here we go now. Now we have the honorable member for Angleton showing and demonstrating that in fact there are countries in our region that are worse than us. And I'm so happy. I'm so happy for that. I'm so happy for that. And you know what? And we must be careful. We must be careful, Mr. Speaker, not to mislead, because it is an index that has countries going up and down on a regular basis. And that's the point I made. And the point is that we have moved from where we were. We have to look at our progress based on where we are and where we're going. And so we don't want to mislead the people. We don't want to mislead the people, Mr. Deputy. We don't want to mislead.
This member had his time and more. Allow Angleton to speak, please. You circulate this document, I'm seeing it for the first time. You saying it's shifting and doing all these things? I don't know. You circulated this. And you're saying now, we are now looking at this and we're saying that the only countries at this point, we don't know what it was at that time, because the claim at that time was that we were near the bottom. But on this occasion, we're saying, maybe we might be saying progress.
All right, Golden Gates.
Yeah, calm down, Golden Gates. We may be saying progress in Haiti and other countries. But I want to make another point, okay? Because we have to appreciate that, the Bahamian people are able to analyze and to make discerning assessments. Now, I put this to you, Mr. Speaker, Mr. Deputy. In July, when we went through all of those shutdowns, like 3 months, it was rough. It was very rough. I mean, you couldn't go to hairdresser, you couldn't do nothing. It was rough. I mean, rough for me, my hairdresser, but I'm just saying it was rough and whole. People couldn't work. Businesses were shut down. It was a very, very, very difficult time and a great deal of sacrifice. I know, because there was no food program. Hello? No food program for people. I had to kick in as a member of parliament to make sure people had something to eat, because they were out of work. The hotels were shut down. They were out of work. And there was no food program, nothing to assist workers who are out of work with not a dollar. But in any event, I'm telling you, the sacrifice was great. July, we opened. The numbers were almost non-existent. That's where we got, from that sacrifice. But how did we get to 189 or whatever it is? Or even, let's take your numbers, Golden Gates. How we get to your numbers? How we get, and you're actually celebrating us digging ourselves out of a hole. And the reason we found ourselves in that again is because of the missteps of this administration. And I don't want to point fingers, but I don't want you taking credit without having an honest analysis of how this country got where it was. I'll give you an idea of what you did. You opened the borders. You allowed people to travel for 72 hours.
All right. Golden Gates.
I mean, no one interrupted Golden Gates, Golden Gates, you take it easy, man. You had your time and more. Let Angleton speak, man. Let Angleton speak. You had your time. These are the issues that contributed to this. In my analysis, because I was here and I watched it. You opened the border. You made a policy decision to open the borders. You allowed people to travel for up to 72 hours and to come back. I don't know what was supposed to happen, but it didn't. People traveled all over the archipelago, and we had a surge. We talking about a surge. This is how we get. This is how we got to 189. You know, we weren't here. We were somewhere else. We went into a surge, and in that surge, many people died. Many people died. I'm not pointing fingers at anybody because it is what it is. But don't come in here with this artificial foolishness, excuse the expression, about how you so great and you did all of these things. The other thing you did, you allowed in the curfew, you shut down everything except construction. And guess what we found out? The super spreaders were in the construction industry. The one thing you allowed, you shut down everybody else, even when you could have allowed them to open with protocols, but you allowed construction, and we learned later this was the foundation of super spreading in New Providence and maybe outside of New Providence. Additionally, you wanted revenue, and you tell people to turn the light off. So people rushed, and you had lines with no social distancing. All of these things happened, you know. Now, the only reason I raise these things, right? And I do it not to, because I don't think that's helpful really at this point. I really don't. And I made the point in here before, and I think we got to keep moving. But I don't want you to misrepresent. I would not. You talk about misleading. I would not want a misrepresentation of the true journey of where we are. And again, people are sacrificing again. This time you have a food program, which I spoke to yesterday. You've now cut back from a number. I mean, many people have been taken off that list. There's no rent assistance program. And I saw a headline, I didn't read the story, where the media is saying the Prime Minister is suggesting that assistance for rent is running out. It won't happen. And this is so distressing. I spoke with a man last night in the Anglican community. He works on the beach, Atlantis, and he lives with his elderly mother. He didn't do anything, The place shut down. He had to go home. Whatever. And he hasn't been able. He's been applying. I've been speaking to the minister about this man. He's been applying for rent assistance. He did it months ago. He's now going before a magistrate. He is terrified. And then he's putting in these WhatsApp messages to me in the late hour of the night that if he is put out of the house, he has to now find other money, and Christmas is coming, to go and give first and last one. He don't have it. He don't even have what they're asking, my landlord is asking now. And so, and this is the point I'm making. I understand we have limited resources. I understand that. But you cannot just have a policy which says, go do your best. And that's what I'm beginning to feel. That's what the policy is moving in a direction. Go do your best. We're human beings. We don't treat each other like that. States do not respond in that way. If you look at what's happening in other countries, they don't respond that way to their people. And so I want to just summarize again. Yes, we come from 183 to 130 something, but we were probably on the first page 1. Now we're on page 3 or 5. We probably on page 1. But we found ourselves at 183, making our way back, which is good. Speaker, the point I want to make, really, I'm really responding to the member, but the point I want to make really is about the Constitution. The history of our people. Every nation has Constitution, but I'm talking about our experience. Our historical experience is one that said at some point for most of us that we were not people or human. Okay? That's what it was. And the journey of the people in this country, the majority, has been a movement away from that concept that we were property and not people. The history about the Burma Road riots, Black Tuesday, and on, the fight of the Bahamian people to achieve dignity as humans and as a collective society is the stuff of which our history is made of. And part of that is our Constitution, because in 1973, our nation went into independence. We severed ties with colonial masters. We know the history. You know, they sit in a room, they divide up the geography of land and the resources of nations. And we are subjugated in that way. And our journey has been the rejection, resistance of that. That's history. I'm not mashing any corns, that's just the history. But part of it is our Constitution. And the Constitution has a lot of words in it, but it also speaks to some fundamental things. And the importance of it to me, and I think that the reason I'm raising it, because I think that we have a tendency, because we've adapted or adopted some of that residual thinking that we inherited, or the journey that we have, that the rights of our people, the freedoms of our people are negotiable. They're not. Now we know that what we're dealing with today is provided for in the Constitution. So that's not what I'm saying. I'm saying that we have to hold up high and value the freedoms of the individual. I insist on it. I insist on it. And the member for Centerville talked about democracy, and there was a lot of laughter and noise and all that. But this is the truth. There was a time we had no democracy in this country. We had no democracy. In fact, today is the anniversary. Women voted for the first time on this day in 1962. First time ever. But there was a time when people we didn't have universal suffrage. So democracy and majority rule really was, in my view, was about the coming to fruition of a people in terms of expressing themselves about how they saw their destiny. So democracy is not just a word or a concept. It's fundamental to our own experience. And I'm saying this with the greatest degree of seriousness. We have to understand our experience and hold up high these freedoms for our people. Now, I've already said I know that what we're doing is provided for and is allowed in certain circumstances. We know that. But the problem I have with this is this, okay? And I'm looking at the process. We had a first emergency order. You forgot to renew it. You came with a second emergency order, which is now being superseded by a third emergency order. And I think I saw something by the Attorney General in the media where he's saying, it's Christmas. And, my words, we want our ham and turkey. Well, I don't think a government should ever be heard to be speaking to this issue in that way. That is why initially we had asked, and it's not to be difficult, because you have to also signal to the Bahamian people how you value our Constitution. The Prime Minister said some things over there and it went viral. And I think he sought to clarify it. The Deputy Chairman sought to assist him. Okay, but it's the message that you are possibly sending to the Bahamian people. Let me just say, I don't have a problem coming at short notice to deal with the Constitution if it's deemed necessary. But don't tell me you're extending it so you can eat ham and turkey. I'm greatly offended by that Christmas holidays, this is our Constitution. And we should treat it as a serious intervention in the lives of the Bahamian people. The message you're sending potentially is so serious, it's so diminishing, it's so taking away from all that was fought for in this country. And a lot of us don't find it difficult to really embrace the concept because I believe we've been so affected by our experience. But it's our duty from our experience to hold it up and to ensure that we tell every child in this country that they are fully entitled to the freedoms of this Constitution. So I say that to say that I really don't like this process. And I would have preferred that you all, that the government would have dealt with this in a way in which it understood we were dealing with the Constitution. And then, and out of that, we as considered members, the leader of opposition, he made his presentation with a lot of noise in here. Let him speak on this. This is not politics. It might be politics, but we're talking about the Constitution. He should be allowed to speak without heckling and attacking and all these things. in my view. It might, others may not agree. And I just wanted to say I also want to say that I think the Bahamas did well in the beginning. I think we made mistakes. We went into a serious surge. A lot of people died. We were faring worse than most countries. I'm not celebrating. I don't feel good about that. I don't feel good when I say these things about the Bahamas, that we have one of the highest rates of incarceration, highest rates of guns, and all these things I spoke about last time. I'm not celebrating them. I'm just trying to urge us as legislators to begin to look honestly at what is happening in our country, because, people are fleeing. I mean, this is not a secret. People are fleeing. They're leaving the Bahamas. The young people, they're going elsewhere because whatever, they're having a view about what's happening. So what we should do is not seek so much seek to defend, but seek to respond in a way in which we can address the issues. So it is my view that we seem to be concentrating on coercion, and a lot of young people are being arrested. They got criminal records now. I know the member for Mount Moriah said they're going to address that. People have have gotten criminal records out of this. I spoke to one of my constituents, said he was in a neighbor's yard. They were inside. This is what he claimed. I will talk to him tonight, and he got a citation. And he was on private premises. But I think instead of the reliance wholly, it appears, on coercion, that we should seek, and the member for Senate will talk about it, more proactive, progressive, democratically based things to coexist with that, like education. Now, I heard the member of Bamboo Town from his seat said some things, but and he's a minister of health, and I think they will tell him this, because he's new in the role, but in every public health emergency, education is critical. Always has been from day one in my experience. The billboards, the community meetings, all of these things in public health crisis. We did it with HIV, we did it with Zika, and on and on and on. Education is key. It's not an insult to anybody. It's about broadening the knowledge base. A lot of people don't, I don't know if I understand fully how this thing is working. It looks like the scientists don't really understand it. So, I think that we need to educate our people on more. We need to do more of that. And as we lock down people, we should be giving them assistance. And just as the government is able to find money for lots of other things, they should understand that people being able to eat and having shelter is 101 of human existence. It's not fancy. It ain't fancy. It ain't nails. It ain't hair. It ain't those things. It's fundamental. It's being able to eat. The amount of people I have heard from, I usually go through my messages at night, people who are saying they are hungry. I'm not used to this. I talked with that before in this house, but in all my years, I've never seen this. But I think that the government should understand what the obligation is. And we have to ensure that people do not suffer. There is no magic bullet where you say, if I don't do it, they can work it out. There's no magic bullet. There isn't. People are stressed. People getting sick. Some having strokes. This is a difficult time. And no one created the pandemic in this country, if it was created. But we have to find a way to ensure that we reach out to our people and that we show that we are concerned about their well-being as human beings. So I say that to say I'm urging the government and the ministers here, please take care of that man Rand before he go to court, because he is fretting. He's fretting. And if we can do all that we can to find the means and the methodologies, sit down and do a brain storm on it, what the options are. One of the things I thought about, and it may not work, is giving credits on real property tax or something to landlords. Do something. You can't tell people do your best, man. It's just, I can't see it. So before I take my seat with Mr. Deputy, I just one other point I want to raise, and it's not really, it's not pandemic related, but you could say it's probably related to principles of democracy. And I have been advised that the school bus contracts, the member of parliament is here in South and Central Andros and Mangrove Key, that, and Cat Island too, that they have taken away contracts from individuals, that they have given it, and in the letter it says that that there will be a tender process. But I'm told that there's no tender process, that the bid was sent to 9 persons, all of whom got it. And it is being alleged by the people there that all of these people have something in common politically. I don't know. And that 7 of the 9 don't even have buses. So I raise that on their behalf, because if that is true, that's grotesque. And so, Speaker, I end simply by saying that let us, the member for Cat Island, Rumpke, and San Salvador has indicated that the manner in which this is done, particularly taking us into January. And you know, actually, Mr. Deputy, while the member for Golden Gates was speaking, someone sent me a message and said, is he speaking against the extension? Because he talked about all the favorable performances. And we've not really had any argument made as to why you need to just give yourself some wide open leverage of our Constitution, because whatever. I mean, you haven't said that you expect a surge because of this. You could say, for example, the borders are opening, that you expect this, or you've looked at trends in other countries. I mean, something. You've not given any reason except to say, and I can tell you, for me, the approach appears very casual, in my view. And I cannot abide by that approach to the Constitution. It's obscene in my view. In my view, for it to be treated in that way. And so we are not going to support our people, we support our country. We do not want COVID to continue to ravage our nation. A lot of people have died, many of whom I know have died, some in my constituency. So we understand the fallout of this terrible virus. We're not enemies against that common objective. What we do have a problem with is the manner in which this administration is managing in terms of the legal process. And so we will not be able to support any extended blank check without any rationale, without any reason. And it might be justified, you know, but we've not heard one thing, not one thing. And so we will not be supporting it, Mr. Deputy. But I want to make it clear, I support the people of Angliston, and I support the Bahamians throughout this country. We are with them 100%, and let them never doubt it, Mr. Deputy. We are with them. Thank you very much, Mr. Deputy. Yes.
Well, thank you, member for Angliston. The chair recognizes the member of South Beach.
Mr. Deputy, thank you very much. This is some point of clarification.
Just 1 second before you.
As many?
Mr. Speaker.
The chair recognizes the honorable member for South Beach.
Point of clarification. And I don't ever wish to interrupt the speaker, but just to clarify. Bus contracts in the respective islands that were previously identified have been concluded. In this circumstance of the COVID environment, they were extended on a month-to-month basis. until such time as an opportunity would arise for the Ministry of Education to provide a tendering process, which has just begun. No bus contract has been given to anybody. That process is underway. Those who are eligible or who have offered to or expect to or wish to tender are not, as far as I know, of any particular political orientation. However, I recognize, as they would have heard some comments with regard to those orientations, we would have recognized the same thing upon coming to office. But it mattered not to us because we met a contract in place. We honored that contract as we were supposed to do. The contract came to an end on the 30th of June this year. The COVID environment didn't permit a tendering process until such time as now. No one is being denied. No contract has been issued. The process is underway. As a matter of fact, Mr. Speaker, it has just begun. So it's just a point of clarification.
Chair recognizes the honorable member for Cat Island.
I'm hearing the same rumblings. The only question I would wish to ask the minister: present holders of contracts will be permitted to participate in the exercise. That's the question I have. Pardon?
Of course.
Okay.
Of course.
Because
now, mind you, Mr. Speaker, you know, if I wish to make a historical reference, there is an observation coming to my attention that what now is undertaken was not previously observed. Thank you so much.
As many? The chair recognizes the honorable member for the Exhumas on Ragged Island.
Thank you very much. Mr. Speaker, it is my pleasure to rise on behalf of the people of Exuma and Ragged Island and the Exuma Keys. It happens to be Thanksgiving, so I want to say a happy Thanksgiving to the people of Exuma and Ragged Island.
Honorable members.
Like Pastor Dave puts it, today I am thankful, I am grateful, and I am hopeful. So I wish all a happy Thanksgiving. I also take this opportunity to offer condolences to the family of former Speaker Oswald Ingram of the Saudi Lutheran community. And I trust that his soul will rest in peace. And I offer thanks on behalf of the people of Exuma and Ragged Island for all of the great service he has given to our country. I also wish to thank the former Minister of Finance, the Honorable Peter Turnquest, for his work in the ministry during very difficult economic times. I thank him for having done the honorable thing, and I wish him well for the future. So, Mr. Speaker, I arrived home last night, and my children were watching a movie, How the Grinch Stole Christmas. And I laughed and I found it very interesting that we would then come here today and we would debate the extension of these emergency orders to the end of January 2021. Our leaders said definitively, supported by all of my colleagues, that we are not supporting these amendments because we have not been told the strategy. We have not been told why. You did not make the case. You didn't lay out what the strategic imperative is. You say we're doing well and the numbers are down and it's under control and you pat yourself on the back. You say the measures worked. But then you come back and you ask for an extension beyond Christmas to January 2021.
We think this is madness, Mr. Speaker. It impedes civil liberties, suppresses quality of life, makes it more difficult to do business. It's impossible to restore tourism in this environment. It's bad for our international brand. We see travel advisories, and a part of the basis of the advisory is that you might experience these lockdowns that we're asking for extensions to the end of January for. It's seriously impacting our ability to attract tourists to our shores, notwithstanding the fact that we opened on November 1 to do so. And we've been at this for far too long now. And our leaders said earlier we should legislate the measures we think are best and pass them into law. The Attorney General says that his office is drafting such legislation, but sadly it's taking too long, and the constant state of emergency and ever-shifting emergency orders are fraying the already stressed nerves of the Bahamian people. The credibility of our country and the confidence of our economy. There seems to be a pervasive view in government that anyone opposed to the continued state of emergency is a cruel sadist that would let anyone just suffer and be vulnerable to die. But it's an absurd, extremist argument. I personally knew and know people who died from COVID-19. And I must tell you, these were exceedingly careful people, most who contracted it at work or from a loved one who was exposed at work, or in the hospital, which was approved to be open by the competent authority. They weren't out partying. They weren't out renting Airbnbs for frolic. COVID-19 is dangerous and potentially deadly. You will never hear me doubt that. If it ever came, or if it never came to the Bahamas, we only need to look at the international trends, and that would be enough to send a message. However, it must not cause us to abandon reason and drift towards extreme measures this late in the game. We have learned more about how COVID works, who is mostly impacted, how to protect ourselves, how to treat those infected in the past 11 months. As we learn more, we should shift, we should pivot our strategies. The same remedies that we applied here 8 months ago are not all necessary now. We must have learned something from this process by now. And I understand this is a complex process to target all the legislation needed to govern the non-health aspects of the emergency order. But I'm not afraid of hard work. The opposition will come. We will give due care and prompt attention to those pieces of legislation if you bring them, whenever you bring them. And there are many others in our country who have a great sense of affliction. Many people are struggling. People are hungry. People are suffering. And I will say that there have been some measures that this government took that made sense and helped to slow the spread. And I would also say that when you realize you erred, you did reverse some of those erroneous errors, those ill-conceived policies. But what you are advancing today is not a great idea. And what we are saying is that we don't believe for 1 minute that COVID has somehow become benign. And we don't believe that we should let our guard down. What we are advocating is that we have had enough time to pivot and formulate a plan for the new normal until a safe vaccine is widely available. But like the leader said, you choose to take the lazy way out. Thankfully, we see that monumental progress is being made with the vaccines. And Lord willing, we might see the back of this health pandemic, hopefully before the end of next year. The economic and social effects will linger. However, we need to tangibly plan for what will come. I've said that before, over and over. In the interim, however, we must have a laser focus on the dual crisis we face. And we must not compound this crisis with a leadership crisis, as you're currently doing. I reiterate, I would like to see better use of the Health Services Act and the Quarantine Act. As our leader pointed out, what we want to see in the Health Services Act would be a threshold for strategic restrictions. So for instance, if the rate of new infections hit a certain percentage, we take a specific action. If the rate of hospitalizations in ICU hits a certain threshold, we take another action. If the rate of deaths hit a certain point, we take another action. This is practiced in various countries. And by the way, we reference countries often, how they're locking down and how they're doing so poorly, but I want us to focus our attention and learn the lessons of countries that are having some successes. We should aspire to be better. What is practiced in many of those countries are the fundamentals of widespread testing, robust contact tracing, enforcement, quarantining, and we got to get back to those basics of managing the pandemic rather than just simply taking the lazy way out. In my view, we need to sort this out. It's been going on for far too long. And we've said this over and over. Yes, we've had some efforts. I am told we've beefed up contact tracing, even though it's not beefed up enough. Yes, there have been some efforts to ramp up testing, but it's woefully inadequate. We've advocated for widespread and free testing. We invite you to consider it seriously. And I heard someone ask, well, you talking about this free testing, who's going to pay? Well, the government must pay with our tax dollars. In my view, we must do so because the cost of not providing free testing for asymptomatic people who can still spread the virus to the vulnerable outweighs the cost of paying for the test. The loss is business and tax revenues, the loss of jobs, wages, and the resulting inability to pay utilities and service debt is far greater than the cost of providing free testing. As we said in our economic plan, we must swallow the tadpole now or swallow the frog later. Mr. Speaker, I am perplexed by the state of play in Exuma. And I would like to talk now about what I have gone on public record as saying were some unduly harsh measures in relation to the weekend lockdowns imposed on the mainland of Exuma. We conceded that some restrictions were necessary. The measures put in place were not only harsh, but they caused chaos and confusion. Mr. Speaker, this thing is impacting real people. People are catching hell. People are hungry. We're doing the best we can to help. But when a lady called me today from Steventon on the main line of Exuma, she works in a restaurant and she just gone back to work. Only now for that restaurant to be closed, not able to do curbside or takeaway. So she's laid off. She's been cut off from NIB support. Her daughter, who runs a small business, she just can't take it no more. She's exhausted all of her savings. So she's closing for good. And BPL came today. Real stories from real people. BPL came today. They shut off the power. They didn't even have the courtesy to come to the front door and say, I got to do this. Real people. Real stories of the pain and the suffering being inflicted by the harsh realities of chaotic, ad hoc restrictions. You didn't have to shut down the restaurant. You could have allowed them to do curbside takeout or takeaway. Hotels on mainland Exuma asked guests to leave. The same guests we worked so hard to get there. They asked them to leave because they couldn't take care of them after 6 p.m. Exumians are stuck in New Providence because of the sudden action. Nasuvians and other Bahamians are stuck in Exuma. They don't mind taking the PCR test, but it costs them $316 and takes a week or two to get the results back because domestic airline service is interrupted. You didn't think these things through. You didn't consult well-meaning Bahamians. You didn't consult the member of parliament. You didn't consult the Chamber of Commerce president. It's shameful. It's disgraceful. Disgraceful. The same Chamber of Commerce president reports multiple business failures. You're killing what's left of the economy. A businessman, a real businessman. He celebrates his birthday today. He needed to get back to his business. He was in Nassau. To get to Exuma, he found it easier to travel to Miami and take a direct flight to Exuma. Because guess what? You shut the borders to your citizens, but you allowed international carriers to come. So he spent $1,700, 3 days of his time to make the trek. And guess what? He didn't have to quarantine either because he was coming from Miami, you see. You didn't think these things through. You didn't consult. You've been locking down for 9 months and seems like you can't even get lockdowns right. Business people need predictability. You can't open today and get some harsh decision tomorrow because you've opened with your last. You've opened with your light bill money. And you hope to sell some chicken snacks to be able to make that money back. So you can pay your light bill now. This thing is affecting real people, man. So the member for Angleton pointed out that you're taking it too casually. Real people suffering at the hands of your decisions. And you sit there and you just take it casually. And you laugh and you heckle and you interrupt sensible suggestions. And you do it over and over. It's despicable. This ain't no laughing matter. Mr. Speaker, we have not been provided with the science even in Exuma to justify the decisions made. We had a spike one day, significant number. I understand the panic. But was it because there was a backlog of cases? Was it because there was a backlog of swabs sitting at the lab in New Providence waiting to be processed? Because the next day we had 1, the next day we had 0, the next day we had 3, the next day we had 0, the next day we had 1. Yeah, we know that there's a problem. We know that there is community spread. The question is, did you use a sledgehammer to kill a mosquito on the head of the people of Exuma? That's the question. You have not justified it. You have not presented the science. And you do it likewise today by asking for an extension to January 21. You have an obligation to make reasonable, justifiable decisions. And you must justify the decisions you make. Mr. Speaker, I promised only to speak for 29 minutes. But this is a troubling state of play. My team in Exuma organized testing because we believe that's the right thing to do. We've advocated for it. We arranged with the clinic responsible for administering the rapid antigen test for tourists, the same one that the government endorses, where the tourists can go to get their 5-day test. We've opened it up. And we paid for the testing for anyone who wanted to go so that they could access this testing free. And then you talk about the trust to not make things partisan. The Prime Minister come and he alluded that it was a dangerous thing to make rapid antigen tests available for free to the public. The health officials aren't doing it. These are tests that are available at the clinics today as approved by the government for anyone who wishes to have them. The same tests that are available in New Providence right now as approved by the Ministry of Health for anyone who would wish to pay for them. All we did on Exuma was we provided the payment for the tests that anyone can go and get them now. The same test. Someone tests positive. I am advised with the rapid antigen test, they were referred for further investigation. So how is that dangerous? You say you don't want to make this political. But what do you think the Bahamian people saw when their government seek to lambaste a member of parliament who is doing what many health officials around the world and the WHO recommend? An MP doing perhaps what your government should be doing. In any event, whether through some extreme coincidence, it had already been planned, and what we did prompted the action of the government to offer free testing. What do you know? What do you know? But they've only offered it to people with symptoms. And then the press reports a positivity rate of 79%. Well, if 5 people have symptoms and they go for testing and 4 are positive because they got the symptoms, then that's a positivity rate of 80%. So you've got to do more testing. That's what that positivity rate told you. And though you sought to disparage that member of parliament and ridicule a move that was intended to benefit the people of Exuma, and we were told that widespread free testing was some sort of fantasy, I'm nevertheless thankful that the government followed the lead of that member of parliament. The competent authority. Mr. Speaker, I've asked about the science. I won't belabor that point, except to say that Exuma has been subject to harsher measures, in my view, than what was warranted. You've caused more suffering, more pain than was necessary. Had you spoken with the Chamber of Commerce if you didn't want to talk to me, we would say, yeah, close down the indoor dining. But yeah, keep the curbside deliveries from bars and tight enforcement of prohibiting the social gathering and the mask wearing. So you're killing the bars of Bahamians who are entrepreneurs because you're killing the business of restaurant owners because they have a bar top, Bahamian entrepreneurs who are struggling to make it under the best of times. But you keep the large businesses who sell wholesale, you keep them open. No rhyme.
They don't make the strategy on it.
No reason.
They don't make it.
No thought. Lockdowns for 9 months and we're still not even good at that.
No, before they come here, they never make that kind of money.
So I move on, Mr. Speaker. I believe I've sufficiently made the point on behalf of the people of Exuma. But I now want to talk about your reporting requirements. Under Clause 12 of the regulations, it provides the power to the competent authority to waive procurement rules. You don't got to go to tender like all those rules that were put in place for good governance. The competent authority now has the power to do as he wishes. Taxpayers' money. You also mandated under Clause 2 that the competent authority shall, how you know QC, but when I hear the word shall, I know that ain't optional. Shall, within 6 weeks of the expiration to the proclamation of emergency, lay a report that details expenditures, suppliers, and the reasons for using such suppliers. 6 weeks after the expiration of the proclamation. My recollection says that there have been 2 expirations so far. Since March. But you have not reported. The law requires you to do so, but you have not done so. You come here and you get on your soapbox week after week talking about transparency and accountability, and you break your own laws. It's shameful, it's despicable, and you're too casual about all of this. There has to be consequences. And there will be. There will be. Mr. Speaker, I say to the people of Exuma and Bahamians at large that we should continue to take the pandemic seriously. Of course, there is a sense of weariness. Fatigue is setting in. Yeah, we get that. But we ask you to take this thing seriously. Of course, we want the competent authority to do more and do better. We ask members of parliament when you can do more to do better. do more as well if you can. But every citizen has a responsibility to help, to follow the protocol. It is only through full compliance that we will beat this. We have to continue to social distance. We have to wear our masks. We have to keep ourselves and our environment sanitized. We got to avoid parties and large gatherings. Yes, we long to have a good Christmas. We long to see our loved ones. We long to gather and fellowship as we once did, and we will again. We will be together again. We'll go to work again. We'll go to school again. We'll have drunken and regattas and wedding receptions and repasts again. Because the Bahamian spirit, the human spirit, is indomitable. The intellect and the capacity for invention God gave us is limitless. We just have to continue to hold firm, to fight on, to protect ourselves until we can reach widespread immunity or vaccination, as the case might be. We'll do all that we used to do again, but I encourage you to pray for strength and patience and resilience and fortitude. And your opposition will continue to fight for you. We've done it before, and we will do it again. We will support you every step of the way. We want to beat the pandemic. We want to manage the economic crisis. We want to manage the health and the social crisis. And there will be consequences for the leadership crisis. We will not support these actions today. We will vote against them on behalf of the people of Exuma and Ragged Island. I thank you, and may God bless the Commonwealth of Bahamas.
Thank you, Honorable Member. As many, the chair recognizes the Honorable Member for Southern Shores.
I didn't see you.
The chair recognizes the Honorable Member for Pine Wood. The chair.
To set the example. The curfew is 9 o'clock. But I left the last time saying the curfew was 7 o'clock, and I left about 6:30. All right, so I want you as the speaker. I invite you.
Honorable members, let me hear the member for Carolina.
Thank you. You're the speaker. And I hope that you could conduct ourselves accordingly, recognizing that we have to get home, hopefully before 9 o'clock.
Honorable members, Mr. Government Leader, Honorable Member for Bamboo Town. How many more speakers do we have? Honorable members, I believe the member for Cat Island raised a fundamental point with respect to the curfew. The chair recognizes the honorable member for Kalani.
We understand that. We understand that there's a curfew, but this is a very important matter. And in circumstances like this, the police has the authority in terms of us being on the road. We would gladly call the Commissioner of Police and ask the Cabinet, the Parliament to be excused tonight because we're running late. But we would gladly call the Commissioner of Police so that's the order
carry on.
to Parliament.
Thank you, honorable member. As many, the chair recognizes the honorable member for Pinewood.
Thank you, Mr. Speaker. Mr. Speaker, I rise by the Mr. Speaker, I rise by the grace of God and for the good of Pinewood. Now, the Bible says, in all things, give thanks. It also says that God is a very present help in time of trouble. Quite frankly, these are truly the best of times and the worst of times, because even in these times, there are those who are excelling. Certainly, the labs are having a bonanza, the food stores are having a bonanza. As it is in war and peace, there is a ebb and flow. In war, when people are suffering, the arms dealers make money. In slavery, during the time, you find that there are people making monies, even though there are those that were suffering. We'll find opportunism in every situation. Sometimes amidst the defeats and the struggle of a nation, there'll be those who seek victory at the expense of people's pains. Sometimes we all forget our humanity and fail to realize when it counts that what happens to the goose will happen to the gander. Sometimes we all need to be reminded of what we're fighting for. We shouldn't have to get COVID or lose a loved one to COVID to have the epiphany of the realities of what we're facing. And definitely no one should seek to advance themselves on the back of this struggle. Our people are really hurting. People in here are hurting. Because of Bird, I probably may lose. And I say that, and I'm going to rebuke it, because my spirit say, I stand to lose in the regular things, but I know of whom I believe. Two businesses I built with my hands long before coming to this place. And I only use that language for people's understanding, because if you ask me, I will survive. I know the struggles because, you know, it is so peculiar, the things that we have to deal with in our country. You know, in the midst of this, just for instance, 3 of my fleet vehicles, not on the road, can't, just those 3 I'm only talking about. Off the road, can't operate. But yet, because they have a mortgage with the bank, I had to pay $15,000 of insurance for vehicles that are not on the road. Just 2 weeks ago, I got a further 6 months extension on the death of my business. We all absorbing this. I want all of us as Bahamians to shake ourselves. And I've said before, catch ourselves before we wreck ourselves. This virus is an attack on us, but our actions could be the most destructive thing. The struggle we have with the plague and the rise and fall of those that are infected comes not from the majority, you know. The majority of Bahamian people have bitten the bullet and made the dedicated sacrifice to obey the rule, and then you have, what the club name, Charms events, where a few, where we give up our liberty so we can sustain our way of life, the few will come out and burn it all down. But this isn't new to the pandemic, you know. When we had the spike in crime for years and record-breaking crime over and over and over again, and it tarnished our nation. But it was still only a few people, because the Bahamian people are law-abiding and good. This is really a we time. This is the time, as Glenison says, we do need to educate our people and help them to appreciate and see what they're looking at. When you go to the valley in the shadow of death, when you walk among your enemies, you must give your army, your people, something to focus on other than the things that scare them. Because these are the times that try men's soul. Mr. Speaker, I sit there and I listen over and over again. And as a leader in my community that have collected me, my people, it is my job to help them to understand and to see what they are looking at. Not to sing them a lullaby, but to understand what we're doing. I find it amazing at how some would seem to think that all us Bohemians in here, from the door to the chair, may have some disconnect from the pain that everyone is suffering. Who can be so self-righteous as to say that anyone in here has no care, when even the devil knows how to do good for his own? If all we care about is politics and wanting to win, don't you think the best effort would still be the same thing? Have you ever thought about it? Mr. Speaker, this week in my constituency, I had a young man. And he had called into the office, called me on my cell. Young father with a daughter. You know, I got my girls too. And he was at the end of his rope. Wanted to kill himself, casting out his house. I didn't have no resources to help him in that situation. The lady in my office said, Mr. Raming, I think I know who could help. You know, sometimes when you have so much on your mind, you don't even know all your own options. And I'm going to call him in because I'm going to thank him. And she made a call, and she called Bishop Hanchel. Bishop Hanchel is a good friend of mine, and trust me, if I had picked up the phone to call him, he would have helped me. But she called Bishop Hanchel. Bishop Hanchel made a way for that young man to have a lodging for a week, which gave us room. Then I reached out to the good member for Southern Shores. And I asked the young man, I said, did you apply for anything that has been offered by the government? And the most important thing is you have your application in, and he did. And Southern Shores is looking out for some things for him. I've heard the stories and the cry of people who have been to and at the end of the rope. There are doors that will be around that persons can't come out because they're sick and they're abandoned, have been left alone. There's so many things all of us have done. All of us have done to help, and there are burdens that all of us as members of parliament carry because there are things that we wish we could do, and dealing with people who think we can do everything because we have the letters MP behind our names. I could say, though Angleston is in opposition, by knowing a glimpse of her heart before being in this place and in this place, that she struggled with that too, and she's a seasoned representative of this house. And I wonder, and that's why I could have a good appreciation for how do you handle that? When everybody calling you like the young man, they think you have the magic wand. We are all going through something drastic. But what I am making is the Bahamian people has paid the price to this point. In our caucus meeting about this, something came up that was rather interesting with the Prime Minister, and I want to do two things, and because it's important for people to understand. And they asked about these emergency orders. One of the things that I heard out of the Prime Minister's mouth, and sometimes, you don't always hear some things, because when you stand up as a leader, you speak as a leader, but sometimes when you hear someone speak as a man, he said, Reuben, we must guard our recovery. We must guard our recovery. These orders that are being extended today is not about whipping anybody left or right. But look at it. In all of our leadership, we've had our successes and we've had our failure. And our leader has learned what works. And we've seen it over and over again. When the Bahamian obey and they work together, we're able to bring this viral load under control and bring our nation in a better position to move forward again. Over and over again, it has proven that when we work as we are able, like they said in about the Tower of Babel, there's nothing that we cannot do if we set our minds together with one language, one speech, one tongue, not moving around trying to create fear, but telling the people, we can do this. We can do this. The virus, COVID is not our worst enemy. We are. We heard the engineering connection saying by breaking the connection, we can break the connection in 2 weeks. The children of Israel could have made it out of Egypt to the promised land in 2 weeks. Check your Bible. 2 weeks, just like COVID in 2 weeks. But the few, we are at a point right now, and I want my people in Pinewood to understand a few things. This is not about lockdown and dooms and glooms. This is about protecting us where we are. There are a lot of things, as the member from Exuma tried to point out some of the things in the order, but there are other things in the order that are built in that is protecting and cushioning our country for a proper recovery. I remember at BPL when they had problem with one of the major generators, and please correct me if I'm wrong, and the fault with the generator was they did not follow the right sequence in restarting the generator. Is that correct, Member for Carmichael? Those big generators, not the little one you got home, the big governing generators, when you are taking them offline for whatever purposes, maintenance, there's a sequence you have to try to do. When you're getting it back up like an economy, there's a sequence you must follow. If not, you will cause catastrophic failure. This emergency order that we are now extending is not the same old, because change is coming. Right now, we are facing a recovery, a bounce back, a surge forward, not running and protecting ourselves from COVID. We are now making an offensive against COVID, and we need the emergency powers to be in place to help us with the offensive against COVID. The Bahamas is no longer running from COVID. The Bahamas is now running to a higher, loftier goal, which is we want to recover. To do that, we need to understand the intricacies of our country. No matter what we say about natural resources, no matter what we say about diversification, the tourism is still the #1 engine. And we must get that engine firing on all cylinders. Our greatest resource is the Bahamian people. They are the tools that drive these engines and sustain our Commonwealth. Do we understand that if we vote like the opposition and allow the emergency orders to fall away, the same businesses that they are decrying, and I feel their pain, will suffer as a result of an extension, are the ones that will very well be destroyed by the removal of those same orders if we're not allowed to properly wean the country back into a level of operation. You cannot even go to the pet store and buy a goldfish and put it from one tank to the next without causing a shock and killing the very fish you went to purchase so you could love and keep. Right now, we had to do some very important things. Right now, we are possibly at 30%, some say 40% unemployment in this country. I remember when the Prime Minister asked all businesses to have a heart. Some people took that negatively. But notice what has happened. The one who holds the rings and is the leader of the largest employer in this country has not laid off a single Bahamian as yet that I know of. Quite frankly, in the best of times, they've always said the civil service is bloated. We need to cut it down. Quite frankly, a good, savvy businessman or a lawyer would have simply said, this is the time, this is the time, this is the time. But instead of that, to guard our heritage, none. And you know what I like about it? It's not just something that is just leader-centric. I see it in my colleagues. And I hope I don't betray a trust with this statement, but sometimes that's okay. I was in a meeting with the minister, and we finished this diplomatic meeting, and he raised a question to some senior people about somebody there, and he said, and just for reference, the person that he mentioned was hired before 2017. He don't know, but I know them. They're Foxhill people. So let's just bring balance to the conversation. This was just a human being conversation. And he had noticed something coming through the airport, and certain persons weren't there who would normally be there. And he asked what happened, and he found out that the person was left off the job, I think maybe for March and whatever else. And I was proud in my heart as a Bahamian, not no F&M, as a Bahamian, when he looked at them and said, listen here, don't you know the policy of this government is we're not laying off any Bahamians in this environment? And he gave the order on the spot, go and rectify that situation. We are standing firm, but here it is. If this order is to fall away, let me give you but one example. The order allowed for the cushioning of the labor laws in this country. How many remember the debacle when hotels lay off, even in the best of times, their workers in this country and many other places? We've seen when things are good, how hard it is for people to get their redundancy. Not only that, let me say something that some people may get a little upset with. Some of you know when you get them good packages, 2 years later you're on skid row. I've seen it when BTC gave up big packages. Some people did well. A lot of persons at the end of the day back out looking for a job because the money just wandered away. Now we have a situation where those businesses, large and small, have gone through the shock of COVID. Most of them have done the best they can to sustain their employees as much as they possibly can. Even I did. And then they're going to let this order, the emergency order, fall away. And when that fall away, all the things that the dam is holding back to control the descent and rise of our economy will now flood the area again. And immediately everyone that would have been discharged from work for 12 weeks now are legally called redundant. Technically, everyone who is home today, for the most part, you have not been fired because of the actions of this emergency order. What we have done is we put you in a type of cryo that will preserve you and all your privilege and your benefits, so that the greatest hope that as we come out of this, you who would have been working 16, 20 years, get all these benefits. You've been working 16 years. Nobody else wants you. Who's going to hire you? Most of your life, you may have pumped into this particular thing. You at the age of retirement, you wanted to do certain things. All of that is held by this emergency order. If you will allow that to fall away, I guarantee one thing would happen. These businesses, not just the hotels, the other businesses that have been trying with you when monies are flowing out of their pocket, now become legally obligated to have to go and pay all this redundancy. What will happen to the business sector of this country? Do you see? We are faced with being surrounded like the Red Sea on this side. If we do not fight against COVID and go on the offensive as we are doing now, COVID will bring us to bankruptcy. That's why we have controlled lockdowns. We only do what we must do. If we drop the wall too quickly, the very action of dropping the emergency order will cause a shock to the system and mass bankruptcy. We just had demonstrations the other day with persons wanting to insist, and I don't know if they realize it, that they get fired from the hotel so they can get their redundancy. I don't judge them, because when you're hungry and you're upset, you feel it. But you got to understand that your benefits are intact. And as the hotels reopen, I'm not guaranteeing everybody or anything. Nobody could ever do that. But rest assured, the intent is for the majority of the people, as many as possible, will be made whole again. And you still hadn't lost what is due to you because of what? What is entrenched in this very same order.
as we begin to move forward in opening our borders. It is not a matter of who's more important than you. We know what is the lifeblood of this. I mentioned me and my insurance. This was just 3 vehicles. How do you think the Moss family feel with leisure tours? How do you think all the taxi drivers around here feel? How do you think about the 400 odd jitneys that are around here, how they feel? We had the question about Bay Street. Bahamians don't shop on Bay Street like that. Bay Street is a hub for merchants, meaning when we come here to do business. The taxis don't come here to hang out, they come here to do business. They don't have no business because there is no inflow of tourism. So we must face this giant. We must look it in the eye. And to do that, we must have the ability to react swiftly to whatever comes our way. And not only that, internationally, people must feel a sense of peace that there is such an order in the country that would allow the country to swiftly respond to anything that rises. This is not a situation of doom and gloom. And as for me, not having to debate this again in December is an act of charity to the Bahamian people. Quite frankly, all of us are sick and tired of this rhetoric back and forth. All of us had a feel of COVID. All of us had our feel of emergency order, including the Prime Minister. We're not doing what we feel. We're doing what we must do in consultation with those who are the heads of all of these various organizations. And yes, Mr. Exuma, including the Chamber of Commerce. Man, listen here. This is about teamwork. You could either sit there and stand in your imaginary la-la land and say because we have won this second round, because no matter how they spin the numbers, we are to a point much better than when we had to enforce the orders again, period. But you can assume that that's the end all be all and watch us get to a state that we regret far more than any inconvenience of an extension of an order that you've seen over and over again. The hand of the competent authority has always been willing to relax it once we help create the environment for relaxation. Man, come on, man. At some point, we must realize that even the public treasury has its limits. At some point, just like a father and a mother, at some point we will not be able to sustain our children. We are just fortunate that we have a prime minister who has not come to the point of deliberating, I am going to lay off the Bahamian people to cut this and cut that. He's cutting everything else, but he's keeping you whole. Most Bahamians, workers, they find themselves home, but at the end of the day, they're still having that full pay. And you know what that means? Yes, we may say there aren't enough people on the food line, but you got to count all those workers who don't have to be on the food line because they have. These orders are not doom and gloom. And unless the opposition can guarantee, they always ask about a plan. Stand up here, I will give you my remainder time and tell me a plan right now. If the emergency order drop and we do exactly what you say, that the propensity of those few who do the slackness will not roll in. And people won't act with chances. People don't do what you expect, they do what you inspect. And if the laws aren't basically there in place to put the genuine fear of not doing the things that put us all in detriment and in jeopardy, what will hold them back? So tell me, when you allow this to drop, I will give you my last 5 minutes to tell me what will happen. What do you have that will protect the Bahamian people other than coming in here and secretly asking the Prime Minister, oh boy, you got to redo this again? Because these are serious times. I really need to know that. Exuma Vax eloquently. He's a brilliant man. But show me, how are you going to jumpstart this engine without the powers that was afforded to us in the Constitution that Angleston herself said is constitutional, and yet I still hear people bickering about this.
So, Mr. Speaker, Pinewood supports this simply because I need to see my residents getting back to work as swiftly as humanly possible. I need to make sure that if we go the wrong way, we could correct the boat rather than letting it run aground. And if the opposition again finally has some tangible, hardcore solution other than the plan I see you call a plan on Facebook, you stand up and tell us you would do something different. You stand up right now and you tell us, or you turn around and look me in the eyes and say, Ruben, if this order is allowed to fall away, that we got something right now that will guarantee that there will be no infection ever coming back to the Bahamas again. That will guarantee if the infection comes, we could do some miracle with our Bahamian people. We know how our people go and make them do what they need to do to save their own lives. I want to hear you say that there is some plan that will stop the collapse of our labor law and the collapse of our industry when they have to now absorb the burden. I want you to show me how without this order you could stop the immediate firing of all those people who hadn't been to work in 12 weeks. And then what you going to do when all those businesses are confronted with all the lawsuits? What's going to stop them from filing bankruptcy? When we're simply telling them slow and easy. Let's make it happen. And I yield on that because sincerely, I want an answer. I want the answer. You have the floor, Cat Island, Rum Key, and San Salvador. Fine with rest.
Thank you, Honorable Member. As many, the chair recognizes the Honorable Member for Southern Shores.
Mr. Speaker, that's a hard act to follow. But, Mr. Speaker, I'm confused, Mr. Speaker, about the persons who, as they make their contributions, complain about coming here month after month after month to debate the extension or the renewal of these orders, but in the same breath, Mr. Speaker, suggests that it is a dictatorship. I'm confused, Mr. Speaker, about which dictatorship allows for that kind of debate. Which dictatorship allows for that level of contribution to say that you disagree? Which member who does not agree was not allowed an opportunity to voice his or her disagreement in this democratic society? Mr. Speaker, I rise to acknowledge the points made by Angliston, the points made by Exuma about persons who are suffering. I'm aware, Mr. Speaker, as the Minister of Social Services responsible for the humanitarian arm of the government, I am fully aware. But what I find heartwarming is even when one member suggests that nothing is being done, there is another member who could suggest that so-and-so got some help. And so I didn't have to stand on a point of order. When one member could suggest that there is no food assistance, but another member stands and says, but food was being given through my headquarters. And so, constituency office. Mr. Speaker, the point I am making is that while this is far from a perfect situation, far from it, some progress is being made. And I could understand why some persons don't want to hear about the progress. Because if they acknowledge the progress, Mr. Speaker, it will suggest that their continued objection to the process will be deemed on the wrong side, Mr. Speaker. But Mr. Speaker, I want to say to the Bahamian people, Mr. Speaker, as Mr. Speaker, the good member from Pinewood would have said and suggested, Mr. Speaker, that these emergency powers is not a weapon against the Bahamian people, but rather a tool that will be ever available to assist and remediate whatever situation might arise. You know, Pinewood challenged someone to stand up and give certain assurances. And we heard crickets because they aren't able to give those assurances. Mr. Speaker, it costs about $270,000 to $300,000 for a new fire truck. But we don't buy fire trucks because we intend to burn down the city. We buy these fire trucks, Mr. Speaker, to have them available to use as a tool to help the citizenry if there is a fire, Mr. Speaker. As a CARICOM nation, we pay our CRIF insurance, not because we're hoping and praying that we will be hit by a hurricane, Mr. Speaker, but we pay that insurance in the event that there is such a calamity, that CRIF insurance could be used as a tool to help the Bahamian people. We stand up in this place and say, yes, there is insurance. This is the insurance for the government building, because we know there should be insurance for the government building, not because we intend to burn the government building down, but with the hope that if the building burned down, you got insurance. And so, Mr. Speaker, these are tools to help the Bahamian people. Mr. Speaker, these same powers got us from 180 something a day to 8, 9, 10 a day. These very same powers, Mr. Speaker. But ain't no plan. No, but there's no plan, Mr. Speaker. There is a suggestion that is just accidental. We stood up in this very same house, Mr. Speaker, and said that there is a plan A, B, C. If we get to this level, this will happen. If we get to that level, this would happen. We acknowledge the hurt. What we're asking you is to acknowledge what is being done towards it. Acknowledge what is being done towards it. And also acknowledge that while we may have the same objective of going to the same destination, we're not necessarily wrong because we didn't take the route that you think. We're not necessarily wrong because we have original ideas of our own. We're not undemocratic if we subscribe to the philosophy of majority rule, which resulted in our being here in the first place. And then we have a discussion and a debate and ideas are thrown around. And at the end of the day, there is a vote where the majority forms the decision. We're not undemocratic for that, Mr. Speaker. We are not undemocratic for that, Mr. Speaker. So I want to say to the Bahamian people, we talk about what is a fact. A fact is a proven truth. No one was able to stand here today and deny that the numbers have improved in the right direction. Some people suggest that it could have been done another way, and that may be so. But progress is being made. We're asking the Bahamian people to allow us to hold on to this tool that has worked thus far, and we want to assure the Bahamian people that this tool will only be used if it is necessary. But Bahamas, it is better to have it and not need to use it than to need to use it and not have it. The Southern Shores supports this, Mr. Speaker.
Thank you, honorable member. As many? As many? The chair recognizes the honorable member for Garden Hills.
Thank you, Mr. Speaker. Mr. Speaker, I'm just here to respond to a concern that was raised earlier, particularly by Pine Ridge and some other members, and only to remind the Bahamian people that the government and public money have expended and given to the Bahamian people nearly $90 million in income support during this pandemic. $90 million. My colleague, the Member of Parliament of the Southern Shores, spoke to food support of $30 million. That's aside from the fact that this nearly $90 million have gone to ordinary Bahamians, air braiders, barbers, taxi drivers, jet ski operators. The government recognized how important it is, Mr. Speaker, to provide some income support.
Just a moment. Chair recognizes the member for Pine Ridge on a point of order.
I don't know, but the member for Garden Hill indicated that he was responding to me. I said nothing about NIB, what it did or what it did not do. I did not speak about NIB giving $90 million to the Bahamian people. I had no objection to that. So, no,
Mr. Speaker.
The chair recognizes.
Don't go down that.
Garden Hill.
Mr. Speaker, my response was not related to NIB. The member for Pine Ridge indicated that the government did not care and did not support the people. And you didn't use the word care. You did not use the word.
That whole terminology is totally incorrect.
You said.
The whole basis of your contribution is on that.
Mr. Speaker.
The foundation of your contribution.
Mr. Speaker.
And the honorable member wasn't even in the house when I was presenting.
Yes, I was, Mr. Speaker. No, I was seated right there. I was seated right there, Mr. Speaker.
At no time.
Mr. Speaker. I was only advising on the amount of money that this government and has invested in individuals as a form of income support during these very tough times. During these very tough times, Mr. Speaker.
Honorable member. Honorable member for Pine Ridge.
I'm not talking to Pine Ridge.
The member for Garden Hills.
I said Pine Ridge and others.
Honorable member for Pine Ridge. Honorable member. The member for Garden Hills has the right to speak. And if he's presenting as but he has the right to speak. So what I'm saying to you is allow him to speak.
But I can't allow Mr. Speaker.
Honorable member, resume your seat.
Put words in my mouth.
The chair recognizes the honorable member for Garden Hills.
Thank you so much, Mr. Speaker. And I'm not here to put words in anybody's mouth.
Nothing about NIB.
And so, Mr. Speaker. And so, Mr. Speaker.
Honorable member for Pine Ridge, I'm giving you notice. You cannot continually interrupt the speaker, the person who's on the floor. by shouting across. It doesn't happen while I'm in the chair.
Mr. Speaker, I am so grateful that my colleague, a distinguished colleague of mine, because he is not joined the next party. He is a member of our caucus. Excuse me, Mr. Speaker, as a member of our caucus. Mr. Speaker, the distinguished member, the distinguished member and the MP for Pine Ridge earlier today when he was speaking, acknowledged that he was a part of this group. He acknowledged that, and I respect his position. He's a member of our caucus, and I'm happy. And I'm happy, Mr. Speaker. I'm happy, Mr. Speaker, that he has publicly said that he did not refer to any member, anyone, and he did not say that he has a disagreement or...
Honorable Member for Garden Mill, on the point of order. What is the point?
33, 7, and B. A member, page 27. To explain a material part of his speech which he claims has been misquoted or misunderstood, but shall not introduce a new matter or interrupt a member who is speaking and does not give way, nor may any debate. He is misquoting me. He's putting words in my mouth.
Honorable Member, you read that rule?
Give him the right rule.
Mr. Speaker.
Yeah, give him the right rule. That's the wrong. Well, that's the wrong rule.
Yes.
He's trying to clarify something here.
No, but you can't be putting words in my mouth. I said, Mr. Speaker, for him to make...
Honorable, the chair recognizes the honorable member for Garden Hill.
Mr. Speaker, the distinguished...
No.
Mr. Speaker. Mr. Speaker, I should have warned the member of parliament for Pine Ridge. I should have warned the member of parliament for Pine Ridge, Mr. Speaker, to take information from a man that I respect so highly, a young Bahamian. Hey, Mr. Speaker. Mr. Speaker, to take information from a man that I respect so highly. I'm proud of his achievement. I had a part in his life, and I will always respect him. So in the future, Pine Ridge, be careful what you take from us Exomians. We are together on all things. And so, Mr. Speaker, and so, Mr. Speaker, the fact that the member of Pine Ridge has acknowledged that we did give 90 million to assist and income support for the poor is a good thing. He is a part of that, Mr. Speaker, and I'm very proud because he's a member of our caucus. He's articulating very clearly that we are committed to the poor, that we have spent from the public funds, from the government side, $90 million of income support.
You're supposed to spend that, and more if you could.
And that's exactly why we've taken this business.
People heard and you have too.
What happened to the other 8? That's the point. Many people are hurting in this country. Well, I would just, Mr. Speaker, I don't want to respond anymore to Pine Ridge. We are providing income support for more than 30,000 Bahamians. We are providing income support for more than 30,000 Bahamians. And that is in addition to. Mr. Speaker.
Yeah. Honorable members, a lot of members forgot to conclude.
Thank you, Mr. Speaker. The $90 million of income support provided by this government to Bahamians does not include the millions of dollars that this government has provided in income support for Hurricane Dorian. Don't forget, Mr. Speaker, that the government has made a clearly determined position to extend income support for an additional 15 weeks to all those persons affected by Dorian in Grand Baham and Abaco. And so I agree with them. We are going through an unprecedented period. We are going through an unprecedented period. And because of that, Mr. Speaker, because he will never limit my time. And because of that, Mr. Speaker, I am extraordinarily proud that we as all Bahamians, whether you're a member of the opposition or this government, we saw the need to do this. We got the support. The members of Parliament all support this gesture to the Bahamian people because we know, Mr. Speaker, this is the right thing to do at this time. And so, Mr. Speaker, I am eternally grateful that I am able to stand here today and say to the Bahamian people that we are doing our best. We need your support. We need your patience. But we are very satisfied, Mr. Speaker, that what we are doing is the right thing. We're taking steps to save lives. And at the same time, we are providing support so that bread remains on the table of thousands of individuals, so that people can go to the grocery store. And my colleague mentioned something that's critical, and I looked through all of the Caribbean. You go to St. Lucia, Dominica, and the islands of the Caribbean, you will see that during this period, hundreds of individuals either had to take a salary loss or they lost their job. But we took the carefully considered position because in many cases, we fully understand that the breadwinner was that public officer. And we said that we would not reduce the salaries or terminate the position of any public officer during this period. And so, Mr. Speaker, with that, God knows rest.
Thank you, Honorable Member. As many, the chair recognizes Honorable Member for Bamboo Town.
Thank you, Mr. Speaker. Mr. Speaker, I rise to close this most important debate. And you know, Mr. Speaker, as I sat and listened, one of the things in this House, Mr. Speaker, we are all entitled to is our opinions. But, Mr. Speaker, one of the things that we are not entitled to are to seek to fudge in any which way is the fact. And, Mr. Speaker, I'm not casting any aspersions, but, Mr. Speaker, when the numbers over the past 2.5 months soaring. The government did not run away from the circumstances that was existing in the country. Mr. Speaker, we spoke to the Bahamian people and said that we had a very clear-cut plan as to how it is that we were going to see this administration breaking the back of the transmission that is taking place within our community. And now, Mr. Speaker, now that the numbers have been going in the direction that we so desire, the very tool that was used to prosecute this war that we seek to have, as the member for Southern Shores would have said, the insurance against circumstances becoming exacerbated again. There are those who are saying that they don't support it. I sat and listened very intently to the member for Exuma, Ragged Island, deputy leader of the opposition. And he said, in reference to the emergency powers and orders that were implemented in Exuma, and I'm sort of paraphrasing and intimating, he said, perhaps a direct quote from him, that we took a sledgehammer to deal with a mosquito. And he further intimated that perhaps we should have done a little bit more consultation with the people of Exuma. But I wonder if he did the same thing that he's asking of this administration. Because, you know, I have an article here, Mr. Speaker, dated November 17th from the Tribune Business section, written by one Mr. Yuri Kemp. And so let me say what the people of Exuma, the business persons of Exuma, that we were asked to speak to. Let's hear from the people of Exuma who live day to day in Exuma, whose businesses are in Exuma. November 17th, 2020. I shan't be long. I shan't be long. Mr. Yuri Kemp said Exuma businesses yesterday backed the government's decision to tighten COVID-19 restrictions on the island, with many saying they could see it coming due to the non-compliance with health protocols. That's the way it starts. There's some names. Caleb Rolls Sr., owner-operator of Rolls Air Conditioning, told Tribune Business, you know, I feel really good about him. Really, really good. Those are his words. Because the people just wasn't listening. He goes on to say, I feel the lockdown is excellent. Now you say we didn't consult and the people of Exuma had a different view. Speaking about these orders that we are here seeking to continue to hold in the arsenal of this administration to be able to deal with any potential future circumstances. Here's what the people of Exuma say. I feel the lockdown is excellent. The Prime Minister is doing a wonderful job. And as he's, you know, this is in a paper of record. I call the man's name. No, you just say somebody say. And Mr. Speaker, we gonna table this. We gonna table this document, eh? And he said, the Prime Minister is doing a wonderful job. And as hard as he is trying Everybody, listen, he said everybody wants to run the country. But we have already elected him and put him there. And we're going to let him run the country. That's Mr. Caleb Rowell Sr.
Read that again, man. Read that again.
You think I should read it again? In regards to the emergency powers instituted in Exuma, Mr. Caleb Rowell says, I feel the lockdown is excellent. The Prime Minister is doing a wonderful job. That's Mr. Rowell.
I know they say.
No, they say. He said.
Nobody else say. Call his name.
Ricardo Molly.
More people?
Owner operator of Shop Right Mart. Asked and added.
I know that store.
He says, business is ticking right along in Exuma. Everybody is orderly and shopping orderly, doing social distancing. There is no harm. Everybody is in tune in what is happening now. So they are adjusting pretty good. He said, really? I've seen this lockdown coming. I want to know whether Exuma spoke to somebody, okay? Because he said we didn't consult and we didn't know what was coming down the pike, so to speak. But the people seem to quite understand. Says, really, I had seen this lockdown coming. I knew we had a lot of problems with our fish fry. That's the gentleman from ShopRite. You got another two. Oh, okay. O'Brien Sullivan, owner operator of Strawn Service Station, says, it could be rough. But see, Exuma's man says it is needed as the cases continue to rise. My. Mr. Speaker, I could go on. But I'll just read the last one. Mr. Raymond Darble, General Manager of Darble Lumber, said, honestly, if the new restrictions just started on Thursday, and I too could have seen it coming. I guess the rhetorical question I would ask Exuma.
The chair recognizes the honorable member for the Exumas and Ragged Island on a point of order.
Earlier, when I spoke, I talked about consultation with the Chamber of Commerce and the business community. And the member for Bamboo Town may have intentionally not quote, may have unintentionally misled this House when he didn't quote the Chamber of Commerce, who said lockdown is the lazy way out. Lockdown is the lazy way out. November 13th.
You table that.
Nassau Guardian.
Okay.
November 13th. November 13th, Nassau Guardian. I'll be very happy to table it electronically.
You know, Mr. Speaker.
Was that endorsed by the membership?
Mr. Speaker, last time I checked, he quoted one, I quoted four. He quoted one, I quoted four. On top of that, we also have. So, Mr. Speaker, you know, I wonder if the member for Exuma is voting no. I wonder if he would have consulted, because it seems to me 1 to 4 is a clear majority. I wonder if he would have consulted his constituents in regards to him voting no. But nonetheless.
The chair recognizes.
It was a rhetorical question.
The chair recognizes the honorable member for the Exumas and Ragged Island
Guidance
on a point of order.
To the member who consistently misleads.
when I indicated to him that the president of the Chamber of Commerce, who speaks for all businesses, and he is an engineer, he understands what that means. Whether it's 1 or 4 you quoted, he speaks for the business community. And I quoted that he said, lockdown is the lazy way out. And he went on, he said some other things. I mean, let's not be trite about this. This is a serious issue.
Mr. Speaker, we're not being trite. And the member for Exuma says that the chamber is speaking for all businesses. I just called off 4 businesses. He can speak for these because these individuals are in print of offering a different opinion. So he couldn't speak for all.
I think he's a dictator.
He couldn't speak. You mean to tell me he's confirming what they're accusing my good Prime Minister of? Well, Mr. Speaker, I think we would have made the point, Mr. Speaker. I'm going to table this document. In addition, we also, it wasn't just 1 to 4. We also had the assistant, the deputy chief consular, Pat Smith, also with the lockdown. No, we ain't gonna put that one on you, Mr. Speaker, I just wanted to say to the people of Exuma who has demonstrated their discipline and have truly endured the curfews that this administration has instituted. I just want to say to them that the most honorable Prime Minister and the Minister of Works will be coming down, I believe, tomorrow, Prime Minister, to them. Will be coming down to personally meet with and to thank the people of Exuma for working through these curfews with us and helping us to bring down those COVID numbers within the island. Thank you. And likewise, Mr. Speaker, the Prime Minister and I next week we will be traveling to Eleuthera. As Foxhill said, Mr. Speaker, we showing them we care. And so, Mr. Speaker, the Prime Minister and I will be in Eleuthera. Also to thank the people of Eleuthera for their endurance of the COVID curfew protocol, which have resulted in the results that we would have seen. And Mr. Speaker, as I take my seat, I just wanted to say to the Bahamian people that they can look as to how it is that we've conducted the business of this country over the past 4 years. And I want them to have and understand and know that the confidence and hope that they have reposed in this administration, that as we have progressed through these 2 most challenging and most difficult events to have taken place within the modern Bahamas to any particular administration, that the seeds of hope that we have planted in the field of this nation, in the work that we have done, Mr. Speaker, are going to continue to bear fruit. And in this 2021, Mr. Speaker, I speak to the Bahamian people and this nation, and I say to them, as the Prophet Amos said, that your latter years will be greater than the former. I tell you, Mr. Speaker, that they can have confidence. Or the same playing with God, leader of the opposition. It is the fact. It is the fact that the hard work that we would have done, both in preparing this nation for the opening of our economy, will bear much. And with that, Mr. Speaker, I so move. The question be now.
Thank you, Honorable Member. Honorable Members, it has been moved and seconded that the following resolution be agreed. Whereas pursuant to Article 29, subsection 1 of the Constitution, the Governor General may make a proclamation of emergency declaring a state of emergency for the purpose of that article exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation of emergency made on the 24th day of November 2020 until the 31st day of January 2021. B, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Risk Management Regulations 2020 made on the 24th day of November 2020 until the 31st day of January 2021. C, affirms the continuance in effect of the Emergency Powers COVID-19 Risk Management Order 2020 made on the 24th day of November 2020 until the 31st day of January 2021. And D, affirms the continuance in effect of the Emergency Powers COVID-19 Pandemic Risk Management Special Provisions Order 2020 made on the 24th day of November 2020 until the 31st day of January 2021. As many members are in favor will remain seated. Those who oppose will stand. The resolution is agreed. Yes. Honorable member for Bamboo Town, the document that you indicated that you would table.
Yes, Mr. Speaker, I promised Mr. Speaker to table the article by Mr. Yuri Kemp, November 17th, 2020. I do not table the
Order that the document be brought up. Order that the document do lie on the table. Further resolutions?
Mr. Speaker, there are no further resolutions.
Appointment of select committees. Instructions to select committees. Oh, my apologies, members. Member statements. The chair recognizes the honorable member for the Exomas and Ragged Island.
I'll be extremely brief.
All of this you all have to say to do.
I'll be extremely brief, Mr. Speaker. I just want to thank the Honorable Minister of Works for inviting me to participate on his mission to Exoma tomorrow. I want him to know that, and the people of Exoma to know that I will be there. I'll be there waiting his arrival. I will get there before he does to make sure that we've appropriately paved the way for him. I want to thank him for his political maturity when he's going to a constituency of an opposition member, especially in the Family Island. I believe that's the honorable thing to do, and I want to assure him of my confidence. Thank you, thank you, Mr.
Thank you. The chair recognizes the honorable member for North Eleuthera.
Mr. Speaker, yesterday I had the privilege of conveying condolences to the former Speaker, Mr. Oswald Ingram, and I had forgotten about another great son of the soil, Mr. Fred Howard Neely, who's also from Eleuthera, particularly the Bog, North Eleuthera. Mr. Neely was very much like Mr. Ingram. He was not a politician, but his life was very similar in that he came from humble beginnings. He served on the Royal Bahamas Police Force as a speed cop. He also traveled back and forth to Eleuthera and established a lot of apartment buildings, and he was in various businesses. He raised an amazing family, of which there were doctors, nurses, and Mr. Fred Neely, I'm sorry, Mr. Fred Howard Neely was most certainly somebody who was well respected in the community. And it would be remiss of me not to pay condolences to him and his family for the for the tremendous contribution he made to the island of Eleuthera. So sadly, Eleuthera has lost two of its founding fathers during the same period. And so I said to the family, my condolences, and to that of the entire constituency of North Eleuthera. Thank you, Mr. Speaker.
Thank you, Honorable Member. The chair recognizes the Honorable Member for North Abaco.
Thank you, Mr. Speaker. I know the hour is late, so I'll speedily do this, but I thought it important to do. While sitting here, I got a message that we had lost Angela Cornish of Dundas Town, someone who grew up right next door to me in Dundas Town. I don't know the circumstances surrounding her death. She's married to my cousin from Blackwood. She was. Her family is Mother Merle. Everybody knows Mother Merle and Dundas Town, and Lenora Black, Dr. Lenora Black, and her sister Shirley. And I want to assure them of my condolences and the prayers and support of our family, because we are one family in Block 30, right there in Dundas Town. And so I thank you, Mr. Speaker.
Thank you, Honorable Member. The chair recognizes the Honorable Member for Carmichael.
I want to thank the Honorable Member for Exuma, for welcoming us to Exuma tomorrow. I want to just emphasize that we start tomorrow morning in Black Point. I'm looking forward to going to Lorraine's first thing in the morning. And then I'm going to visit Sister Payman Rule, who always welcomes me to her home. So I don't want anybody to beat me to my bread tomorrow morning. We're going to go from there. We're going to fly into Baritari. And we're looking forward to seeing you in Baritari, Exuma. And then we're going to inspect this plant, this asphalt plant. And I just want to say to the member for Exuma, I expect that plant is going to be in Exuma for a little while. So between you and South Andros, I know who your favorite Minister of Works is. So it ain't that fella next to you.
Chair recognizes the Honorable Member for Yamacraw.
Good evening, Mr. Speaker. On last week, I highlighted a situation that occurred and that was occurring for the past 2 years in Yamacraw, where there was some shooting. A lady's son was shot through the window, one on a bucket, a number of shootings in Yamacraw. And on last week, and on yesterday, I indicated that we intended to bring the nation's attention to this situation and to highlight to those individuals who are the perpetrators that if we find out any information, that we're going to give it to the police. And also that we intended to have a town hall meeting to highlight it. It will be carried live. Tomorrow, the community has banded together, and we're going to be having a town meeting. I'm delighted to say that Dr. David Allen will be leaving the Parliament. Mr. Solomon Cash, Deputy Assistant Commissioner of Police responsible for crime and criminal investigations, will be there. We will also have Reverend Ferguson, Dwight Ferguson, Mr. Lewis, a young activist from the community, will be there, and a young, brilliant attorney in the person of Ms. Hepburn. She will be there to present and give a lady's view. And so tomorrow we're going into the community exactly where those incidents occurred to have a discussion. I want to commend the Minister of National Security, the police, but most certainly the mothers of those children who were lost, the senseless shooting. One of whom said that she's going to be there, and a number of the other individuals who will be out. It will be carried live on ZNS, and it will be streamed live over Facebook. So we're inviting the entire community of Yamacraw, and by extension, this country, to partner with us, to bring attention to this and to say enough is enough. We are one, and Yamacraw is united in the fight to protect women, children, men, boys, and girls, and to secure their right to live in a peaceful environment. Thank you very much, Mr. Speaker.
Thank you, Honorable Member. Chair recognizes the Honorable Member for Foxville.
Mr. Speaker, I want to say to my favorite Minister of Work that the reflectors I want to report that the infrastructure work in Foxville continues, and that something that we've waited for some time, that the reflectors down the middle of Bernard Road are now in, and it's a joy, even if it's a dark night. The reflectors are such a great safety asset to us, and so we move on. And so I want to thank you very much for that. Our sidewalks are almost done, and I also thank you for Foxville Road South. As you know, Foxville Road begins at the bottom of Eastern Road, all the way to Hannah Road at the end. And so I'm happy that Foxville can be of assistance to St. Anne and to all of the constituencies that run north and south. And so, Minister of Works, thank you. The thing about infrastructural things, people say, well, it's things, but these are things that help the quality of life. And so we work hard to improve the quality of life in Foxville. Thank you very much.
Thank you, Honorable Member. Appointment of select committees. Instructions to select committees. Discharge of select committees. Notices for future meetings. Chair recognizes the Honorable Member for Mangrove Key, South and Central Andrews.
Thank you, Mr. Speaker. Just to advise chairs that all notices standing in the name of the opposition are renewed. Thank you.
Thank you, Honorable Member. Chair recognizes the Honorable Member for Southern Shores.
I rise to renew all notices in the name of the government, and to also give notice that we intend to move that the House adjourn to Wednesday, December 2nd, 2020.
Honorable members, it has been moved and seconded that the House adjourns to Wednesday, the 2nd of December at 10 a.m. As many as in favor will remain seated, those who oppose will stand. Final adjournment.
Mr. Speaker, I move that the House adjourns until 10 a.m. Wednesday, 2nd December, 2020.
Honorable members, it's been moved and seconded that the House adjourns to 10 a.m. Wednesday, the 2nd of December. As many members as are in favor will remain seated. Those who oppose will stand. The House stands adjourned to 10 a.m. Wednesday, the 2nd of December, 2020.
All right.